Tabling of documents. The Honourable Parliamentary Secretary.
Thank you, Mr. Speaker. Pursuant to Standing Order 36.8a, I have the honour to table in both official languages the government's responses to one petition. This return will be tabled in an electronic format. And while I'm on my feet, Mr. Speaker, I would move, seconded by the member from St. Catharines, that the House do now proceed to orders of the day.
Mr. Lamoureux, seconded by Mr. Biddle, moved that the House do now proceed to orders of the day. If a member participating in person wishes that the motion be carried or carried on division, or if a member of a recognized party participating in person wishes to request a recorded division, I would invite them to rise and indicate it to the chair. I therefore declare the Honourable Parliamentary Secretary.
On a recorded vote, Mr. Speaker.
Call in the members. La question est la suivante.
The question is the following one. Mr. Lamoura, seconded by Mr. Beaulieu, moves that the House do now proceed to orders of the day. The 10-minute period for members voting electronically has begun. The House will now proceed to the vote for members voting in person. All those in favor of the motion will please rise.
Mr. Holland.
Monsieur Duclos.
Monsieur Duclos.
Mr. Fraser.
Mr. Fraser.
Ms. Scrow.
Ms. Scrow.
Mr. Scarpaleggia.
Mr. Scarpaleggia.
Ms. Sahota.
Ms. Sahota.
Mr. Dollywall.
Mr. Dollywall.
Mr. Lamoureux.
Mr. Lamoureux.
Madame Fortier.
Madame Fortier.
Mr. Biddle.
Mr. Biddle.
Mr. Van Couverden.
Mr. Van Couverden.
Monsieur Cormier.
Monsieur Cormier.
Monsieur Elcoury.
Monsieur Elcoury.
Mr. Hardy.
Mr. Hardy.
Mr. Sidhu Brampton East.
Mr. Sidhu Brampton East.
Mr. Badaway.
Mr. Badaway.
Madame Koutrakis.
Madame Koutrakis.
Mr. MacDonald Avalon.
Mr. MacDonald Avalon.
Mr. McLeod.
Mr. McLeod.
Monsieur Robillard.
Monsieur Robillard.
Madame Shanahan.
Madame Shanahan.
Ms. Hepfner.
Ms. Hepner.
Ms. Yip.
Ms. Yip.
Mr. Pulowski.
Mr. Pulowski.
Mr. Van Bynen.
Mr. Van Bynen.
Mr. Ali.
Mr. Ali.
Mr. Koto.
Mr. Koto.
Mr. Hanley.
Mr. Hanley.
Mr. Julian.
Mr. Julian.
Mr. Johns.
Mr. Johns.
Ms. McPherson.
Ms. McPherson.
Ms. Barron.
Ms. Barron.
Mr. Garrison.
Mr. Garrison.
Mr. Cannings.
Mr. Cannings.
Mr. Angus.
Mr. Angus.
Okay, tous ceux
All those opposed to the motion will please rise.
Stand.
Mr. Bazan.
Mr. Kimmich.
Mr. Kimmich.
Monsieur Paulus.
Monsieur Paulus.
Ms. Landsman.
Ms. Landsman.
Mrs. Gray.
Mrs. Gray.
Mr. Ellis.
Mr. Ellis.
Mr. Kelly.
Mr. Kelly.
Mr. Baldinelli.
Mr. Baldinelli.
Mr. Cooper.
Mr. Cooper.
Mr. Davidson.
Mr. Davidson.
Mr. Duncan, Stormont Dundas, South Glengarry.
Mr. Duncan, Stormont Dundas, South Glengarry.
Monsieur Berthold.
Monsieur Berthold.
Mr. Workington.
Mr. Workington.
Ms. Finley.
Ms. Finley.
Mr. Abutayev.
Mr. Abultayev.
Mr. Viss.
Mr. Biss.
Mr. Aitchison.
Mr. Aitchison.
Mrs. Goodridge.
Mrs. Goodridge.
Mr. Patzer.
Mr. Potzer.
Mrs. Gallant.
Mrs. Gallant.
Mr. Van Popta.
Mr. Van Popta.
Mr. Steinley.
Mr. Steinley.
Mr. Lehoux.
Monsieur Lou.
Mr. Generou.
Mr. Generou.
Mr. Zimmer.
Mr. Zimmer.
Mr. Dreeshen.
Mr. Dreeshen.
Mr. Kitchen.
Mr. Kitchen.
Mrs. Wagenthal.
Mrs. Wagentall.
Mr. Allison.
Mr. Allison.
Mr. Nader.
Mr. Nader.
Mr. McGuire.
Mr. McGuire.
Mr. Reed.
Mr. Reed.
Mr. Shields.
Mr. Shields.
Mr. Falk Provencher.
Mr. Falk Provencher.
Mr. Motz.
Mr. Motz.
Mr. Arnold.
Mr. Arnold.
Mr. D'Entremont.
Monsieur d'Entremont.
Mr. Dalton.
Mr. Dalton.
Mr. Vierson.
Mr. Vierson.
Mr. Leipert.
Mr. Leipert.
Mr. Canna.
Mr. Canna.
Madame de Bellefeuille.
Madame de Bellefeuille.
Madame Michaud.
Madame Michaud.
Monsieur Fortin.
Monsieur Fortin.
Monsieur Brunel-Duceppe.
Monsieur Brunel-Duceppe.
Monsieur Savard-Tremblay.
Monsieur Savard-Tremblay.
Madame Chabot.
Madame Chabot.
Monsieur Trudel.
Monsieur Trudel.
La Chambre est en
The House will now await the results of the electronic vote before continuing its proceedings.
I wish to inform the House that the electronic voting period has ended, and if members were not able to vote due to technical difficulties, they may now use the raise hand function and the chair will recognize them. We'll start in the House. The honourable member from Kingston and the Islands.
Thank you, Mr. Speaker. I had technical difficulties, but I am voting in favour, please.
Mr. Gerritsen, yay, pour.
Mrs. Gladue.
Thank you, Chair. I used the app to vote, and they asked me to confirm that my vote was recorded as nay.
Was indeed recorded as nay. Mrs. Rempel-Garner.
I vote no.
Ms. Rempel-Garner, nay, contre.
The table will now compile the vote.
Yeas pour 175, 175. Nays contre 143, 143.
I declare the motion carried. Orders of the day.
Government orders, government bills, commons, beginning debate at second reading of Bill C-64, an act respecting pharmacare.
Mr. Holland, seconded by Mr. Fraser, moves that Bill C-64, an act respecting pharmacare, be now read a second time and referred to the Standing Committee on Health. Debate. The Honourable Minister of Health.
Thank you very much, Mr. Speaker. It's my pleasure to rise. And I want to start, if I could, Mr. Speaker, by extending gratitude to the member for Vancouver Kingsway for his extraordinary work through this process. It was a long, hard discussion to find a place of meeting. But it's an example of what's possible when we in this chamber focus on getting things done, focus on working together rather than focusing on what divides us. I think sometimes we fundamentally misunderstand the purpose of democracy. The purpose of democracy is to build consensus. It's to find points of commonality and pull people together to find common ground. It is not to find differences or sow division. Oh, I apologize. I thought there was something in my speech, Mr. Speaker, that had offended you in some way. But thank you. Give it time, indeed. Yes, I'm sure I can get there. Madam Speaker, it's a pleasure to see you in the chair. I also want to thank so many and some of them I'll reference, are phenomenal colleagues on our side who've dedicated in some cases decades to fighting for this moment, to fight for the moment when people aren't forced to make a choice between the medication that they need to stay healthy or the essential goods and services they need to stay alive, whether it be their rent or their food. You know, when we launched in the 1960s National Medicare, we forget how challenging that was. That was an incredibly turbulent period to actualize that and bring it to reality. The dream had long existed, but to bring it to bear was extraordinarily difficult. And at that moment in time, there were certain things left out, one of which was medicine. And partially because at that point in time, the number of medications that were available were very limited. They were typically prescribed in a hospital setting, and that they didn't have their use and ability and weren't as essential as they are today. But certainly that dynamic has changed. And this means, Madam Speaker, a new dawn for health. I would say that I'm going to talk specifically about pharmacare and the legislation therein, but I want to, before I do that, just paint a broader picture of the circumstance that faced this. Like all countries everywhere in the world, the vast complexity of our health systems was overwhelming. And we're driving down a highway at 100 kilometers an hour, recognizing that we can't slow down and we have to change the engine while we're driving. And because of that difficulty, most health systems hadn't done the hard work of transformation and the really stepping back and looking upstream and how we deal with prevention and how we deal with reducing the amount of chronic disease and illness that exists within our system. And then the pandemic hit. And in the pandemic, everywhere in the world, the strains and cracks in our health system were laid bare. Healthcare workers were asked to carry a burden that was impossibly large, working night and day to try to keep their communities safe, carrying a load beyond imagining. But in that moment, here in Canada and in a few places elsewhere in the world, we saw something I think quite remarkable happening. And that was, in that chaos, there was one purpose in our system. what doctors and nurses and personal support care workers showed us is the possibility of what happens when we move with one purpose, with one direction, and we focus on people's health and nothing else. We set aside egos and jurisdiction and turf and make things happen. So in an incredibly brief period of time, Canada's pandemic response was indeed one of the best in the world, with one of the lowest death rates anywhere in the world. We had unbelievable support for the people that were working within the system and for one another for that period of time. And then challenges resumed. The pandemic began to recede. A war erupted in Europe. Global financial turmoil ensued. And we forgot the lessons of the fruits of cooperation and working together. And many of those divisions returned. And within our health system, we saw that there were a workforce who had carried far too much, who was dealing with burnout and yet still had the extraordinary weight of a system that needs to change. And you saw for the population that health was a bit of a hot plate, that people's experience of the pandemic, it was a trauma really for everybody. It was especially so for healthcare workers, but nobody was saved from the traumatic experience of going through the pandemic. But I would say, Madam Speaker, it's the responsibility not just of this government, but of every government in this country to remember the incredible heroism of those who are working in the health workforce during those dark hours of the pandemic, to, with the same spirit of cooperation and determination, not focus on what divides us and what makes us different, but focus on what can be done. And that is no more important in any area than in health. I would say, Madam Speaker, that Canadians don't much care what political party you're from. They don't much care what jurisdiction it is. They want to see results. And that's why the $200 billion that we put forward to invest over the next 10 years in healthcare was so critical. Because it required an agreement with every single province and every single territory to develop a plan to deal with the crisis of today, to tackle those issues that are within our health system around workforce, around backlog, around health data, around sharing of patient information, and dealing with issues like administrative backlog and things that are legacies that don't make sense, to work with every province and territory regardless of their stripe. And I could say whether or not it's Adriana Lagrange in Alberta, or it's Adrian Dix in BC, or it's Michelle Thompson in Nova Scotia, or it's Bruce Fitch in New Brunswick, and you can go on, that in every instance, that spirit of cooperation pervaded our negotiations. That there was a profound understanding in those conversations that we have to be bigger than our partisanship and find commonality. And as a result, we have extraordinary agreements signed with all the provinces and territories in a short period of time to lay out the next number of years and what that health transformation looks like. That spirit of cooperation was also seen in Charlottetown, where in Charlottetown we were able to have an agreement on a couple of things that are really essential, Madam Speaker, on health data, on looking towards interoperability and how our systems work together with the digital charter, on reducing wait times for recognition of foreign credentials, taking it down to a 90-day service standard. We also were able to work later with the College of Physicians and Surgeons to take a process of credential recognition that's normally a couple of years and get that down to a couple of months. The other thing that these agreements did and these conversations that I think are critically important for the future of our health system is to establish common indicators, meaning that every province will have the same indicators for their health system, so that whether or not you're in Quebec and you're a Quebecer, or whether or not you're in Manitoba and you're a Manitoban, you can see how your health system is faring, not in anecdote, but in data, and you compare that against other provinces. Making sure that those indicators are there are essential, because it's so important that people feel that positive change and experience it in outcomes, but that it's also measurable in data. And in our federation, as we're making changes and interventions, that ability to have data and see how we're moving the needle is essential. What you measure, you achieve. And for the first time in these health agreements, we've set these essential tools of measurement to be a key component of our health system. Madam Speaker, we can then turn to dental care. And there are some who say, well, this is just a boutique intervention, something that's a one-off, but it's actually part of a broader vision of health. Imagine in this country there are 9 million people today who don't have access to dental care. And I want to thank my predecessor, Jean-Yves Duclos, for his extraordinary work. Sorry, yes, I know better than that. I want to thank the former Minister of Health and now the Minister of Procurement for his extraordinary work to get us to this point in dental care. I want to thank the NDP and the member from Vancouver Kingsway for their work to work with our caucus and Common Purpose to make sure that we pull over health. I want to thank parliamentary cooperation. And I would say to this place that this is what we were intended to do. That when we are elected as members of parliament, we are not here to shout things at each other, to belittle each other, to put each other down. We're here to listen to each other. That the purpose of debate is to ensure that we take each other's ideas and that we find common ground. And in this bill, in pharmacare and in dental care, we are embodying exactly what I believe our constituents elected us to do, which is to say that right now we have 1.8 million seniors. These are seniors in many cases who have never had access to oral health care in their life. I talked to a denturist that had a senior that hasn't had a new pair of dentures for 50 years. They lost their dentures, Madam Speaker, and they had no money to replace them. And the denturist saying that the dignity, the way that senior felt, knowing that they were going to get new teeth in their mouth and that they could go out in the world and feel that somebody cared about them. The extraordinary nature of that. And when you go into seniors' homes and you talk to people working with seniors, and they say, is this really going to happen? And they talk about the dignity that comes. You know, it's not just about that healthy smile. It's not just about the fact that they're not going to wind up in an emergency room for an avoidable procedure. It's about the dignity of saying, we care about you. We see you. Your health matters. We have one of the most extraordinary healthcare systems in the world, but it cannot be the best healthcare system in the world unless oral health is part of the equation. Because when we don't take care of oral health, when we are not there for oral health, then the costs, not just in terms of social justice, but in terms of health outcomes, are entirely unacceptable. And I would submit that that's not the country we want to live in. I'm also extraordinarily proud, Madam Speaker, about 2 weeks ago, the Minister for Families, so many of us were there to launch the National Food Program. This is something when I was at Heart and Stroke I was advocating for fiercely, knowing that when a child goes to school hungry, it's impossible to learn. That when a child is denied nutrition, it has devastating effects on their health. And it's so sad to say that the research shows us just one healthy meal a day has a dramatic change on health outcomes for children. Just one healthy meal a day. And the other thing that it does is it gives kids a taste for what nutritious food is. They develop their palate. So for their whole life, nutrition and their nutritional profile has changed. That is an essential part of being upstream and avoiding illness and sickness. Dental care, a national food program, and yes, Madam Speaker, action on pharmacare. Now, this is a big task. We know that some 21% of Canadians are struggling to be able to meet the financial burden of being able to afford their medicines. So we took essential actions on bulk purchasing, reducing the cost of medicine in this country by hundreds of millions of dollars by working with provinces and territories to do bulk purchasing. We're taking critical action in PEI with a plan for islanders on a pilot basis to improve affordable access to prescription drugs. And since June 1st of 2023, we've been able to reduce copays to $5 for almost 60% of medications regularly used by islanders. PEI residents have saved more than $2 million in out-of-pocket costs. So this was a precursor to show us what could happen. And when you go to PEI, and whether or not it's the member for Malpeque or who I know talks a lot about this or others, that when you hear the difference that that's making in the lives of people, to have medication taken off the table is a concern, it's absolutely huge. We also are launching we launched in March of 2023 a national strategy for drugs for rare diseases with an investment of $1.5 billion over 3 years. Because we know that, drugs for rare diseases can be cripplingly expensive and yet absolutely vital to keep people alive. And I think, I'll just give one quick story before I talk about the bill that's in front of us and the action that we're taking here. I had an opportunity on the weekend, a few weekends ago, to be away with my partner in the United States. And we watched somebody in front of us collapse. This person obviously was not a person of means. And as they came to, and I called 911, the thing that person was worried about wasn't their health. It was how much money were they going to have to spend. How much money did me calling 911 burden that person with? Can you imagine that we don't want to be in a place with any element of health care where somebody who is of limited financial means, through no fault of their own, is in a circumstance where they can't afford their care? Where a nurse who's on the front lines of taking care of patients and investing their entire life in trying to make things better isn't given the opportunity to get proper health care themselves. So why these drugs? Why did we start with diabetes medication and with universal contraceptives? Let me start with diabetes medication, and I want to thank the fantastic advocacy for the member for Brampton South on diabetes specifically. There are 3.7 million Canadians, and it's growing, who have diabetes. When I had a conversation with 12-year-old Raina, she summed it up in Ottawa, I think, better than anybody else. She goes, as a 12-year-old, it's really hard in this world. No 12-year-old should have to worry about all the problems of the world and also how they're going to afford their medication. And I think if 12-year-old Raina can get it, then this house can get it. When somebody doesn't have access to their diabetes medication, it means that they risk heart attack, stroke, kidney failure, blindness, amputation. I was talking to Sarah in a diabetes clinic who told me about patients who are reusing syringes because they can't afford them. The risk of blood-borne disease is terrible. That's not the country we should live in. So we all need to rise to this moment to say that medication as a precursor disease, when diabetes is so indicative of whether or not you have future chronic disease and illness, it's so essential that we make sure that we're there for them. On contraceptives, Madam Speaker, let me just give you one example that I think illustrates the case. Oral contraceptives cost $25 a month, and they have a 9% failure rate. The IUD costs about $500. It lasts 5 years, and its failure rate is 0.2%. So what it means is for somebody who doesn't have money, they end up choosing either the birth control option that is cheaper, that has a 9% fail rate, which means they're more likely to wind up with an unwanted pregnancy or with a sexually transmitted disease. If they're not able to make the choices that have autonomy over their own body and their reproductive health and future. And so it's absolutely essential, not only for health, because for example, in British Columbia, they've demonstrated with UBC, they're saving more money with this initiative than it costs them to run it out. And that's similar, I think, to what we're going to see in diabetes. This has such a powerful effect in prevention that it actually reduced costs overall. But I think that the message it sends to women about their bodies and about their sexual and reproductive rights and autonomy is essential, which is in this country, no matter where you are as a woman, that you will get what you need to have control over your future and your body. That's a powerful statement, and it goes beyond just contraceptives as a drug. I can tell you that as a very young person, when I was very, very young, I was exposed to sexual violence. And I can tell you that that experience in a family that didn't talk about sex and didn't have a conversation about what healthy sexual relationships were had a devastating impact on my life, my self-esteem, and my ability to stand up for myself at different moments in my life. And I can tell you that for somebody who doesn't have the information about their sexual health, isn't told that sex would never have anything to do with violence, that violence is about control, that sex is about connection, that sex should always be consensual, that it should never be exploitive, that it should never involve violence, it should always involve what you want for your body, it should be pleasurable, and it should make you feel like you. And the fact that as a health minister, it's in any way controversial for me to be able to say those things, to be able to say to people, because whether or not you're in a marriage or you are intersecting for the first time with somebody sexually, understanding that it's okay to be you, that as long as it conforms to those things, that sex should be pleasurable and that you should feel empowered in your body and that you should have access to the reproductive medicines that you need to make choices about your life, it's going to save lives. Because I can tell you right now that the second leading cause of death for young people is suicide. We lose about 500 kids every single year. And way too often that has to do with them not feeling comfortable in their own bodies. And we have to end that. Madam Speaker, in totality, looking at all of these actions is a new dawn for health. Going up, dealing with the crisis of now, but looking at prevention so that we can build on what we started in the 1960s and ensure that all Canadians have access to the greatest healthcare system in the world. Thank you.
Questions and comments. The Honourable Member for Cumberland Colchester.
Thank you very much, Madam Speaker, and interesting comments by the Minister of Health. Certainly he talked about the incredible results that he thinks he's getting with these new programs. Oddly enough, the backlogs for care in Canada have never been worse. 27 and a half weeks from time of seeing a primary care provider to getting treatment from a specialist, the worst in 30 years that they've ever been. His Canada Dental Care program, he wants to talk about how many people have signed up for it. And we know very clearly, and perhaps the question is really that the minister would like to ask, although we know he'll go on with his fantastical speech that he's had here in his incredibly fact-devoid fantasy. But that being said, the question would remain for his great dental care program is how many dentists have actually signed up for the program? And very specifically, Minister, if I could, through you, Chair, how many dentists in Atlantic Canada, specifically, Chair, how many in each provinces, Nova Scotia, New Brunswick, Newfoundland, and PEI have signed up for the dental care program?
The Honourable Minister of Health.
Well, Madam Speaker, it was true in the 1960s, and it's true now, that there are purveyors of doom. There are those who try to push people to despair, because when you don't believe in a public health care system, what do you want people to do? You want people to despair, because nothing comes from despair. All change comes from looking at what's hard and true and driving for change. So let's talk very specifically. Every healthcare system in the world is facing extraordinary backlogs as a result of COVID and stress on their systems. It's a question of how we meet that. And these 13 agreements and these investments of $200 billion are demonstrating that we are meeting that challenge. And in these plans, in articulated detail, is exactly how we're going to get to the health system that Canadians deserve. And with respect to dental care, we have thousands and thousands of dentists who signed up across the country, Madam Speaker. And secondly, just on Thursday, I met with the dental associations, and I can tell you that we're down to a couple of minor issues, and that I'm extraordinarily confident that over the next number of months, we will see virtually every dental office in the country participating in this program. And I know that the member opposite doesn't want that, but that's what's coming.
Questions et commentaires, l'honorable député de Montcalm.
The Honourable Member for Montcalm. Thank you, Madam Speaker. The Minister spoke about many things, but did not speak much about C-64. Now, when we raise Quebec's interests, he says that the Bloc Québécois is just looking to pick a fight. But we have had our own version of pharmacare for a long time. But the minister did not sit down with Quebec to see how this bill will affect them and how they will work together. Does the minister know how many drugs are covered by Quebec's pharmacare system? The health minister said that we have constitutional rights, but he says that we're looking to pick a fight. Are we looking to pick a constitutional fight then? We, the Bloc, seem to respect the Canadian Constitution more than he does, although his party did everything to ensure that we didn't sign in 1942. So how will this work with Quebec? The Honourable Health Minister. Thank you, Madam Speaker. When it comes to Quebecers, we want to help them as much as we will help all other Canadians. We want everyone in Canada to have access to a strong healthcare system that works for everyone. The same goes for pharmacare. I had a great conversation, many conversations in fact, with Minister Dubé, the Quebec minister. We are working together. Now, it's easy to pick a fight and raise problems, but the goal is to find solutions and ways to work together in order to fix the situation, to improve the health of Canadians. One example is indicators. For Quebecers and Canadians, that is essential. It is essential to be able to follow and track provinces' progress and to be able to compare and follow. It's also important to be able to follow federal money within the plan. That's why it's incredibly important to work together rather than to squabble.
Very much, Madam Speaker, and I'd like to congratulate the Minister for working attentively with the NDP effective opposition to actually bring about this historic debate today. This is going to make a difference on average, and I point to the Conservatives, to 18,000 of their constituents in each of the Conservative ridings across the country. Now, Madam Speaker, I wanted to reference one of my constituents in Burnaby, BC, resident Amber Malotte. She learned that she had diabetes when she fell into a coma just before her 21st birthday. With all of the types of insulin and injections that she takes, her monthly bill on insulin because of her diabetes is close to $900. Now, Madam Speaker, we saw last week the disgraceful exhibit of the Conservatives blocking even bringing this bill forward to the House. They blocked it from the kind of debate that we need to have on this bill. And Conservatives have indicated they would like to destroy this initiative. I wanted to ask my colleague, the Minister of Health, what would be the impact on people like Amber if the Conservatives had their way?
The Honourable Minister of Health.
Well, thank you very much, Madam Speaker, and I want to thank the Honourable House Leader, and now very pleased to work with him again as in his role as a critic for health, to say that he's absolutely right. First of all, that I appreciate that these were not always easy conversations, and they were indicative of the conversations when we were both House Leader, where finding that common ground as two different parties is often difficult. But I think that for people like Amber, you can see exactly what the difference is. And the cost and consequence for Amber of not being able to have access to the life-changing medication that Amber needs, let's be very direct, could be devastating. It could mean that Amber winds up with a heart attack or stroke. It could mean that Amber has a limb amputated or that Amber dies. It certainly means that Amber's less productive, less able to contribute to society, and certainly is going to have almost definitely an earlier death. So the cost of not providing that medication is far superseded by those negative outcomes, not just as a matter of social justice, but as a matter of material cost. And I would say to the Conservatives, are they going to be there for Amber? Are they going to be there for people who need their diabetes medication? Are they going to vote for their constituents who need these medication, or are they going to vote against it?
The Honourable Member for Don Valley East.
Thank you very much, Madam Speaker, and I want to thank the Minister for his speech. I'm proud to be part of a government that is bringing forward new national programs like childcare, student nutrition, dental plan, and of course, pharmacare. You know, it's been decades since a government in this country has moved forward with such massive programs. In fact, we haven't seen this type of movement for many, many decades. So I'd like to ask the Minister, the relationship with the provinces and territories, as you move forward, what has been the response by some of the key people, ministers and other stakeholders in other provinces for this specific plan?
The honourable member to speak through me, please. The Honourable Minister of Health.
Thank you, Madam Speaker, and I thank the member and my friend for an important question. I think that I've been so encouraged by the conversations that I'm having with every provincial health minister across the country, regardless of their stripe, whether or not I'm talking to Everett Hindley in Saskatchewan or I'm talking to Zoma in Manitoba, that the conversations have been incredibly productive and positive, focused on how do we get people the care that they need. And I think, I would really challenge the Conservative opposition. Instead of talking about how they want to destroy dental and how they don't want pharmacare there and how they're going to block a national food program and tell people the reason they can't, don't dream. You can't have it. Don't dream that you could get medication. Don't dream that you could have dental care. We're going to make sure that it doesn't work. We're going to call dentists and scare them. We're going to give them false information. We're going to work against people getting care, and that for political reasons. And I think that we should listen very carefully to what they say. Are they asking questions about how they can help? About how they can ensure that people get dental care? Are they asking questions about what are the problems that dentists have? And how can we help fix them? Because we want to make sure people get dental care. No, Madam Speaker. They're saying give up, have despair, they can't do it, and shame on them for it.
Resuming debate, the Honourable Member for Cumberland Colchester.
Well, thank you very much, Madam Speaker. And hopefully today we'll now move into reality as opposed to the fantasy land that was painted here by the Minister of Health. When you look at it, this program of pharmacare that's trying to be introduced is really about preservation of the costly coalition. And we also know that Canadians are not going to be fooled by the foolishness that's been presented here in the House this morning. And we know that the other plan that they have is to clearly extend the date of an election so that they can access their pensions, which really is the worst state of trying to be a politician that one could possibly imagine is being self-serving, when we know that all of us who should be coming to this House should be here for the benefit of Canadians. And we know that that is clearly not the case, Madam Speaker, with the costly coalition and the preservation, which they've made very, very clear throughout Canada that this is an essential part of the ability to maintain this inept government in power for as long as it has. So that's the first part that Canadians, of course, are well aware of. The other thing that Canadians are well aware of is the state of coverage with respect to pharmacare. Avec mes collègues de Bloc, c'est...
With the Bloc colleagues, it's quite clear that this is a provincial jurisdiction when it comes to pharmacare.
0.2% of Canadians are already eligible for some form of prescription drug coverage. And that, of course, is not some funny conservative talking point. That comes from Stats Canada, CIHI, CLHIA, the Conference Board of Canada. So when you look at the numbers, Madam Speaker, it becomes very simple to understand that there is a gap of about 1.1 million Canadians who do struggle with coverage from pharmacare. And I think it's important, Madam Speaker, to point that out because this is an honest conversation that we are attempting to have here. We also know that the numbers of uninsured have decreased precipitously since, for instance, the Ontario government has gone on and introduced OHIP Plus. It's also interesting that the minister went on and talked a tiny bit about his historic meetings with all the provincial ministers of health, which, Madam Speaker, I have chosen to undertake myself. And when I have done those, what those provincial ministers of health have made clear is not the rubbish that the federal minister has brought forward, but what they have made clear is that they in no way, shape, or form want another large federal program dropped on their heads to fund in which, as I said in French, is clearly a provincial area of responsibility, which is the delivery of health care, which oddly enough, Madam Speaker, the federal Minister of Health has pointed out himself that the delivery of health care is a provincial responsibility and not one of the federal government. In spite of the fact that this minister continues to want to intervene with respect to moving things from that provincial authority and responsibility into the federal government. I did have an opportunity to mention a little bit about this bill, and I would like to expand upon that, that what this bill does is it's creating another government agency. Exactly what Canadians would like to have is more bureaucracy, more gatekeeping. It's going to create the Canadian Drug Agency, which will cost about $90 million to create, and perhaps another $30 or $35 million a year. But again, who worries about monetary policy? Certainly not the NDP Liberal coalition, to continue to allow that agency, that new agency, to exist as time goes on. It's odd also, Madam Speaker, that the government has posted on its Canada.ca website a list of drugs, diabetic drugs and contraceptives, which in no way, shape or form may or may not represent what is actually on the formulary in the future, because we know that it will be the responsibility of the Canadian Drug Agency, with consultations with provinces and other stakeholders to then create a formulary which could be used. I think it's also important that if we were to have any faith whatsoever, which quite personally I don't, in the formulary that has been put out thus far, much to the chagrin of Canadians, that it's rife with older medications, and there's no fees there for pharmacists, and there's no fees on that list to look at the primary care which is provided by pharmacists to many, many Canadians, with the sad reduction in the number of family physicians. I think it also worth noting very specifically, Madam Speaker, that the blockbuster drug in terms of treatment of diabetes in a generation, namely Ozempic, is not included. No surprise. As I was saying, after the creation of the Canadian Drug Agency and a formulary and these consultations, the only consultations that have happened thus far, of course, are with the NDP costly coalition partners, which should not give Canadians any warmness in their heart. When we look at the other issues that are clearly brewing in Canada at the current time, Canadians know that the state of our beloved healthcare system has been under siege by the inept management of the NDP Liberal coalition. We know that wait times have surged beyond what they have ever been in history. For instance, the wait time from seeing a family physician to a specialist to obtaining a specialist-based treatment has increased by 195%, 27 weeks wait time. We know that this is the highest it has been in 3 decades, 30 years. Is this a system that Canadians should be proud of? The other disturbing statistic is that 6.5 million Canadians are without access to primary care. As time will march forward, as it always does, by 2030, in Ontario alone, there will be 2.3 million Ontarians at the current time without access, surging to 4 million Ontarians without access to primary care. Madam Speaker, it's very clear, even if this were a good pharmacare plan, which it clearly is not, without access to primary care, there's really no way to get your medications. And I would suggest that there is a bit of misguided nature here. I think the other difficulty that Canadians also are very aware of is that the newest medications, a class of medications called biologics, which account for 2% of claims, are now accounting for 30% of spending. Of course, Madam Speaker, none of these biologics are included on any of the proposed Fantasyland formularies by this NDP Liberal coalition. The other problem we have in our healthcare system is wait times from application for approval of medications to be on formulary to the actual acceptance on 50% of public formularies. And we have the longest wait times in the world, 25 months for new life-saving therapies. So in a government that should be seized by policy changes to improve the lack of bureaucratic control and the ability to change things that would be cost effective for Canadians, and indeed changes like this to make a government work more efficiently would actually not cost the government anything. It would cost Canadians nothing. And what is this government doing? Again, as I said previously, they are interfering with clear provincial jurisdiction and adding federated programs that in no way, shape, or form could possibly reduce the cost for medications. The other reason, of course, Madam Speaker, is that the cost of these medications are already in a forum which allows all of the public plans to come together under a program called the PCPA, which allows all public plans to negotiate for low prices for those medications already. So for the Federal Minister of Health to suggest that this new plan will suddenly allow prices to drop precipitously is absolutely and categorically untrue. The other major issue, of course, is related to finances and cost of living, Madam Speaker. When Canadians were asked what is the major cause of their inability to afford their medications, I suspect my colleagues know very well what the answer to that question is, and the answer is inflation. Yes, Madam Speaker, inflation is cited as the major cause of Canadians' inability to afford their prescription medications. So why do we have 40-year high inflation? Well, of course, it's with the costly coalition of the NDP and Liberals. We know that the chance of a young Canadian now owning their own home is almost zero. It is a dream that is almost dead because of the NDP Liberal coalition incompetence. We also know that more than ever, Canadians are turning to food banks to enable themselves to feed their families. 2 million Canadians a month, sadly, very sadly, are having to go to food banks. And what do we see? We see more large federal government spending in what David Dodge called last evening perhaps the worst budget announcement in the history of this country. And what are we doing today? We're waiting for more of these terrible budget announcements today, in which we will see another $40 billion estimated of deficit spending. On top of that, Madam Speaker, we know that the $1.2 trillion debt that this NDP Liberal coalition has coffered together, of course, more than all governments, Canadian governments combined in history, is costing now more to service that debt than we are spending on health care, which is an incredibly sad state of affairs. And certainly I would suggest that it's one that Canadians are taking very close and paying very close attention to. We also know that simply saving for the down payment on a mortgage is now taking 25 years, when the Canadian dream would be those 25 years would allow us to pay for a mortgage, not to save simply for the down payment. Madam Speaker, Canadians are suffering more and more with their mental health. And we know also that this Liberal government had committed $4.5 billion to the Canada Mental Health Transfer. And Madam Speaker, not one penny of that has been transferred. A very, very sad state of affairs, when 1/4 to 1/3 of all Canadians are currently suffering with mental health issues, and they believe that 50% of them are suffering with inadequate treatment. Madam Speaker, $4.5 billion could go a long way to help treat the mental health care of Canadians. This NDP Liberal coalition has had a multitude of failures, and I think they're worth pointing out simply because of the fact that why would Canadians believe that another large federal program will ever come to fruition? What we know is that these programs are great announcements. I think the next Prime Minister of Canada has spoken about that you can't eat these papers that the announcements are printed on, and they're incredible photo ops for ministers to go out and say that they might be capable of doing things when Canadians know that they are absolutely unable to do so. Sadly, Madam Speaker, I'd asked a question of the Minister of Health which he once again failed to provide an answer to. But now I'm quite happy to provide that answer, that the Canadian Dental Care Program, last week I had the opportunity to speak to every dental association in this country, save for the Yukon, simply because of time. But that being said, here's a sample of the number of dentists who have signed up for this widely touted program. In my home province of Nova Scotia, 4. Madam Speaker, wow. 4. Not 400, not 14. 4. Wow. 1, 2, 3, 4 dentists out of 400 have signed up for this program. Shameful. In Prince Edward Island, Madam Speaker, it's even easier. 0. There's no debating 0. None. Zilch. Nitch. Zada. Nada. In New Brunswick, once again, to be clear, 4, 1, 2, 3, 4 out of 370 dentists have signed up. The most we were able to find was speaking with the British Columbia Dental Association was 400 out of 4,000. Still a mere 10% of dentists. This is a program that has been created without any consultation with respect to dentists and has been creating an incredible administrative burden on dentists and has also created a conflict where dentists have to sign a contract with a provider, namely the federal government, as opposed to having a relationship with the patient, which is how healthcare has historically and always been delivered in this country. So dentists will continue to ask questions about this program, and certainly why would they sign up for a program when they have distrust of this NDP Liberal coalition. Let's talk a bit about affordable housing, which was another failure, which was promised by this government in 2015. They will have to build 9.6 million homes over the next 10 years. And we know also that they are now building less than this country was building 50, not 15, 50 years ago. Less houses being built now because of the terrible policies of the NDP Liberal coalition. We also know that this Prime Minister sat here in this House of Commons and promised 7,500 new doctors, nurses, and nurse practitioners. And as I mentioned previously, 6.5 million Canadians now do not have access to primary care. 6.5 million. And we also know that this government continues to spend money that could be easily used to generate these spots for Canadians on their consultants, of which they are quite happy to line the pockets of their friends. They also said they would reduce Canada's federal debt to GDP ratio every year, which sadly we know has not happened. We know that they can barely even deliver passports, Madam Speaker, which is actually one thing that is in the purview of the federal government, which they're now announcing things that certainly delve into provincial jurisdiction, and they can't do things that they should be able to do, which are simply the purview of the federal government. So as we begin to look at these things, we know that this NDP Liberal coalition is an abject failure. Now, people will often say, you know, you've got a lot of negative things to say. Why don't you give Canadians hope? Well, Madam Speaker, let's focus on that for a few minutes. I'm not sure, Madam Speaker, how much more time I have, so I'll focus on it for a bit. But it's the Blue Seal program, which we have announced here as Canada's Conservatives, which will allow those who have trained internationally to quickly and safely have their credentials recognized here in Canada. And that is a program. Why has that been created? Because as we go around this country, what we hear from new Canadians who have trained in other countries is that now they are driving taxi cabs. Madam Speaker, I heard a story from one trained physician who's not allowed to work in this country, that he was very sad because his young child asked him, "Dad, if you are a physician, why do you go to work dressed as a security guard every day?" Madam Speaker, it doesn't get any worse for new Canadians than that. So as we look at that, we know that Canada's Conservatives have been working hard to create policies when we form the next government that will easily allow new Canadians to have their credentials recognized here in Canada so they can support Canada's healthcare system and work in a manner in which is attuned to the training that they have undertaken in their home country. So, Madam Speaker, what do we have? We have, again, a photo op, we have papers, we have announcements. We do not have a plan that has been put forward by this NDP Liberal coalition in any way, shape, or form. We have more announcements, we have no actions, and we have continued interference in provincial jurisdictional matters, which, as I said, Madam Speaker, as I've gone around the country speaking to provincial ministers of health, the last thing they want is another federal program dropped in the laps of provinces to have to pay for because of the ineptitude of this NDP Liberal coalition. So we await the time when the Conservatives will form the next government of this country. We'll have a new Prime Minister and new hope for Canadians as they are able to afford their lives, and the inflationary pressures and the inflationary spending that continues to be put forth by this NDP Liberal coalition will end, and Canadians can then not be priced out of their lives. Madam Speaker, we will axe the tax, we will build the houses, we will fix the budget, and we will stop the crime. Madam Speaker, I would like to put forward a motion, that the motion be amended by deleting all the words after the word that and substituting the following, and I quote, and this is seconded by the member from Edmonton Riverbend: the House declined to give second reading to Bill C-64, an act respecting pharmacare, since the bill does nothing to address the healthcare crisis and will instead offer Canadians an inferior pharmacare plan that covers less, costs more, and builds up a massive new bureaucracy that Canadians cannot afford. Thank you, Madam Speaker.
Mr. Ellis, seconded by Mr. Genereux, moves the following: that the motion be amended by deleting all the words after the word that and substituting the following: the House declined to give second reading to Bill C-64, an act respecting pharmacare, since the bill does nothing to address the health care crisis and will instead offer Canadians an inferior pharmacare plan that covers less, costs more, and builds up a massive new bureaucracy that Canadians can't afford. The amendment is in order. Debate, questions and comments. The Honourable Parliamentary Secretary to the Government House.
Yes, thank you, Madam Speaker. I think it's really important to look at the contrast between the Government of Canada and the Liberal Party versus what the Conservative Party is espousing. We are the only party that is espousing a national health care system in which Canadians have grown to love for generations now. And what we're talking about is expanding and looking at ways in which we can complement that national health care system by bringing in a pharmacare program, Madam Speaker, at least a good step forward. That's what we are proposing. The Conservatives, on the other hand, are proposing to kill it. They're proposing that the federal government should not play a role in many aspects of health care. I believe that the Conservative Party is doing a great disservice to Canadians, and my question to the member, quite frankly, is can he give a clear indication as to why the Conservative Party does not believe pharmaceuticals has a role to play in the Canada health care that Canadians want it to play, Madam Speaker? Why not?
For Cumberland Colchester.
Well, Madam Speaker, what this member said is categorically untrue. What we have pointed out with the eloquent speech that I just gave is that 6.5 million Canadians do not have access to health care. We know that the wait times are the longest that they've ever been in the history of this country, and that this NDP Liberal coalition, with the gooning and guffawing behind me, because of course they know it's all true, is that the difficulty that exists inside the current health care program is that the inability for Canadians to access the program. And why would we continue to put lipstick on a pig when their inactions have allowed the system to deteriorate to the point where many Canadians say that the system is failing them, and indeed it is. When men and women in this country are dying on a waiting list, 17 to 30,000 a year, that is a failing system, Madam Speaker.
That's right. Le député de Montcalm.
The honourable member for Montcalm. Thank you, Madam Speaker.
Pardon? Merci, Madame la Présidente.
Thank you, Madam Speaker. I would like my colleague, the health critic for the Conservative Party, who made an important point about access to care and about delays in health care. I'd like him to tell me what the Conservative Party would propose to reduce these problems, given that in regard to the health transfer agreements, I haven't heard his leaders speak out about going further than what was on the table. And all the provinces believe that it's not enough. Not enough to reduce the problem that my colleague mentioned earlier. What does his party suggest to strengthen our healthcare systems in the provinces and Quebec?
Cumberland Colchester.
Merci beaucoup, Madame la Présidente.
Thank you, Madam Speaker. I think that it's always essential to work with all the provinces and encourage necessary change in the system. We need to respect provincial jurisdiction. That's at the heart of the issue, and I'm sure that it's something that my colleague cares deeply about. That will be a Conservative goal in future when we form government.
Honourable Member for New Westminster Burnaby.
Thank you very much, Madam Speaker. I had flashbacks when the member was speaking because, of course, we lived through the terrible, terrible years of the Harper regime. So when he said, well, I'll take care of health care, we saw what the Harper regime did, which was gutting health care across the country, leading to the crisis that we see today. When he talks about credential recognition, Madam Speaker, I heard the same speech from Harper and his minions just before they formed government, and the reality was they did nothing on credential recognition. They doubled the cost of housing. They increased and doubled the lineups at food banks. I mean, the Harper regime was absolutely dismal. We lived through it, and that's why they were thrown out of power. Now that they're saying, well, this time will be better, I think it kind of strikes credibility. But the member did say very clearly that Conservatives are going to destroy pharmacare. That this, in Cumberland, Colchester, where 17,000 of his constituents actually need the kind of supports that come from providing supports for diabetes, the medication that can run up to $900 a month. So I'd like the member to say clearly to his constituents in Cumberland, Colchester, are Conservatives going to gut pharmacare? Do they refuse the kind of supports that 17,000 people in Cumberland, Colchester need?
Cumberland, Colchester.
Well, thank you very much, Madam Speaker. I'm not sure what fantasy land that member was listening to the fantastic speech that I gave. But that being said, there was no mention of anything that he said in his question, so I'm not sure where that came from. But that being said, what we do know is that a new day and a new dawn and a new sense of hope is out there with Canadians because of the hope that we as the next Conservative government are able to give Canadians. When we know that the damaging policies that the NDP Liberal coalition have caused for Canadians, as I said, the numbers speak for themselves, Madam Speaker. 6.5 million Canadians do not have access to primary care. As far as the great people of Cumberland Colchester, Nova Scotia, much like my colleagues in the great province of Quebec, has a program for pharmacare that enables all Nova Scotians already to access a pharmacare program, which indeed covers even more medications than than the one put forward by the inept NDP Liberal coalition government with their anemic formularies that they so far have put forward. So the great people of Cumberland Colchester have access to wonderful programs, and those are the things that a Conservative government should be supporting in the future, Madam Speaker.
The Honourable Member for Brandon Souris.
Thank you, Madam Speaker. And just in relation to the question that my colleague from Cumberland Colchester asked the Minister of Health, I have a letter here from a local dentist in my area, and I'm just wondering if he could refer to any similarities between the Canadian Dental Care Plan and what is being rolled out in the Pharmacare Plan. This dentist says that it may place our oral dental care system in serious jeopardy. Goes on to say that it's deeply flawed and stands to jeopardize our entire established system and how we deliver care to our patients. And says that only 70% of the dentists have said they are likely to participate as a provider in the CDCP program. He goes on to say that patients are going to be surprised to learn that dental care will not be free. They may not be able to choose their preferred dentist, and nothing has been done to protect access to third-party insurance. So I just want to ask my colleague from Cumberland Colchester if he can outline further than he did in his speech, which was a great speech, by the way, any similarities that he can see between this plan and the Pharmacare Plan.
Member for Cumberland Colchester.
Well, Madam Speaker, thank you very much. I thank my colleague from Brandon Souris for his insightful question. We know that this NDP Liberal coalition wants to create federated programs that are going to reduce the choice for Canadians and push those that do have access to their beloved care that they now have into a program that will cover much less medications. For instance, we know at the current time that public programs cover about half of the medications that privately funded plans do. So that will reduce choice for Canadians. What incentive will there be for employers to continue to provide plans for their hardworking employees in the future if a federated plan with a few old medications on it is what is being offered, quote unquote, for free on the backs of all Canadians, which of course we know that does not count for the bloated bureaucracy that it will take. As I mentioned, creating a new Canada Drug Agency in and of itself, at least $90 million just to create it. And even though my great colleague suggested that perhaps 70% of dentists may support it, we know from the figures now that only less than 10% of the 26,500 dentists in Canada have signed up for this program, which is severely limiting access for Canadians. Indeed, last week, in one day, 4 great supporters from Cumberland Colchester showed up in my office and said, I have this shiny card for the dental care program. I cannot find a dentist to actually provide the care because of the terrible nature of this program that has been created without consultation of the great dentists who provide care to millions of Canadians across this country. It's a shame. They should be ashamed of their program, and they should be ashamed of the fact that they want to introduce another bloated, federated program on the backs of hardworking Canadians.
Resuming debate, and I would remind members that we're debating the amendment. The Honourable Member for Montcalm. Thank you very much, Madam Speaker. I'd like to start my speech with a comment about the answer from my colleague, who's the critic on health for the Conservatives and who's at the committee. If I understood his answer correctly, he talked about respecting provincial and Quebec jurisdiction and not about adding to the health transfers. It means that people in Quebec really only have the Bloc Québécois as a choice, because on the one hand, we have the Liberals, which are stepping into our jurisdiction and saying you can have money, but only with a great many strings attached. And then the Conservatives saying, well, we won't bother you or get into your jurisdiction, but you won't have a single red cent more. That's the choice that people are facing throughout Canada, except in Quebec, because in Quebec we have the Bloc Québécois. Now, I hope the Minister of Health is listening closely. He often talks about his excellent discussions with his counterpart. I'll come back to that later. Let me start by saying that the nation of Quebec, through its National Assembly, speaks with a single voice. All parties have responded to the idea of having this coast-to-coast insurance. They did that in 2019. The National Assembly of the People of Quebec has not changed the position since then. I will just read out the motion that was adopted the day after the report was published. That the National Assembly take note of the federal report on a federal Medicare program, pharmacare program rather, that it reaffirm Quebec's exclusive jurisdiction in the area of health, that it reaffirm that Quebec has its own general pharmacare program and has had it for 20 years, almost, in fact, 28 years today, that it indicate to the federal government that Quebec refuses to adhere to a Canadian pharmacare system, that it asks the government of Quebec to keep its existing pharmacare system, and that it requires full compensation without conditions from the federal government if a federal pharmacare regime is officially tabled, which is what we're now seeing. Now, this that I just read is from June 2019, Madam Speaker. This House has twice voted on recognizing Quebec as a nation. So the least that it could do when you respect a so-called nation, if it's not just to be symbolic, if there were that respect, then the Minister of Health would not be acting like this, trampling all over our jurisdiction. Instead, he would come sit down respectfully with people who already are implementing a system. Yes, it's not perfect, but we know that the federal government was stingy with the health transfers. And I imagine that's because it wanted to keep money for dental or pharmacare insurance. And so it should have come to sit down with those who already have expertise to see how things work in the Quebec system. And the Minister of Health should be looking at how to give Quebec what it's asking for, full compensation without conditions. And let's stop engaging in this pretense around what Quebec wants to do with the money. Quebec's Minister of Health has been very clear. And the Minister of Health of Quebec said that we have no issue with adding that money to the pharmacare program, but it must be granted to us without conditions. It's not up to them to decide on the best coverage, the best drug coverage for Quebecers. I think that's quite clear, Madam Speaker. So the federal government says that it respects Quebec and that it's a nation. And yet, there are no concrete legislative consequences to this. The debate could be over right now by just offering that compensation. In the bill, a list will be created under this legislation. I asked a question earlier about it. Now, do you know how many drugs are covered by Quebec's pharmacare? 8,000. It's 792 pages long, so I wanted to bring it, but it's a bit too heavy. And yet, these federal politicians, like the Sorcerer's Apprentice, are trying to tell us that they'll be able to draw something up in so little time, something equivalent to that formulary. They want to create an agency to do this, but in Quebec we already have the infrastructure. Really? Does the federal government have that much money that it can throw it around, creating another agency to do the same thing? Doesn't our agency do it already? For 28 years, Quebec has had this expertise. It's been analyzing for 28 years. It's been analyzing the drugs, analyzing the chemical composition, and if necessary, adding new drugs to the formulary. Whether in the public or private part of this system, everyone has access to the same medication, Madam Speaker. So this would have been an excellent opportunity to respect the Quebec nation, Quebec's national statehood. Despite what the leader of the NDP has said, he's completely off base when he said that the problem with healthcare in Quebec is that the government has not invested sufficiently in healthcare. Although that's not true, the government increased the health budget by 50% and brought in reforms to do more with less. A great deal has been done to make the system more efficient. But when you have a partner who's simply not bringing the resources to the table, and then years later is coming along and saying, oh, well, we'll tell you how to handle your health system because you don't know what you're doing, instead of just putting the money on the table. So that's what I would say to start. Quebec is very upset with this interference. It's all very well for the Prime Minister to say, we don't care about jurisdiction. Does the Prime Minister really not care about the Constitution? Then maybe he should reopen it.
Let him reopen it. And then we'll see what happens. We'll see whether he cares. The government is always preaching, but not really taking care of Canadians. That's what the government in Ottawa is all about. And I'll come back to that. Madam Speaker, we'd like to believe that this bill is the result of good intentions, but the devil is in the details, and the road to hell is paved with good intentions. So I ask the question, how many drugs are covered by this Canada-wide system? Will they copy Quebec's formulary? Will they set aside Quebec's system, or will Quebec's system be able to continue to do its good work? Why would a Canada Drug Agency be able to replace Quebec's program? These questions remain unanswered. The minister, though, insists that he's had many discussions about this with Quebec. Well, those are not good conversations. Those are one-sided conversations where the minister speaks, where Ottawa speaks, but Quebec is not being heard. We want full compensation, and we want unconditional. Not only are we not receiving the money we've asked for health transfers, but Ottawa wants to interfere with provincial jurisdiction. The government knows full well that health is under provincial jurisdiction. We have had our own pharmacare plan since 1997. That's almost 30 years. And we also have the broadest formulary of covered drugs. All this according to Quebec's health minister, Christian Dubé. But the minister across the way says, oh, well, I've had many good conversations with that minister in Quebec. Then the Quebec minister had to call a press conference to be heard by the Liberal NDP government. The government was even less centralizing before the NDP got involved with all this. So the Quebec minister said, mind your own business. Then the Ottawa minister stands today and just insists that the teamwork is great. Then when we ask questions about this, we're told by members across the way that we're trying to pick a fight. We're not trying to pick a fight. We're only trying to ensure that the unanimous voice of the National Assembly is heard in this place. Now, we want to improve our program. We would like federal money to do so. Can anyone stand and prove to us that they can do better than Quebec does? Can Ottawa do better in Quebec than Quebec is currently doing with its pharmacare program? I'd like someone to be able to prove that. This is a matter of jurisdiction, of competence, and of incompetence. There's a lot of incompetence, which I will list later. With regard to C-64, C-64 put the cart before the horse. There was no summit, no meeting, no fulsome discussion. Rather than starting in that way, the government is tabling a bill stating its intent to eventually take action. But Ottawa hasn't consulted Quebec. They haven't done any consultations. They have not worked this out with Quebec. These are not good intentions. This is all about a political deal that the government made in order to stay in power until 2025. That's what's behind all this. Because it's not normal to do such botched work when it comes to something as crucially important as pharmacare. And medications in 2024 are not as they were in 1996, 1997. This isn't about codeine and Tylenol. This is about innovative molecules, new drugs, which lead to treatment that could at some point prevent, for instance, diseases, transplants. One example is Trikafta for cystic fibrosis. You take 2 pills a day with some water daily rather than being hospitalized for 200, 300 days a year, rather than having to be on a lung transplant list. But this medication must be covered. How will Canada proceed in establishing its formulary? And how can we trust the federal government, which is clearly checked out? This is the federal government that ransacked the EI fund, stole from workers, and then never put the money back in the fund. Let's not forget that in the mid-90s, around 1995, 1996, the federal deficit was punted down to the provinces. Health transfers were cut. Jean Chrétien traveled around the world stating at the G7 that all he had to do was cut health transfers to balance the books. He was bragging about it. And people, in fact, as a result, protested in front of the Quebec National Assembly rather than in front of Parliament. Now, Ottawa is creating a program, but how many years will it be before another government realizes that this program isn't working, that the program is just duplicating other existing programs. Money just needs to go to patients, to the healthcare systems provincially on the ground to help people as soon as possible. The minister gave a very nice speech today. We can all agree that the principles are good. But we are told that Quebec should just mind its own business. Ottawa doesn't handle its own business properly. For example, the F-35s, there's been underinvestment in defense. Let's not forget the Phoenix pay system issue, the National Emergency Reserve Stockpile, which was empty at the beginning of the pandemic, the Global Health Public Information Network. It was dismantled and it was not effective, therefore, at the beginning of the pandemic. We want the federal government to mind its own business and to manage its jurisdiction and its programs properly before telling us how to manage ours. Federal health employees, well, when it comes to Canadians who are taken care of by the federal health system, they're underfunded. They're not being taken care of properly. And employees are treated worse federally than they are by the provinces in provincial health care. Yet Ottawa still feels that it can tell provinces how to run health care. So what would this bill do? This bill would institute principles. Based on these principles, a formulary would be drafted. When the formulary is established, a committee and an agency would be established. The government does not know what direction it's going in, so they are tabling a bill to implement a committee which would make recommendations about eventually implementing pharmacare. Good work. Hats off. The Bloc Québécois is not against national pharmacare on principle. We have a system in Quebec, a mixed system, a mixed drug insurance plan. So we're open to this concept. But what we want and what the National Assembly has always called for is the right to opt out with full compensation. When it comes to health and administering pharmacare, if elsewhere in Canada pharmacare is needed, that's fine. We in Quebec, we will never accept anyone taking away from our coverage. Currently, pharmacare is fully covered for those under 18 in Quebec. Now, our system is far from perfect, of course. There are, of course, fees and costs. But if we had enough money, we could increase coverage without removing any medications from our formulary. Does the government have any idea how much this will cost? Is it costed? Will everything really be fully covered? I don't think the wizards and math whizzes in the government have actually thought this through. Quebec's National Assembly and Quebec's government were not fully consulted. And Quebec's expertise will not serve as an inspiration, whereas it should.
The Government House Leader.
Yes, thank you, Madam Speaker. Many years ago, the province of Saskatchewan implements a policy and a program that ultimately led, in good part, to the national government recognizing how important it is to develop a national health care system. And as a direct result, over generations now, we have benefited by a national Canada health care system. Many people had advocated over the years that there should be a pharmacare component to that healthcare system. Today, what we're seeing is historic legislation that leads us to achieving that particular goal. That is something that is universally shared across the country. Every province, the people that reside in those provinces understand and have faith in the Canada health system, whether it's Winnipeg, Toronto, Montreal, Vancouver, Halifax, and all the municipalities in between. There's a great deal of support for the federal government to be involved in healthcare. That's why we have the Canada Health Act. My question to the member is, does he not believe that Canada has more than a role to play than just being an ATM machine?
The Honourable Member for Montcalm. Well, Madam Speaker, that's very insulting to hear. An ATM? We don't treat Ottawa like an ATM. Ottawa handles our taxes. It's taxpayer money. All we're asking for is for the Government of Canada to invest through health cares. We want sustained health transfers, significant ones, not the insignificant transfers that we've been getting. Experts have said that the collateral impacts of the pandemic on non-COVID patients, well, that it could take 5 to 8 years to recover from the pandemic. And what did the government do? They waited until after the pandemic to hand the provinces pennies and crumbs for their healthcare systems. Not only is that insulting, but it's criminal.
Honourable for Cumberland Colchester.
Thank you very much, Madam Speaker. I would like to thank my colleague for his speech. It was a very passionate, fact-based speech. Faced with the costly Liberal NDP coalition, with all their ridiculous programs. Now, here's my question for my colleague. When we vote on the budget, we will have the chance to vote against the government and against the costly coalition. Will the Bloc vote against the budget and the government? The Honourable Member for Montcalm. Madam Speaker, we'll have to see what's in the budget. Yesterday, the Bloc Québécois leader, parliamentary leader, said that given Ottawa's meddling with Quebec's jurisdiction, said that we cannot vote for this budget. So we do intend to vote against the budget. But I will let our party's spokespeople address that. I don't want to steal anyone's thunder. I'm the health critic. But in principle, we will likely vote against the budget because it does not respect the nation state of Quebec.
Merci, Madame la Présidente.
Thank you, Madam Speaker. I would like to thank my colleague for the contents of his speech. I am a progressive, and we recognize that Quebec has a really strong social network, for example, with education, housing, daycare, health, and that's no coincidence. That's the result of very hard work done by Quebecers for decades now. That said, many Canadians have fought to strengthen and broaden the healthcare system elsewhere in Canada. I'm proud of the work that the NDP has accomplished when it comes to pharmacare. We have some significant concerns about Liberal promises made, but we feel that it is essential to broaden pharmaceuticals that Canadians have access to. We need to expand access. Does my colleague agree that Canadians should have access to this care and these services? And if so, how can we work with Quebec? The Honourable Member for Montcalm. I'm happy to hear that the NDP member seems to understand Quebec better than her party's leader, because he said that healthcare is going poorly in Quebec because we're not investing enough. Meanwhile, though, the budget has gone from 40 billion to 50 billion in Quebec, so we are investing in healthcare. The federal government is not doing its part. Now, if other provinces would like to implement a system similar to ours, that's great. But I would like to hear my colleague and the NDP leader say outright that Quebec will have the right to full compensation with the right to opt out and unconditionally. Questions and comments? The Honourable Member for Rivière-du-Loup. Rivière-du-Nord, rather. Thank you, Madam Speaker. Madam Speaker, I wish to thank my colleague from Montcalm for his speech, which was very interesting. I've been listening to debate today, and I've been following this file for a few weeks. Things are going terribly. But at the end of the day, the problem that we have with this bill and the problem we have with how the Liberal NDP government acts, they're always meddling with provincial jurisdiction. Is this not a tax issue? Quebec collects taxes to offer services which are under provincial jurisdiction. Then Ottawa also collects taxes and then returns some of it with conditions, though. Our issue with this bill is our issue with all bills from Ottawa that overstep on provincial jurisdiction. We want the federal government to stop taking money from Ottawa's pockets, from Quebecers' pockets, and maybe Quebec can one day decide to exit this confederation. Thank you very much. The Honourable Member for Montcalm. Madam Speaker, it will come as no surprise that I agree. Ottawa is always overstepping. They are not recognizing that we are a state. We have only been recognized symbolically, but that symbolic recognition of our nationhood has no tangible impacts. So at some point, Quebecers may decide to take their own business into their own hands and make Quebec a country.
Aldergrove.
Thank you, Madam Speaker. I have a question for the member from Montcalm about monetary policy and how it relates to healthcare policy. I did the quick math, $1.2 trillion in national debt at 4% interest rate annual servicing costs, $48 billion. What does this member think is the likelihood of the Liberal promises about health care, about dental care, and now about pharmacare actually being successful in this environment of high debt servicing costs?
The Honourable Member for Montcalm. Madam Speaker, between now and the election, well, the government seems totally unable to listen to Quebec. The government does not heed to Quebec's asks. But in Quebec, we insist that we want the right to opt out with full compensation and no conditions. They cannot deny us that. But between now and the election, they don't really have time to do much. The polls seem to indicate that if the Conservatives form government, there won't be much done for health care. That was my understanding, anyhow, based on the comments of the Conservative health critic. They won't interfere, they won't meddle. That's all well and good, but they won't give us a penny either.
New Westminster, Burnaby.
Merci beaucoup, Madame la Présidente.
Thank you, Madam Speaker. And I just want to respond to my Bloc Québécois colleague at the start because he doesn't seem to have listened to Quebecers who support this bill. So I'd like to start, Madam Speaker, by reading the statement by the CST, the CSN, the CSQ, and the FTQ, all these unions that represent 1 million Quebecers, as approximately a third of the population of Quebec is represented when we look at the families of those workers and the workers themselves. And they said that they are in favor of the tabling of a bill on pharmacare by the federal government, which is creating a universal public pharmacare program. A number of these are encouraging for the future, such as the consideration for the Canada Health Act of the public health care values and the inclusion of contraceptives and related products for diabetes and coverage for other things. I would like to quote the union leaders themselves who are in charge of these unions, and they said, Luc Beauregard said, he's the Secretary-Treasurer of the Quebec Workers' Union, and he said, Quebecers deserve better. They need a public universal pharmacare system as soon as possible. Magali Picard, president of the Fédération des Travailleurs et Travailleuses de Québec, and she said, with the increase in the cost of living, a number of Quebecers have difficulty making ends meet. Every year, 1 out of 10 people is deprived of prescription medication because they cannot pay for it. It makes no sense to tolerate that kind of situation. Drugs should be free because nobody decides to be sick. Caroline Senneville, president of the Confédération des Syndicats Nationaux, said the following: unions believe that Quebec is going down the wrong path. It would not be acceptable for us, for Quebecers, to get federal money unconditionally in the goal of maintaining a dysfunctional and unfair plan. And finally, Luc Vachon, president of CST, said the following: it is unthinkable that the health of someone depends on their income or is the subject of negotiations. Even if Quebec has its own plan, it discriminates against people with lower incomes. A really public and universal plan must ensure that everybody has access to medication, both in Quebec and Canada. There's a strong consensus for putting in place a public universal pharmacare plan. The time has come to go beyond constitutional squabbles in order to ensure that the population of Canada and Quebec has access to medication. And this is, once again, Madam Speaker, we're talking about more than a third of the population of Quebec, which is being represented by these big unions within Quebec. And they spoke very clearly, I think, because we've just heard the Bloc Québécois, and they showed resistance to the bill. And I think, Madam Speaker, I would ask them quite nicely to listen to Quebecers and not to presume that because they don't like it, because the Bloc itself doesn't like it, that this represents the wishes of the Quebec population. In fact, their reality is that I think these voices in Quebec should be listened to by the Bloc Québécois. Of course, Madam Speaker, we know that the current system in Quebec is not working well. People have been abandoned. This bill, which was pushed forward by the NDP and which has now come to the House thanks to the NDP, is something that will make a difference in the lives of Quebecers and Canadians, everyone across the country. So this is the message that I am sending to my Bloc Québécois colleagues. It's difficult to be opposed to something when you listen, as I have just quoted these people. When you listen to these people, they looked at the bill and they want for progress to be achieved. People who are fighting to pay for their diabetes medication, people who don't have the income, who are abandoned. These people are people who deserve help. I hope that the Bloc Québécois will listen to these voices and take action accordingly to vote in favor of the bill, because they can't simply be reactionary like the Conservatives are.
Let's talk first off about the impact of pharmacare. You'll recall, Madam Speaker, a little over 3 years ago, I brought forward, on behalf of the NDP caucus, the Canada Pharmacare Act. This is something that would have made a difference in the lives of Canadians from coast to coast to coast. 120,000 Canadians wrote to their members of Parliament. Hundreds of them wrote to each Conservative MP. And you'll recall 3 years ago, Madam Speaker, systematically Conservatives and Liberals voted against that bill that would have established, on the basis of the Canada Health Act, the 5 principles of universal health care, pharmacare in Canada. So for me, it's poetic justice that 3 years later now, because of the NDP's pressure, because of the NDP's work, because of the work of leader of the NDP, from my colleague from Burnaby South, our health critic at the time, the Member of Parliament for Vancouver Kingsway, and the entire NDP caucus. We used our weight and our pressure in a minority parliament to actually achieve something that is going to make a significant difference in the lives of people. Now, Madam Speaker, Conservatives have said, well, it's diabetes and contraception. That's only a start. That is very true. But the reality is, when we talk about diabetes medication, Madam Speaker, that costs of having diabetes, which is a profound health challenge in this country, can be up to $900 a month. I cited a little bit earlier, resident of Burnaby, BC, Amber Malott, who pays $900 a month. Now, the reality is each and every Conservative MP has in their riding 17,000 to 18,000 people that are impacted by this significant move forward in Canadian healthcare. They benefit from that. The ones that are paying $100 a month or $500 a month or even $900 a month finally have that burden taken off them. And Conservatives have signaled they want to gut it. They blocked the bill last week, refused to even have it brought to the floor of the House of Commons. They've indicated that they are going at every step to try to block and destroy this legislation. And you have to ask the question, Madam Speaker, why? Like, is it just weird ideology? Is it just their extremist leader? Or is it the fact that they haven't even read the legislation and haven't consulted their constituents? Because if they talk to 17 or 18,000 people in each of their ridings, they would find that those constituents would be saying, no, we need to adopt this legislation. I can't keep paying $200 a month or $500 or $900 a month for medication. I simply can't afford to put food on the table. I simply can't afford to keep a roof over my head and pay for this medication. And if they consulted their constituents, they would overwhelmingly hear from those 17 or 18,000 people that this will make a difference in their lives. Now, Madam Speaker, I certainly will be going out to Conservative ridings, and I'll be consulting their constituents because they seem unwilling to. For them to block the bill and to say that they don't even want it discussed on the floor of the House of Commons indicates their extremism within.
I want to remind members that there will be an opportunity for not 5, but 10 minutes of questions and comments. So if honourable members have questions and comments, they know that they should wait until the appropriate time to do so. The Honourable Parliamentary Secretary. Oh, sorry, the Honourable Member for New Westminster Burnaby.
Well, Madam Speaker, I think from the reaction of Conservatives, it's obvious that they're a little worried about this because obviously they know that they haven't consulted their constituents. They haven't talked to them. They don't. They love to say that they're concerned about affordability. Of course, Madam Speaker, as we recall, under the dismal, terrible Harper regime, how food lineups doubled, how the price of housing doubled. And yes, Conservatives say, well, Liberals did the same thing. But the reality is the Conservatives at no point have ever taken responsibility for what they imposed on Canadians, Liberals at least are willing to accept NDP leadership to bring forward things that will actually benefit people, such as dental care, such as affordable housing, and now pharmacare, Madam Speaker. So if they're sensitive about this, if they're saying, no, we don't want people talking to our constituents, the 17 to 18,000 people that will benefit from having their diabetes medication actually taken care of, diabetes devices actually taken care of, you have to wonder, Madam Speaker, what is their motivation then? If they don't want to consult their constituents themselves, don't want anybody else to consult their constituents, just want to, in a disconnected way, make their speeches here in the House of Commons, but without actually talking to the people that will benefit from the bill, you have to wonder, Madam Speaker, what responsibility they take as elected representatives, particularly given how deplorable their record was in government. The worst government in Canadian history was the Harper regime. And I could spend easily hours. And in fact, I did, Madam Speaker. As you recall, I spoke for 14 hours about the 2012 budget and the appalling impacts of that budget on Canadians, on Canadian seniors, on environmental policy. And so I could literally speak for hours about the scandals, about the dishonesty, the lack of transparency, the brutality of the Harper regime, what it did to seniors, forcing them to work longer, what it did to veterans by shutting off all their services. But I'm going to leave that for today, Madam Speaker, and hopefully at some future time we can really remind Canadians of how dismal and terrible the Harper regime was. And Conservatives who are there should be ready to apologize, but they never have apologized for everything they've done. Now, Madam Speaker, here's an opportunity for them to redress the wrongs when they were in government, when housing prices doubled, when they slashed affordable housing, when they ensured, of course, that services were gutted. They have an opportunity to address some of those things, and they're saying, no, we're refusing to provide pharmacare. We refuse to have any kind of supports for the people in our ridings, 17 or 18,000 people in each of our ridings that would benefit from having their diabetes medication covered. They're saying, no, we don't want to help our constituents at all. And that is a sad thing, Madam Speaker, because the reality is pharmacare in this bill makes a big difference. On average, for every member of Parliament, not just the Conservatives, every member of Parliament in this House of Commons will see 17 to 18,000 of their constituents benefit. The people who are struggling to pay for their diabetes medication, to put food on the table, to keep a roof over their head, will benefit. And you can imagine, Madam Speaker, at the cost of up to $900 a month, $900 a month, we're talking about a $10,000 benefit. And yet Conservatives say, no way, we're not interested. But there's more, Madam Speaker, and this is where we get back to the 3 years ago when this was brought forward in the House of Commons, and Conservatives and Liberals, with alacrity, voted down the Canada Pharmacare Act. And thankfully, Liberals now are apologizing for that by bringing forward and supporting this pharmacare bill. But as we know, with pharmacare writ large, Parliamentary Budgetary Officer has indicated this so many times. The overall savings to Canadians is about $4 billion. Savings to our healthcare system are enormous because many of the people who end up in our emergency wards across the country end up there because they can't afford to pay for their medication that keeps them in good health. The reality of pharmacare, and Canada is the only country that has universal health care, thanks to Tommy Douglas and the NDP, fighting hard for it in the 1960s, that doesn't have universal pharmacare. Why is that every other country has gone coupling universal health care with universal pharmacare? It's because having access to your medication beyond the hospital makes a good sense for the healthcare system as a whole. That if you can take the medication your doctor prescribes to keep you in good health, you're not going to spend your time in the acute care ward or the emergency ward of the hospital. And we know how those costs are. An acute care bed in the course of a week is $30,000. So why wouldn't we put in place pharmacare in a way that allows that person to stay in good health and stay out of the hospital. And that's why the Parliamentary Budgetary Officer stressed not only the savings to the healthcare system, but also the savings that come from the kind of bulk purchasing negotiations that have led other countries like New Zealand to reduce the cost of some of their medications by up to 90%. It's no longer a multitude of hundreds of different negotiations taking place where the pharmaceutical companies, of course, can play one against the other. It's with a universal pharmacare system, you can say to the pharmaceutical companies, these are the prices we're going to pay. And when New Zealand reduced the cost of some of its medication by 90%, that is because it is a best practice, a bulk purchasing. Now, Conservatives will not talk about this at all because, well, quite frankly, I find most Conservatives are mathematically challenged. When it comes to budgetary things, they simply do not do it well. We saw it under the Harper regime. Record deficits. They're terrible when it comes to managing money and paying down debt. The NDP, according to that stellar source, the Ministry of Finance and their fiscal period returns actually compared how NDP governments, at the provincial level of course, compare with Conservative and Liberal governments at the provincial and federal levels. And NDP governments over the last 40 years have been the best at managing money, ensuring that money goes into the healthcare system for things like that, rather than paying money to the pharmaceutical companies, negotiating a cheaper price and making sure it's accessible to everybody, which then saves money in the healthcare system, means fewer stays in acute care beds, fewer visits to the emergency wards. I mean, it makes sense, which is why other countries do that. Universal healthcare, universal pharmacare. And this is the first important step to that universal pharmacare, to ensure that people who are forced to take diabetes medication, who needs access to diabetes devices, actually have that paid for. They're no longer having to question whether or not they can pay for that. Because if they can't pay for it, Madam Speaker, they end up in the hospital. And it costs far more to our healthcare system than having in place the pharmacare. It just makes good sense, Madam Speaker. But worse, as you know, it's not just people who can't afford to pay for their medication that end up in acute care beds and in the emergency wards. Madam Speaker, as you know, tragically, and Canadian nurses have been telling us for years, hundreds of Canadians die every year because they can't afford to pay for the medication that keeps them alive. Hundreds of Canadians. This has been a crisis in our healthcare system, that people can't afford to pay for their medication, and so they go to the hospital, they cost more to the healthcare system in an acute care bed, but worse, Madam Speaker, they also pass away. And that creates even more mourning in the healthcare system. It is something that we simply should not be willing to tolerate. But Conservatives and Liberals for decades have said, that's not a problem. We're not going to take charge of it. Thankfully, Liberals, and I do compliment the Minister of Health for stepping up on this, finally we are moving forward on the first step of pharmacare in Canada. This is vitally important. So when professionals in the healthcare system say this is a smart thing to do, when financially we know costs $4 billion less to have in place a pharmacare program than it would to continue with the patchwork that we have now. If we can save hundreds of lives, then all of these things make sense. This shouldn't even be a matter of controversy, Madam Speaker. This should be something that is adopted at all stages and adopted by all members of Parliament. And as I mentioned, Madam Speaker, 17,000 to 18,000 in every riding in the country, 17,000 to 18,000 Canadians would benefit from just having access to the diabetes medication that is prescribed in the bill. So, Madam Speaker, the NDP is happy to see this first step taken. We're not going to give up. We're going to keep pushing. I have constituents that are paying $1,000 a month for heart medication, and that's going to be the next push for us. But we believe strongly this House should be adopting this bill. We should move it to committee, and we should get going with putting in place the first steps of pharmacare in Canada. Thank you, Madam Speaker.
Questions and comments. The Honourable Parliamentary Secretary, the Government House Leader.
Yes, thank you, Madam Speaker. You know, one of the sad things that I've witnessed in the province of Manitoba is often you'll get individuals that will go into hospital situations where they require medications after they leave the hospital. So while you're in the hospital, the medications are free. But then when you leave, you have to cover your own costs for medications, which ultimately put many people, especially on fixed income, in positions where they're deciding food versus medicines. And they end up ultimately going back to the hospital because they're not taking the medications that they should be taking. And when I think of the long term, in terms of how we evolve and develop a pharmacare program, that we should be reflecting in terms of what it was initially meant when we brought in a national health care system, that there was always the thought of having a pharmacare component to it. And I'm wondering if my colleague could just provide his thoughts in regards to how important it is that we recognize this as a stepping stone moving forward into a stronger and healthier healthcare system.
Honourable for New Westminster, Burnaby.
Thank you very much, Madam Speaker. I often disagree with my colleague from Winnipeg North, and he disagrees with me, but I think on this issue we are in solidarity, because he is absolutely right. We are wasting tax dollars on a healthcare system that has been dysfunctional, where you go to a hospital because you have a medical emergency and your medication is paid for, and then the moment you leave, it's up to you. You're on your own. And if you have to scrimp on food or you have to move out of your apartment to pay for that medication, it's up to you. The reality is, for so many Canadians, hundreds who die every year, they simply can't afford to do all of those things. It is time that we put in place pharmacare, and it is time that we start extending it to other types of medication.
Questions and comments? The Honourable for Pitt Meadows, Maple Ridge.
Thank you, Madam Speaker. Madam Speaker, this is not a pharmacare plan. This is a PR exercise by a NDP Liberal coalition that is floundering in the polls. There's a reason why almost a quarter of the NDP MPs are not seeking re-election. Now, the member is from British Columbia, which I'm also. And as he was speaking, I was looking up what the plan is for pharmacare in BC, and they say specifically that pharmacare covers approved diabetes management supplies and most insulin. It's already covered. Now, and the plan that is being proposed is nowhere, doesn't even compare. So I wonder if the member will also just mention that the fact that by inflationary spending, that we have to pay $50 billion in interest, how that is actually undermining health care across Canada.
Honourable from New Westminster, Burnaby.
Thank you very much, Madam Speaker, and I think the member has just made my point that BC is already moving. Yes, BC is the leader in the country in terms of affordable housing. More housing built in British Columbia than the rest of the country combined. A leader in the country in terms of environmental legislation, leader in the country in terms of healthcare investments, a leader in the country in terms of post-secondary education. So he's absolutely right to point out that the BC NDP government is doing the best job in the country of any government. And we appreciate that he's acknowledging that. The point is, what we want to do is bring these best practices in BC and put them right across the country. But he also mentioned deficits. And I find it rich that any Conservative would talk about deficits after their deplorable record of $30 billion a year given to overseas tax havens under the Harper tax haven treaties. $30 billion. Over their watch, it was $300 billion. They have been absolutely deplorable in financial management. We're still paying the cost today.
The Honourable Member for Thérèse de Blainville. Thank you, Madam Speaker. I'd like to start by saying what my colleague for the NDP has done. The major unions in Quebec have been fighting for years, and my colleague mentioned that. They fought for years to ensure that we have universal pharmacare in Quebec. And I just want to underscore that, like my colleague did. These large labor movements struggled for a long time to ensure that this system would be implemented. The system is not perfect, but it would be false to claim that in this case, Canada can just step in to create a pharmacare program without considering the Quebec and provincial realities. If my colleague were being honest, he could also have said that these large union movements are asking for the right to withdraw with full compensation. But the NDP refuses to mention that because it wants coast-to-coast social programs. New Zealand has 5 million people living there, whereas Canada has 34, and it is only going to go up. And there are other examples. If we don't respect provincial jurisdiction on health and other social programs, that completely goes against the foundational principles of Canada. The member for New Westminster Burnaby. The Bloc Québécois should apologize for twisting the remarks that I just quoted. For example, Caroline Senneville, president of the United Labour Group, that said that Quebec is doing the wrong thing by asking for withdrawal with full compensation. Luc Vachon, another union leader, said that the time has come to move past constitutional disputes. The reality is that all of these major unions that represent all of the workers, that represent millions of workers in Quebec, nearly a third of the Quebec population, they have all said that they look favorably upon this new bill. And if that's the case, the Bloc Québécois therefore has a responsibility to support the bill and help it move to committee so we can move forward. This legislation, once again, is looked upon favorably by these unions.
For Timmins James Bay.
Thank you, Madam Speaker. It was fascinating to watch the Conservatives put up their doctor, who just trashed the notion of medical treatment, but not with any facts, but with those kind of bumper sticker slogans of, 4 legs good, 2 legs bad, 4 legs good, 2 legs bad. And I was trying to understand how a doctor could be so dismissive about basic health care. And then, of course, it dawned on me that the Conservatives' deputy leader was a lobbyist for Abbey Feed. That was a company that jacked up its medical prices for seniors by over 470%. So you know what the Conservatives are going to do with seniors and medical treatment? They don't want them to get pharmacare. But then we also find out that the Conservative Party's governing body is full of lobbyists for Big Pharma. So I'd like to ask my honourable colleague why he thinks it is that the Conservative MPs and their one doctor are so concerned to protect the interests of companies that they work for that have jacked up medical costs on basic pharmacare for seniors.
The honourable member for New Westminster Burnaby.
Oh, thank you very much, Madam Speaker. And that's an excellent question from my colleague, Timmins James Bay. And the corporate Conservatives are all over. The lobbyists in their ranks, the lobbyists influencing the Conservative Party, they see Canadians as plunder, that they can just jack up oil and gas prices, jacked up 30 cents in British Columbia. That gas price gouging, not a single Conservative MP from British Columbia said one word. The grocery price gouging, food price gouging, we find out that the director of the next Conservative campaign is a Loblaws lobbyist. And so not a word about food price gouging. They simply allow the corporate sector to plunder Canadians, and we saw this under the Harper regime, as my colleague from Timmins James Bay points out. It was the worst government in Canadian history. What we saw is big corporations basically ravaging this country, and their massive giveaway of $30 billion each and every year. It doesn't go to seniors, doesn't go to students, doesn't go for health care, doesn't go to support any building at all in the country. It went to the Harper tax haven treaties. Basically, they signed a whole bunch of tax haven treaties so the wealthy and big corporations could take their money overseas and not pay a dime of tax Conservatives should be ashamed of themselves.
Wow, yes. Reprise de débat. Resuming debate. L'honorable député de Lac-Saint-Louis.
The honourable member for Lac-Saint-Louis. On Bill, I wish to speak on First Nations. Is that not the case? No, our debate is on Bill C-64 on health. No, we haven't switched what bill we're debating.
Resuming debate, reprise de débat. The member for Nepean.
Thank you, Madam Speaker. I'm going to share time with the members from Kingston and Thousand Islands. Bill C-64, the Pharmacare Act, is a transformative shift in our national approach to healthcare. We are taking a decisive step towards not just improving healthcare, but fundamentally redefining what it means to be a part of this great nation. Healthcare is a cornerstone of Canadian identity, rooted in the belief that access to medical care should be based on need, not ability to pay. Yet, until now, this promise has been incomplete because it has not fully covered medications. Bill C-64 establishes a framework towards a national universal pharmacare in Canada for certain prescription drugs and related products, including free coverage for contraception and diabetes medication. This is more than policy. It is a new chapter in our social contract. This comes after our Canadian dental care program that reduced the financial barrier to access oral healthcare services for up to 9 million uninsured Canadian residents. Let us consider the significance of this moment. Many of our citizens, particularly the chronically ill and the economically vulnerable, have had to choose between medication and other essentials of life. This choice no one should ever have to make has led to deteriorating health condition, increased hospitalizations, and tragically premature deaths. Bill 664 also provides that the Canadian Drug Agency work towards the development of a national formulary, develop a national bulk purchasing strategy, and support the publication of a pan-Canadian strategy regarding the appropriate use of prescription medications. Several G7 countries have implemented national pharmacare programs that vary in structure but share the common goal of improving access to medications. In the United Kingdom, the National Health Service covers most prescription medications, with patients paying a fixed prescription charge or obtaining an exemption, making medications free for children, the elderly, and low-income individuals. France operates a co-payment system where patients are reimbursed for a significant portion of their medication costs based on the medication's necessity and effectiveness, with some essential medication covered at 100%. Germany features a statutory health insurance system that covers the vast majority of the population, with prescriptions requiring a nominal copay that is capped annually. Similarly, Italy's national health system provides medication at low or no cost, depending on the medication's classification and the patient's income level. Japan has a system where patients pay a percentage of the cost for their prescriptions, which is adjusted based on income, age, and chronic health status, ensuring that no one is denied access due to financial constraints. These G7 countries demonstrate a commitment to ensuring that essential medications are affordable, reducing the financial burden on individuals, and promoting better health outcomes across the population. The United States and Canada have distinct healthcare systems that reflect differing approaches to healthcare management and funding. The US healthcare system is predominantly a privatized system where health insurance is primarily provided through private entities, supplemented by government programs like Medicare and Medicaid for specific groups such as elderly and low-income individuals. This system often results in higher out-of-pocket costs for individuals depending on their insurance plans. In contrast, Canadian healthcare system is publicly funded. It provides universal coverage for all Canadian citizens and permanent residents funded through taxation. Healthcare services in Canada are delivered through a single-payer system, meaning that the government pays for care that is delivered by private entities. This model aims to ensure that access to healthcare does not depend on one's ability to pay. While both systems aim to deliver high-quality Medicare, the Canadian system is generally more focused on equitable access, whereas the US system offers a wider range of provider choices and faster access to elective procedures, often at a higher cost to the consumer. The US system also features higher healthcare spending per capita compared to Canada, which has managed to control costs more effectively through its single-payer system. As a diabetic myself, let me touch on the transformative change that promises to reshape the lives of more than 3.7 million Canadians living with diabetes. Diabetes, a chronic and complex disease, poses one of the greatest health challenges in our nation, impacting an enormous swath of our population across every age, socioeconomic status, and community. The burden of diabetes is not just a personal struggle, it is a national concern. The profound physical, emotional, and financial strain of diabetes is well documented. This disease is not, if not managed properly, can lead to devastating complications such as blindness, kidney failure, heart disease, and even amputations. Yet, despite the availability of effective treatments, a staggering 1 in 4 Canadians with diabetes has reported not adhering to their prescribed medical regime solely due to cost. This is not a failure in health management, it is a failure in our health policy. The introduction of Pharmacare Act is a beacon of hope. This legislation is a crucial step forward towards eliminating the financial barriers that too many Canadians face in accessing essential diabetes medications. By ensuring that no one is left out because they cannot afford their medicine, we are not just improving individual health outcomes, we are enhancing our nation's health security. The importance of this act cannot be overstated for the diabetes community. Improved access to necessary medication means better disease management and control, which significantly reduces the risk of severe complications. This is a direct investment in the health of millions, and the ripple effects will be seen throughout our healthcare system. Fewer complications from diabetes mean reduced hospital admissions, fewer medical emergencies, and a general decrease in healthcare burden on our system. We are not just providing medication, we are restoring opportunities and enhancing the well-being of millions. To all Canadians living with diabetes, this legislation is for you. It is a testament to our belief that together, as a united nation, we can tackle the challenges of chronic disease with compassion and resolve. Let us move forward with the assurance that our government is committed to your health and well-being. Let us embrace this change, not just for those living with diabetes, but for all of us, for a healthier, stronger Canada. To conclude, Bill C-64 lays out our plan for universal single-payer coverage for contraception and diabetes medications. Through our bilateral health agreements with provinces and territories, the Canadian Dental Care Plan, and now PharmaCare, we are delivering on the promise that every Canadian deserves better health care. Thank you, Madam Speaker.
Questions and comments? Questions et commentaires? The honourable member for Timmins James Bay.
Thank you, Madam Speaker. It has been one of the great failings of the Canadian medical system that we stopped at the moment where we brought in universal health care, which Canadians believe in and want, but we did not go further in bringing forth the pharmacare that every other G7 country has. But I'd like to ask my honourable colleague, considering what we're seeing now with right-wing provincial governments in Ontario, Doug Ford leaving community after community with ER closed on weekends, the fact that they will hire privatized nurses at huge cost while underfunding the public system, is he concerned that we're going to see the likes of Daniel Smith, Premier Moe, and Doug Ford try and kill a really important initiative to help Canadians, and how will we prevent them from doing that?
The honourable member for Nepean.
Thank you, Madam Speaker. I thank the honourable member for his comments and questions. He is right that the healthcare system is not perfect today. There are a lot of challenges that are being faced, and the responsibility lies with the provinces. The federal government has taken enormous steps to improve the healthcare of the country as a whole. We have allocated $198 billion, mostly to the provinces and territories, to deliver better healthcare, and I wish the provinces step up and shoulder their part of their responsibilities to deliver quality care to all residents.
And comments, the honourable member for Yorkton Melville.
I'd like to follow up that question with some facts about Saskatchewan, where our provincial government is deeply engaged in assisting, as an example, our seniors, my mother of which was one, get the medications that they need if they are not able to have their own third-party plan. So to challenge our provincial government in an area that is their responsibility, where we are doing good work, are you suggesting, or is the member suggesting through you, Speaker, that what they maybe are expecting and fearing is a reality that possibly third-party providers that exist now will just throw up their hands and no longer provide the kind of care that over 90 percentile of Canadians are already receiving, to allow this program, which will not be as efficient and far more expensive, to exist in their stead?
The honourable member for Nepean.
Thank you, Madam Speaker. Madam Speaker, healthcare is such an important thing for all Canadians. It is the responsibility of all levels of the government to work together, to work collaboratively, so that the Canadians get the quality health care they deserve. Unfortunately, certain provinces are not in a very collaborative mood when it comes to dealing with the federal government, which has taken enormous steps during the last several years to provide additional funding towards the healthcare system.
Questions and comments? Questions et commentaires. L'honorable député de Château.
The honourable member for Châteauguay-Lacolle. Thank you, Madam Speaker.
I wanted to ask my honourable colleague about why we are seeing the prioritization of diabetes and contraceptives in this bill. And as before, I knew that he himself suffered from diabetes. So I certainly am interested to hear his perspective as to why these are the two areas that we're focusing on right at this point.
The honourable member for Nepean.
Thank you, Madam Speaker. Madam Speaker, as a diabetic myself, I had a certain period of time in my life in Canada where I did not have any prescription coverage. So I understand personally how important it is that this sort of support is given to the people who don't have the coverage available to them. And as I mentioned in my speech, this is the first step. This is the first step towards dealing with that. We have to start somewhere, because contraceptive coverage and the diabetes affects vast number of people, contraception coverage, I think, is available to about 9 million Canadians, and the diabetes medical coverage is available to about 3.7 million. This is the step going towards having a single universal pharmacare system in Canada.
Reprise de débat. L'honorable député.
Resuming debate, the honourable member for Lac Saint-Louis. Thank you, Madam Speaker.
I'm very pleased to stand today and to speak in support of this bill to bring in the first stages of national pharmacare in this country. Pharmacare has figured as a commitment in the Liberal platform, and I would go further and say that it is an extension, really, of an arc of social justice that began many decades ago with hospital insurance. Before we had Medicare, we had hospital insurance. If you went to the hospital, you didn't have to pay, but then you would have to pay if you went to see your physician. And then, of course, we brought in Medicare. And on that score, I would like to come back to something that the member from Colchester said, which made me think back 50 years ago or 60 years ago, when he said, in reference to dental care, that the dental care plan results in the dentist focusing more on the relationship with the payer, the insurance companies, than on the relationship with the patient. You know, Madam Speaker, that was the main criticism, one of the main criticisms of Medicare when in 1970 the federal and provincial governments were implementing Medicare. At the time, many medical professionals, many doctors said, well, this is not good because it's going to bureaucratize our profession. We're going to have to deal with government bureaucracy, and that will leave less time to deal with patients. In the final analysis, we saw that it is a more efficient system. Doctors know that they will get paid. They don't have to hire a bill collection agency to collect medical bills and so on. So it's funny that we're going back to arguments that were raised 70 years ago when there was opposition initially to implementing Medicare in this country. But I'd like to go back for a moment to the pandemic, Madam Speaker, because I think it's important. The pandemic was a watershed moment in so many ways. I think it will take decades, really, of analysis and doctoral theses, maybe, to really understand how the pandemic changed our world. But the pandemic did something for public policy that I don't know if we think enough about. It showed us that we can deliver service, we can deliver support to citizens in ways that we never thought possible. If you had gone to the government before the pandemic and said, look, let's offer support directly to Canadians through the CRA, through payments based on attestation, you would have been shut down right away. People, you know, the bureaucrats, the politicians would have said that's absolutely impossible. And then we proved that it was possible in a crisis to bring financial support to Canadians in a very streamlined way, in a very direct way, and in a very timely way. Well, Madam Speaker, that, I think, gave confidence to governments that it could deliver other services in a very efficient way, and dental care is one example of that. If you would, I bet if, Madam Speaker, if you had gone and said we can deliver dental care directly through dentists and a company, an insurance company making payments to dental offices and so forth, people would have said, well, we can't do that. I mean, you need lots of bureaucracy to do dental care. But no, the pandemic showed us that we can do things directly and efficiently. And that brings me, Madam Speaker, to this pharmacare, this initial building block of a national pharmacare system. We've heard the Conservatives raise the specter of a national pharmacare system requiring immense amounts of bureaucracy. But we've learned from the past that these kinds of services, this kind of financial support can be delivered rather effectively. Now, we know that the provincial healthcare systems across this country are bogged down in bureaucracy. We've seen some of the tragic consequences of that. But when we're talking about the delivery of drugs, Madam Speaker, each province has a very efficient and effective pharmacy network that already liaises with governments and with private insurance companies, such that when you get a prescription, the pharmacist already knows that you're covered by a private insurer, or if you're not governed by a private insurer, they know that you're covered by the government system. So there's already a very efficient infrastructure in place to deliver national pharmacare. With the help of infrastructure set up within the provinces. So I don't believe this idea that national pharmacare is going to create a heavy burden of bureaucracy, Madam Speaker. And the member from Colchester said, well, you know, he talked about the so-called Blue Seal program that his party is putting forward as a way of recognizing credentials for foreign-trained doctors. Well, our government's already doing that. But taking away from the fact that it's already a provincial jurisdiction to recognize credentials, and we don't hear any objections about invading provincial jurisdiction when we talk about recognizing credentials on the other side. But the recognition of credentials is, in fact, something that is done by provincial colleges of medical professionals. But all of a sudden, the invasion of provincial jurisdiction doesn't seem to enter into the picture. But the point is, if you want to do that kind of thing, you're still going to need some bureaucracy. You're going to have some government employees who are coordinating something. That's just the way it is in modern governance, Madam Speaker. And sometimes I fear that the Conservatives don't understand the realities of modern governance. But I won't get into all of that right now. But in terms of the role of the federal government when it comes to pharmaceutical products, and by the way, let me go back to the CERB, Madam Speaker. You know, it's conventional wisdom that it's the provincial governments that deliver social assistance in this country. Yet during the pandemic, I didn't hear any provincial governments complaining that we were providing CERB to citizens in need. I didn't hear it then. All of a sudden, it's back in the picture. But back to pharmaceuticals, Madam Speaker. The federal government is deeply involved in the pharmaceutical industry. It does inspections of pharmaceutical companies. The Patent Medicine Price Review Board has a role in determining the prices of pharmaceuticals, and Health Canada is involved in approving drugs for safety and medical devices. So this idea that there's this clean-cut distinction when it comes between the federal government and the provinces when it comes to those kinds of products, I think, Madam Speaker, I think that's a bit of a stretch. That being said, I can speak, I think, I'm not in the government, but I think I can speak on behalf of the government, that the federal government is not seeking to manage more things. We have, you know, we've got lots of responsibilities, and if the provinces can do something well, why not? Why not? I mean, if the provinces can achieve the goals that we've set based on what Canadians want, then why not? So the federal government is not seeking to manage all aspects of pharmacare, but I think that we're responding to the wishes and priorities of Canadians in proposing this plan. How much time, Madam Speaker?
Just about a minute and a half.
About a minute and a half. Now, I'd like to come back to another argument that was raised by the Conservatives in this debate. Somehow, in a kind of twisted logic, it was suggested that national pharmacare is going to cause inflation. But I don't understand how. Now, I could be wrong. I could be wrong, Madam Speaker. Maybe I have a blind spot here and I don't see all the logic of the argument. But how can providing free drugs to Canadians who need drugs fuel pharmaceutical price inflation? Pharmacare is an affordability measure, Madam Speaker. The Conservatives claim to care so much about affordability, but every time you want to do something on affordability, free child care, pharmacare, dental care, they vote against it. I don't think they care about affordability, Madam Speaker.
Very well done. I had it a minute, Red Deer, Mountain View.
Well, thank you very much, Madam Chair. And just a couple of points, things that I've heard this morning. Of course, the NDP is talking about cuts that there were during the Harper era. If one was to look at the amount of money from the budgets over the years. When the Liberals first took power, it was the first time that it ever ducked below the 3% floor that was given. So that statement is certainly one that they talk a lot about, but it is incorrect. The other question that I would like to ask the member, and that has to do with the formularies that the provinces already have. In able to get drugs approved, we go through the federal system, but then it goes into the provinces and they make the decisions on how much they can afford to be able to cover. This is different around the country, and I'm wondering if he is at least curious about what the consequences will be when that decision comes from the federal government versus the provinces whose responsibility it is to deliver health care.
The honourable member for Lac Saint Louis.
Well, that's a very good question, Madam Speaker. And the whole issue around pharma economics is very complex because governments look at potential benefits of drug use versus the cost, and it becomes a budgetary and political decision. So what we're doing with PharmaCare is we're providing more funding so that we can surmount these political and budgetary obstacles to providing Canadians with the drugs they need for free. Thank you, Madam Speaker.
Resuming debate. Questions and comments. The honourable member for Timmins, James Bay.
Thank you, Madam Speaker. I've been listening intently to my Conservative colleagues who promise one thing, then oppose. For example, they really pushed for the suicide hotline and then voted against it, tried to cut off the funding for it. And you wonder why they do these things. But I was noticing that the Conservative deputy leader was a lobbyist for AbbVie. So this is a pharmaceutical company that jacked up medications for senior citizens by 470%. We know who the Conservatives work for. They're not there for seniors. They're not there for ordinary people. They are freaked out if people have access to medication that when they get into power, they're not going to be able to rip off seniors to benefit the lobbyists who actually are pretty much running the National Conservative Party and certainly the deputy leader. This is why we've seen their complete unwillingness to take on grocery price hikes, because the member for Stornoway's boss is a Loblaws lobbyist. I'd like to ask him what he thinks about a party that would go along with jacking up medication for senior citizens by 470% to benefit their friends.
The honourable member for Lac Saint Louis.
Well, the first thing I would say, Madam Speaker, is I hope that those individuals will not end up working in the health minister's office. That would be a tragedy, of course. But I think what's important is that we have a lobbyist registration system, and that lobbyist registration system ensures that we have the kind of information that the honourable member has taken good care to collate and to share with this House and with Canadians. Thank you, Madam Speaker.
Questions and comments. Questions et commentaires. The Honourable Parliamentary Secretary, the Government House Leader.
Yes, thank you, Madam Speaker. Madam Speaker, I'm wondering if the member can expand on his comments in regards to recognition of credentials, because the Conservatives going around misleading Canadians, indicating they got this grand Blue Seal program as if they're going to form government and all the individuals that have credentials are going to get their credentials recognized. They just got to write this Conservative exam, and miraculously they're going to be able to work in healthcare across Canada, crossing provinces and so forth. Would he not agree that that is exceptionally misleading to a very vulnerable component of our communities?
L'honorable député de Lac Saint Louis a 1 minute.
The honourable member for Lac Saint Louis, 1 minute.
And they're not just doing that with the Blue Seal program, they're doing that with climate change, suggesting that there's some kind of magic bullet that doesn't cost anybody anything and we can magically get rid of greenhouse gas emissions. So I think, yes, I think they need to be more forthcoming, Madam Speaker. I think the opposition needs to be more forthcoming and be a little more direct and frank with Canadians.
I want to remind the honourable member for Calgary Signal Hill that if he has questions and comments, he should wait for the appropriate time and not try to contribute to the debate until such time. The reprise de débat, resuming debate, the honourable member for Cariboo Prince George.
Thank you, Madam Speaker. It's an honour to rise today and speak on Bill C-64. Boy, we've heard some doozies over the last day, haven't we? And of course, it's a budget day today, so we'll hear some more doozies of the billions upon billions of dollars that will be spent and heaped on the backs of taxpayers. And
Madam Speaker, it is an honor to stand today and speak on Bill C-64. One of the reasons why it is such a great honor is I get a chance to split my time with the newly minted Conservative member from Durham, who will be taking this time. And finally, Madam Speaker, we have a true blue Conservative in Durham, and I can't wait to hear his speech. I believe it might be his maiden speech today. So he's a great member of Parliament. If anybody has not heard his story, it's a true testament that you can do anything that you want if you set your mind to it and you don't accept the barriers that life has placed before you. A cancer survivor, ruled that he was illiterate when he was in grade school, and then went to the Yale School of Law just 7 years later. I'm just so honored to share the bench with my colleague from Durham and be splitting the time with him as well. So, Madam Speaker, we're speaking about Bill C-64. That is, again, this is just yet another promise, I guess, or plan by this Prime Minister to hold on to whatever shreds of power that he has, Madam Speaker. And it is essentially just a power grab again. And we'll be talking a little bit about some of this announcement, as well as some of the other failed announcements that this Prime Minister and his NDP coalition, SPENDP coalition, have undertaken in the last 5 years. Now, Speaker, I guess one of the biggest concerns that I have with this, and from the onset, I will say that, look, I believe that if a Canadian needs medication, that we should be doing everything in our power to make sure that they have access to the medications that they need. But this bill is not a pharmacare bill. It is a plan or a promise to work towards a bigger pharmacare system. Speaker, where did we hear that previously? It was that was their dental care plan that we saw earlier on. And what are we hearing now, that less than 10% of dentists across our country are signing up to it? And so it is a failed system. I've got more on that as we go further, Madam Speaker. The Conference Board of Canada estimates that over 97% of Canadians are already eligible for some form of coverage, drug coverage. Over 27 million Canadians rely on privately administered workplace plans. Now, Speaker, I spoke with insurers. They have no idea how this pharmacare plan is going to, are they to scrap it altogether, their plans altogether? What happens to those 27 million Canadians that already have a plan, Madam Speaker? We heard earlier that through our Bloc colleagues that Quebec was not, despite what the health minister has said, that he's got a great working relationship with Quebec, but indeed that was proven wrong time and again. I believe it was the health minister of Quebec had to go publicly and said, look, there are no talks. We do not agree with what this federal minister is saying regarding health care. And so we just see it time and again with this government. I'll bring you back to 2015, where the member from Papineau campaigned on doing things differently, campaigned on being the most open and transparent government in the history of our country. That's hilarious. Wow. The one thing that he has accomplished is the most scandal-plagued government in the history of our country. And, Madam Speaker, this NDP coalition is complicit in the cover-up of those scandals. The Pharmacare Act is just another long list of bills which allow the Liberals to get in front of the camera, say they're getting things done for Canadians, when they're really just trying to pull the wool over everyone's eyes. Now, Liberals and the NDP will stand up and pound their fists and say how bad Stephen Harper was and the dark years of Stephen Harper. Guess what? Here's a news flash. Liberals have been in power for 9 years. If it was a priority for them then, they could have got it done. They had a majority, and now they have a majority with the NDP. So they could get things done if they really wanted to get things done. C-64 is nothing more than a photo op. That's it. It doesn't actually do anything concrete. It talks about to consider working towards the implementation of a national universal pharmacare. In other words, just another broken election promise. Why don't we work, why doesn't the government work with pharmaceutical companies to bring down the cost of all drugs to Canadians? That's a novel idea. Nothing mentioned in there. All we get is future promises, no plan. Let's really, truly be honest with Canadians. This isn't a pharmacare plan. It's an empty promise that will not even come close to every medication that Canadians use. Madam Speaker, I spoke about the provinces. We heard that Nova Scotia has a bit of a plan. We heard that Quebec obviously has a plan that wasn't even consulted on how they do theirs. You know, Madam Speaker, my province, BC, has the Fair Pharmacare Plan. As a matter of fact, we have 12 plans under that one plan for British Columbians to access that have troubles accessing medication. What these Liberals have proven time and again is that after 8 years that they neither trust nor respect Canadians. Apparently they also think Canadians are too foolish to see through the truth that's right before their eyes. And the truth is that after 8 long, miserable years, that the NDP Liberal government is simply not worth the cost. We say that time and time again. With this government, the choice is between costly programs or future promises, should I say false promises, and Canadians know that the NDP Liberal promises never come true. After 8 long years of this Prime Minister, there have been so many broken promises. So many. 2015, he promised affordable housing. Then he doubled the mortgage, rent, and down payment costs. It now takes 25 years to save for a down payment on the average home, Madam Speaker.
Wow.
Vancouver, you have to earn almost $250,000 salary just to afford a home. Most young Canadians believe that they'll never be able to afford a home. That used to be the dream. Now it's just a nightmare. He promised the carbon tax wouldn't cost you anything, and now we find out over 60% of Canadians pay more because of that tax. He doubled the tax. Actually, he raised it by 23% just on April 1st, April Fools to all of us. Now, Speaker, I want to quickly, you mentioned that I got about 2 minutes left. I talked briefly about the pharmacare. I want to read this quote, or the dental care. I want to read this quote from a dental office in Prince George. What has been put out to the public as far as the coverage is totally not true. What they said to the public, what the government has said, is that this is free dental, and it's nowhere close to being free dental, unfortunately. That's why there's frustration from the patients who are signing up and phoning around saying that they have free dental now, and we have to give them the bad news. This lady continued, there hasn't been a whole lot of information released to dentists, and they won't give any more information until you register. They haven't even been totally honest and transparent with the dentists, and the dentists are leery of signing up. It's confusing for all of us because we haven't been getting all the facts. Until these facts are better explained to dental offices and dentists and owners, they're not going to register for something they don't know what they're getting involved in. Madam Speaker, that is par for the course with this government. They stand before the public and the cameras, perhaps with a tissue in their ear or in the eye, and they put their hand on their heart and they say they care, they truly, truly care. The reality is they're not doing the work, Madam Speaker. And you have people across the way, good people across the way, that are actually waking up and seeing the failures of their front bench and the lies of their front bench, Madam Speaker. You know, Madam Speaker, it's about time that this failed NDP Liberal coalition moves out of the way so the member for Carleton, Canada's future Prime Minister, can start righting the wrongs of the last 8 years. It's going to be tough, Madam Speaker. It's going to be tough. But we have the team, and we're ready to do it.
Here, here. Questions and comments. The honourable member for Humber River Black Creek.
Yes, thank you to my colleague for his comments. I must say I disagree immensely with almost everything from the start to the end of the kind of comments that he made that, of course, I'm not going to add to it. but I'd like to know what he would be doing or what your government would be doing, if your party would be doing, if they have an opportunity to become the government, which I hope they don't actually, because I look back on the years of the previous Conservative government, and it was a question of taking away and deteriorating health care. I think the dental program, the pharmacare program is really, really important to all of my constituents. I'm not getting the complaints that my colleague was saying. They're very grateful to have that program and are already using it. And I would expect that my colleague has many people in his constituency that would be very glad to be able to access that program. And is he at a point to eventually support that program?
I want to remind the member a couple of times that she actually was directing it directly to the member, but she did correct herself at the end. The honourable member for Caribou Prince George.
Right across each other, she was making eye contact with me. I understood what she was doing, Madam Speaker. And Madam Speaker, I have a great respect for my colleague across the way. Madam Speaker, first and foremost, what we would do, and I believe my honourable colleague from Cumberland Colchester mentioned it earlier before, a former physician himself. We have to first eliminate the wait times that Canadians face. Like 6 million Canadians can't get a primary care physician. You can't get your medication if you need that. Well, we would work with the pharmaceuticals writ large to make sure that we're driving down the cost. We work with PMPRB. We may even just revamp PMPRB so we're getting those drugs approved faster so that Canadians with rare diseases can get the drugs that they seem to be getting, their friends and families seem to be getting in other countries faster so that they can be looked after sooner. We'd develop a rare disease strategy so that those Canadians that are struggling with rare diseases can get the help that they need when they need it.
Comments. The honourable member for Courtenay Alberni.
Again, we know the Conservatives have consistently opposed pharmacare. We heard my colleague from Timmins, James Bay, highlight that the Conservative deputy leader was a lobbyist, Madam Speaker, for AbbVie, a large pharma company in North America that jacked up its prices on medications for seniors by over 470%. Who really needs pharmacare lobbyists, Madam Speaker, when you have Conservatives here? So my question through you, Madam Speaker, to my colleague, and I want clarity because I heard him say and mislead this House that people in British Columbia are covered for insulin. That is not true, Madam Speaker. So through you, Madam Speaker, will my colleague, I'm going to give him another chance to clarify that insulin is not free in British Columbia. In fact, it is a huge cost to many British Columbians, especially working class British Columbians. And is he going to oppose those British Columbians that require insulin? Is he going to oppose this legislation that's going to provide them the support that they need on life-saving medication, especially when someone loses their job, Madam Speaker, and their deductibles no longer in reach in their affordability levels? I'd like some clarification, Madam Speaker, from my colleague from Prince George. Thank you.
I just want to remind the honourable member he might want to retract something that he said that the honourable member misled the House. He knows that he can't say indirectly what he can't say directly.
He said it directly.
Yeah. So the honourable member. Perfect. Okay.
Madam Speaker, because
the honourable member withdraw, and I'm sure that the honourable member
speaking on behalf of British Columbia and saying that he was not, that they are not covered, Madam Speaker, that they are fully covered. That is not true, Madam.
So again, the honourable member withdrew. He doesn't need to elaborate. I just asked him to withdraw. And so the honourable member for Caribou Prince George.
Well, Madam Speaker, most of his minute-and-a-half-long rant was incomprehensible, or I couldn't understand what he was saying, Madam Speaker. So, but the one comment that he did mention is they like to point fingers at other groups and lobbyists, and I'll remind this member that his leader's brother himself is a lobbyist for a big grocer, Madam Speaker. They may not like the answer. They obviously don't like the answer, so they're shouting out over top, Madam Speaker.
Members, they have an opportunity to ask questions, but unless they're being recognized again, they shouldn't be yelling out or trying to ask other questions. So the honourable member for Caribou Prince George.
Madam Speaker, it's unfortunate that when we speak the truth here, they get up and they take offense to it because all that they want to be on the record is is their misinformation, Madam Speaker. And they can say everything that they want about Conservatives, but when we fire back at them, they take offense to it, Madam Speaker. And I hope I didn't hurt his feelings by not answering it, but I'm sure that we'll speak offline and we'll hug it out afterwards, Madam Speaker. With that, I'll end it.
I have a point of order. The honourable member for Timmins James Bay.
We've seen a lot in this House, but since the member couldn't answer the question, he doesn't need to attack the emotion of my colleague. He doesn't need to hug him. He needs to tell the truth. It's a simple thing.
This is a point of debate, not a point of order. Resuming debate, reprise de débat, the honourable member for Durham.
Madam Speaker, I rise in the chamber today as Canada's newest Member of Parliament, elected to represent the riding of Durham. And I have a very clear message to deliver on behalf of my community in Durham. We are tired of the Prime Minister's broken promises. We are tired of the Prime Minister promising to fix this and fix that, and in return what we receive is a life that is harder and more expensive. Madam Speaker, we believe that Canadians deserve better, and we believe that the topic of debate today, pharmacare, is just the latest example of the Prime Minister promising big things only to disappoint the people of Canada. Now, I put my name on a ballot, and I wanted this job as Member of Parliament because despite the Prime Minister's best efforts, I am optimistic and hopeful about the future of this country. I believe that once we have a new leader in this great land, we will see brighter days ahead. Hear, hear. And my optimism does not come from these big deficits or these big budget announcements. My optimism comes from my knowledge of the people of Canada and the people of Durham. My optimism comes from people like Kirk Kemp, who runs one of the biggest and most important agricultural businesses in Canada, Algoma Orchards. And as he becomes more successful in his business, he only gives back more to our community, supporting initiatives like the Bowmanville Hospital redevelopment. My optimism comes from people like Dr. Khan Chandra, a dentist in Curtis, Ontario, who has built a tremendous business, provides for his family, and gives back to our community as a connector for Durham's growing Tamil community. And my optimism comes from Kim and Leon Morrow over on Taunton Road East in Oshawa, who scrape together every spare dollar they can find and every spare moment to provide guidance and mentorship to young men and women who may otherwise fall into the pitfalls that await struggling youth. But Kim and Leon have their backs, and that is why I'm hopeful about the future of this country. You see, Madam Speaker, I'm very honored to stand here in this beautiful building, and I appreciate the chance to dress up in a suit and a tie. But my heart was not shaped in places like this. My heart was shaped by people like my grandfather, Robert McFarland, rest in peace. My grandfather, who worked as a school custodian for decades in the Toronto District School Board. A man who swept the floors and mopped the floors, who kept the classrooms tidy, who locked up at the end of the night so that children had a place to learn and teachers had a place to work. And I carry his story with me. I come into this job very much a servant, like my grandpa. I am here to protect what makes this country special, to protect the rights and freedoms of Canadians, to make sure that this country continues to be a place where people from all over the world can come and find a better life. People like my grandpa, who came here from Scotland, my grandmother, who came here from Ireland, and my father, who came here from Kenya. Now, I am aware that there is a liberal playbook that gets used against people who disagree with this Prime Minister. A playbook that likes to marginalize and vilify anyone who has the audacity to stand up and say what is happening in this country right now is not right. And that playbook the Prime Minister likes to use, likes to cast people who disagree with him as racists. And I would be welcoming the Prime Minister to try that with me. You know, based on our history, I don't think that's going to go so well for him. But I also believe that he is completely out of touch with the needs and desires, the hopes and dreams of our very diverse country and the diverse communities like the one I represent in Durham. He's welcome to take his claims that people who disagree with him are racist to my African father and see how that goes for him. He also uses this liberal playbook to marginalize and vilify Canadians who disagree with him by calling those of us who believe in traditional family values bigots. And I say to him, come to my riding, my diverse riding in Durham, and try that on us, where we have Christians and Muslims, Sikhs, Hindus, and Jews living together, all people who believe that mothers and fathers matter. He's welcome to try that with us. And I know his liberal playbook also likes to say that people who disagree with him don't care about the working class or don't care about vulnerable people. And I don't think that's going to work on me either. I am not a trust fund baby. Like most people in this country, I have clawed and I have scraped and worked hard for everything that I have. I don't think the Prime Minister can say the same thing. And the reality is this. He's welcome to try that message on people like my mom. She'd love to have a conversation with him. A woman who raised 3 children by herself. 68 years old, sorry mom. Continues to work hard every day because she cannot afford to retire in this NDP Liberal economy. The Liberal playbook is not going to work. They can try their greatest hits. Tune up the guitar. Tune up the banjo. The greatest hits aren't hitting anymore. And I'm here to deliver that message very, very clearly on behalf of my community in Durham and anyone else in this great country who is unhappy with what is happening and frustrated to feel like they are not able to say what is happening in their hearts and their minds, do not feel validated and affirmed by the reality they experience, not being echoed by many of the institutions across this country who have bought into a narrative that simply does not reflect reality. Now, with the remainder of my time, I'd like to also deliver a message to any young men and young women across this country who might hear my words. My presence in this chamber is a glitch in the system. I'm not supposed to be here. When I was 15 years old, I failed the Ontario literacy test. I was labeled illiterate by the Ontario education system. But I'm here. At the age of 30, I was diagnosed with stage 4 cancer. I sat in a recliner with an IV in my arm pumping my body with chemotherapy drugs. I laid on a hospital bed as radiation lasers ran along my spine for months. But I'm here. I took on woke censorship from corporate Canada, looked them dead in the eye, and I'm here. And I've been the subject of hit piece after hit piece from liberal news media. And guess what? I'm here. Yeah. The reality is that many young men and young women are facing a variety of challenges across this country right now, some of whom are facing things that I can't even fathom. But as long as I stand in the House of Commons, as long as I'm honored to call myself a member of Parliament, I hope that I can be a walking, talking reminder that you should never give up. Don't give up on yourself, don't give up on your family, don't give up on your community, and don't give up on this country. And as long as I'm here, I won't give up on them either. Thank you.
Great job.
Questions and comments, questions et commentaires. The Honourable Parliamentary Secretary of the Government House Leader.
Yes, thank you, Madam Speaker. And I did want to thank the member for sharing his personal stories and to congratulate him on his first speech here in the chamber. I did have one very brief question in regards to the member, and is that could he give his personal perspective on the principles of a national pharmacare program?
The Honourable Member for Durham.
Well, my concern in being asked about pharmacare is that I'm being drawn into a debate which sort of assumes that the Liberal NDP government is going to do what they say. And I think we've seen over the course of the last 8 years that is simply not going to happen. We have a country full of people, tens of millions of people, who have been led to believe over and over and over again that the Liberal NDP government and this Prime Minister are going to deliver for the hardworking people of this country. And yet, that has never happened. So before I would discuss anything like the principles of pharmacare, I'd like to be convinced that anything substantive is actually going to happen for the people of Canada. And I'd love to be able to go back to my riding and say, you know what, they have a plan for us here. Unfortunately, everything I've seen since I got here last Monday has indicated otherwise.
Questions and comments? The honourable member for Courtenay Alberni.
Well, Madam Speaker, I'd like to join my colleagues in congratulating my colleague on his election, on his first speech. And Madam Speaker, I recall a great quote from Scott Bryson, who sat both on the Liberal bench and the Conservative bench. When he sat in this House, he said that regardless, and obviously I don't share a lot of the policies of the Conservative Party, he said, but regardless of where you sit in this House, you can make a huge impact and difference for Canadians. And I hope my colleague will also take that into heart and working collectively with each other to try to find solutions to support Canadians as we walk forward together. But Madam Speaker, to the question of insulin, and I know my colleague cited the delays of the Liberal government, I agree, but does he believe that insulin, free of cost, no charge, would be a benefit to his constituents, and would he be willing to work with us to find a pathway to expedite that? Thank you.
The honourable member for Durham.
You know, when I was a cancer patient at North York General Hospital and Sunnybrook Hospital, I saw many people in very dire health circumstances, people facing all sorts of challenges, some of whom I shared a cancer ward with. And what was very clear to me is that we need programs that can help people who don't have the money to purchase drugs that they need. What we had in that cancer ward at North York General Hospital was a provincial program to help people afford drugs. And what I continue to be confused about as I hear this debate on pharmacare is why exactly there is not greater recognition of the need to work with the provinces in order to solve some of these problems. I saw people right beside me hooked up on the same IVs as I was, getting their bodies pumped with chemotherapy drugs, who depended on those provincial programs in order to get the health care that they needed. And what I worry about, and I think my fellow cancer patients at North York General Hospital would worry about, including cancer patients all across this country, is whether this is a matter of creating more bureaucracy here in Ottawa, or if we're actually concerned with providing people with what they need at an affordable price.
Questions and comments? Questions et commentaires. A brief question. The honourable member for Cumberland Colchester.
Thanks very much, Madam Speaker, and thank you to my colleague from Durham for his fantastic speech. You know, you've had the opportunity to knock doors very recently, and I wonder if you can enlighten the House of the issues that you...
To address questions and comments through the chair and not directly to the members.
I apologize to you. He's caught up in the moment, Madam Speaker. If the member through you, Chair, Madam Speaker, could elaborate on the issues that he heard knocking on the doors in his most recent election for all of Canada to understand what the issues are out there, Madam Speaker. Thank you.
The honourable for Durham has a brief question, please. He's got 50 seconds to respond.
The short answer to my colleague's question is simply affordability. People from all ages, whether they be seniors concerned about their pensions not being able to afford a good quality of life, people my own age living in their parents' basement hoping to move out and start a family one day, across generations, across cultures, across languages. What is uniting Canadians right now is concern over affordability and concern over whether the NDP Liberal government can actually make life easier so we can move forward in our lives in this country. Thank you.
Hear, hear.
Resuming debate, the Honourable Government Deputy House Leader.
Thank you very much, Madam Speaker, and it is a real pleasure to rise today to speak to a very important piece of legislation, Bill C-64. I will be sharing my time today, Madam Speaker, with the member from Humber River, Black Creek. And you know, this is important legislation, Madam Speaker, because for decades we have been talking about the need to bring in pharmacare, and I look at this as the first step. The first step to bringing in pharmacare that can cover a whole host of drugs and medicine that are very important for people. And like the member from Burnaby who was speaking earlier, I would agree with him that this is about preventative healthcare. This is about helping people before they get to the point where they are going to be needed to go into an emergency room to get them to very important medication. And so when we have an issue like this, Madam Speaker, that further builds on the healthcare system that we have, a healthcare system that has developed over generations through very difficult at times partnerships and relationships with provinces. I was very disheartened to see that in the very first speech on this issue, when Conservatives stood, all they did was bring in a motion to amend this bill that basically just says that we substitute everything under the words "at" with "the House declined to give second reading." That's all they did. They just said, and now they're clapping. And now, okay. So now you have Conservatives that are clapping as a result of, this non-motion. They could have just voted against it and just said, no, we're not interested, and voted against it. But instead, all they've done is introduced a second vote of 10 minutes to basically just have to vote down their motion before we vote in favor and pass this very important piece of legislation. And I imagine, Madam Speaker, that much like the piece of legislation on sustainable jobs that we finally voted on yesterday, there will be obstruction after obstruction with regards to Conservatives playing with this bill at committee and at various different stages in this House. And so I ask myself, why, Madam Speaker, why are Conservatives so dead set against legislation like this? Well, because, in my opinion, Madam Speaker, this is about helping people, in particular, people that really need help. The vast majority of the donors to Conservatives, Madam Speaker, and the people that they look to off fundraising all the time are individuals, quite frankly, who can probably afford to have private insurance or work in a job that provides them with insurance. The individuals who I see that will really benefit from this legislation, Madam Speaker, are vulnerable individuals in our society who aren't covered by health care plans, pharmacare plans currently, or who don't have insurance in one way or another. And I know that, one of the criticisms that we hear from Conservatives, Madam Speaker, is well, why, what about this being provincial jurisdiction? Conservatives have said, well, this is provincial jurisdiction. Why did you get in the way of it? Well, then I asked them, why did they vote in favor of the National Child Care Plan? I mean, they got up and they talked down the plan for hours on end, but then ultimately ended up voting in favor of it. Well, that was something that we needed to work together with the provinces on to make it a reality. And the Conservatives saw benefit in voting in favor of that, and so they did. But, they can't seem to see the same on this particular issue, Madam Speaker. And so what this bill does, Madam Speaker, is it introduces pharmacare by first setting up the system to provide for two drugs: insulin and other related drugs specifically for individuals with diabetes, and contraceptives. And I think that this is extremely important, Madam Speaker. There are 9 million women and gender diverse Canadians all across the country that will get access to the contraception and reproductive autonomy that they deserve. And I think that this is really important in the current context that we're in, Madam Speaker, and I'll explain why. Because right now, when we look south of the border, we're literally watching state legislatures, and we're watching the Supreme Court make rulings that are further confining the ability of a woman's right to choose. We are seeing legislation being adopted that is, something that would have been dreamt up, that you would have assumed we had moved, that the United States had moved away from decades ago. And so I think that for Canada to stand up from a very progressive position and say, we will not go down that same road as the United States despite the fact that many Conservatives, I'm sure, would love to, we will not do that. We will ensure that not only does a woman have the right to choose, but that she has free access to the necessary medication and for contraceptive purposes specifically. So I certainly will be voting in favor of this, Madam Speaker, and I look forward to when this bill comes to the House so that we can have that vote if the Conservatives let us end up getting there.
Questions and comments? The Honourable Member for Central Okanagan, Similkameen Nicola.
Thank you, Madam Speaker, and to the member who just spoke. In my province of British Columbia, we are actually sending cancer patients for therapy in the United States. Does he have concerns that provinces are sending to the American system that many Liberals, including this Minister of Finance or Minister of Health, have said we don't want to go to the United States system, yet our public health care system in British Columbia is sending patients. And here we are talking about expanding more bureaucracy when we have provinces like mine that are sending patients. What does he have to say about that sad state of affairs, Madam Speaker?
Good question. The Honourable Deputy Government House Leader.
So if I understand the member correctly, Madam Speaker, what he's saying is my province has to send people to the U.S. for treatment, which I don't know. I'll take his word for it that at least he believes that. He's saying my province has to send people to the United States. Therefore, we shouldn't try to do anything else to help Canadians. This legislation is about developing a national framework. I'm sorry that there are issues in his province with health care. He should come to Ontario. I'd love to have a chat with him about the issues that Doug Ford has created in Ontario. But that's besides the point, Madam Speaker. What we're talking about is developing a strategy, a national strategy as it relates to pharmacare. This member can find all the excuses in the book that he wants to try to vote against this. But at the end of the day, what he's going to do is he's going to vote against helping vulnerable Canadians in particular get access to medications that they need.
Hear, hear. Questions and comments. Questions et commentaires. L'honorable député de Châteauguay-Lacolle.
The Honourable Member for Châteauguay-Lacolle.
My colleague with great interest, and I know that he's a great advocate for health care for Canadians. I'd like to ask him about the situation in Quebec. Maybe he's not that familiar with it, but we did hear how many unions are actually in favor of our health care plan, even if they have employer drug insurance. Thank you.
L'honorable député de Kingston et des Îles.
Well, see, and I think this is an excellent question, Madam Speaker, because what you have is you have different levels of coverage throughout our country. And those levels of coverage, directly or indirectly, are going to correlate to individuals that are more wealthy versus individuals that aren't. So somebody that works in a corporation, probably an executive high up in the corporation, probably has really good coverage. And then there are going to be, even within the unions, different levels of coverage. This is about accepting and realizing and coming to the conclusion that we all deserve the exact same level of coverage, regardless of who you are or where you work or what your income is.
Questions et commentaires. L'honorable député de Montcalm.
The Honourable Member for Montcalm. Thank you, Madam Speaker. Well, we've just seen that the member from Quebec knows nothing about the Quebec Pharmacare program. Everyone is covered with access to the same drugs, and everyone is covered equivalently. The answer we had shows very clearly that this government does not know what it's talking about when it comes to pharmacare, and they're just going to create trouble.
Member for Kingston and the Islands.
Well, he's referring to the question that was previously asked me, not my answer, but I would say maybe the member didn't hear what the question was, but the question that the member asked me was specifically about union support for this. And in Quebec, in particular, unions in Quebec that support this. So I would encourage my Bloc colleague, who stands up quite often for the workers of Quebec, to consider what the union folks in Quebec are saying about this legislation. And from what I hear, they're saying that they're supportive of it. So maybe the Bloc should really give some consideration to that if they when it comes time to vote for this.
Hear, hear.
Statements by members. Déclaration de député. The honour member for Yukon.
It's a different world up here in the Yukon, and Madam Speaker, I'm going to tell you a few reasons why. Starting north on the Dempster Highway, have the hike of your life in the magical Tombstone Mountains. Then drop into Dawson City, dine at the Bonton, where each delicious bite is locally sourced. Then get to the downtown for the sour toe cocktail. Yes, Mark, a real toe that must touch your lips. Then sally on to Diamond Tooth Gertie's for a look at the showgirls and a round of roulette. Sleep at Bombay Peggy's, a Victorian inn with a lubricious past. Yes, tourism is big in the Yukon thanks to supports like the Tourism Growth Program and the Indigenous Tourism Fund. And the Yukon itself, Mr. Speaker, is gold. Now, winter in the Yukon, it's a little bit metal, they say. We have snowmobiles, mountains, trails, ice fishing, skiing, fat biking, and after it all, come soak in the soothing pools of Eclipse Hot Springs as you gaze up at the northern lights. Summer, fall, or winter, we don't really do spring. It's a different world up here, but be warned, once in the Yukon, you may never leave.
Here, here.
The Honourable Member for Lévis-Lotbinière. Mr. Speaker, it is with great pride that I will once again be Honorary President of the 2024 edition of the Canadian Cancer Society's Lotbinière Relay for Life, which will take place on June 8th. This relay is a symbol of perseverance and a message of hope for people affected by cancer. Since 1999, participants of all ages have been taking turns walking along a trail or a path. This event will take place at Parc Terry Fox in Saint-Apollinaire from 7 p.m. to 7 a.m. the following day. The funds raised at this long-awaited event will be used to support innovative research projects for all types of cancer, to provide the largest support network to improve the lives of cancer patients, and the funds will also be used to shape public health policy. I encourage you all to form teams and to come walk with me at the Lotbinière Relay for Life for this worthy cause, which is very important to me. Thank you very much, Mr. Speaker.
The Honourable Member from Nepean. Thank you, Mr. Speaker. The month of April marks Sikh Heritage Month. Is an opportunity for us to reflect on, celebrate, and educate future generations about the important role that the Sikh Canadians have played and continue to play in communities across the country. Saturday, April 13, many of us celebrated Vaisakhi, which marks the creation of the Khalsa and the Sikh Articles of Faith. Canada is the home to over 770,000 Sikh Canadians, making it one of the largest Sikh diasporas in the world. Since the arrival of the Sikh immigrants in the late 19th century, Sikh Canadians have contributed immensely to Canada's social, economic, political, and cultural fabric. This month and beyond, let us recognize and embrace the diversity that makes our country strong and inclusive. Thank you, Mr. Speaker.
The Honourable Member for Berthier-Masquinongé. This afternoon, the Senate will vote on C-282 and the future of supply-managed products ahead of the upcoming international negotiations. We call on members of the Senate to respect the clear vote of the House of Commons at third reading. We call on them, thus, to vote in favour of committee study of C-282. We need to protect supply-managed sectors because that guarantees a strong agricultural industry. When we support supply management, we guarantee thriving, prosperous communities and towns. Above all, what supply management is, it's about neighbors providing high-quality local products for their communities, and this is how we can guarantee our food security. Members of the Senate, we are asking you to vote in favor to ensure the future of our villages and communities. Thank you. Mr. Speaker, it was a privilege to welcome French Prime Minister Gabriel Attal to Canada last week. This was his first foreign visit outside of the European Union. In my capacity as president of the Canada-France Interparliamentary Association, I also met my French counterparts, Christopher Weisberg, president of the France-Canada Interparliamentary Association, and Senator Yann Chantel, president of the France-Canada Interparliamentary Friendship Group in the Senate. Canada and France have a long shared history and a deep friendship. We celebrated that history and friendship when we gathered at the Monument Amicitia France-Canada at the Beechwood National Cemetery on April 11th. Canada and France remain strong partners who share many priorities, such as climate change, the Francophonie, innovation, and countless other priorities. I would like to thank the entire French delegation for this wonderful and productive visit. Thank you.
The honourable member from Kelowna Lake Country.
Mr. Speaker, today I would like to commemorate a dear friend, Shel Sandin. Shel passed away on March 23, 2024 at 91 years old and was predeceased by his wife, Hazel. He retired as an air traffic controller in 1988, also worked in construction and was an avid traveler. Shel is survived by his nieces, nephews, and many other relatives in Canada and Sweden. Shel gave back in many ways, supporting local fundraisers and helping people who needed a hand, like driving friends to appointments. Shel had a great memory, was a wonderful storyteller, and loved politics. He would start a conversation by saying, "I put out signs for Diefenbaker." Shel was the head sign guy on campaigns for all levels of government locally. His wooden sign design has been duplicated all over Western Canada. In politics, he was always the first to volunteer, mentor others, and was a serious campaigner. My family, Larry, Daniel, and I send our deepest condolences to the Sandin family. We love you, and we'll miss you, Shel.
The honourable member from Davenport.
This week is National Tourism Week, when we celebrate a pillar of the Canadian economy that employs nearly 1 in every 10 Canadians. In my constituency of Davenport, we attract many tourists to places such as the Museum of Contemporary Art Toronto, the Drake, the many amazing art galleries, as well as countless cafes and foodie restaurants on Dundas West, West Queen West, and Ossington Street. In addition, across Canada, business events represent 40,000 of all tourism and over 25 billion in direct GDP. That's why our federal government has invested $50 million in the International Convention Attraction Fund through Destination Canada, poised to inject another $170 million into our economy. This demonstrates our federal government's commitment to economic growth, job creation, and it positions Canada as a global hub for business excellence and innovation. Tourism truly brings people together. Thank you, Mr. Speaker.
The honourable member from Labrador.
Thank you, Mr. Speaker. April marks Cancer Awareness Month and an important time to spotlight the impact of cancer, recognize advancements in treatment, and extend support to those affected. Last week, I had the privilege of meeting with the Cancer Society and listening to the inspiring stories of brave individuals battling this disease. It's crucial to acknowledge the deep disparities in cancer risk, care, and costs that can significantly affect treatment outcomes and overall experiences. The Canadian Cancer Society is tirelessly working to bridge these gaps, striving to improve healthcare outcomes for the 2 in 5 Canadians who will receive a cancer diagnosis in their lifetime. On a personal note, as a 2-time breast cancer survivor, first diagnosed at age 42, I cannot stress enough the importance of opening regular mammography testing for women age 40 and above. It should be available to all Canadians. It's a simple step that can save lives of your own or those you love. So let's all unite in the fight against cancer, raise awareness, and advocate for better health.
The honourable member from Carlton Trail, Eagle Creek.
Yesterday, the Procurement Ombuds published his damning report of this government's cozy relationship with McKinsey. McKinsey was led by Dominic Barton, a close advisor and personal friend of the Prime Minister. Barton and McKinsey were responsible for turbocharging opioid sales, fueling the opioid crisis we face today. The Ombuds found that the Liberal government changed the requirements for contracts to allow McKinsey to qualify. In one instance, they even disqualified the winning bid to ensure McKinsey got the contract. Then they switched to sole source contracts, giving McKinsey tens of millions of dollars without any justification. We've also learned that a minister personally approved one of these sole source contracts worth $5.7 million. No wonder the NDP Liberal coalition blocked Conservatives from getting the unredacted documents they asked for. This cover-up must end. Conservatives deserve answers.
Yeah.
Right. The honourable member from Windsor-Tecumseh.
Mr. Speaker, a year after we landed in Canada, my father was still looking for work. He hopped on a bus from Scarborough to Windsor for a job interview at a manufacturing plant. The interview went late. He missed the bus back to Toronto. It was dark and he was hungry. He didn't know anyone in Windsor. So he looked up the address of the Ursuline Sisters near Holy Trinity Catholic Parish and walked the 5 kilometers. Sister Małgorzata Górska opened the door, invited my dad into the warmth, and brought out supper. Sister Małgorzata knows the story of immigrants, having arrived in Canada in 1965 to open the first Ursuline convent in North America. It is the way of the Ursulines to live in service and kindness. I want to take this opportunity to wish Sister Małgorzata a happy 104th birthday and to say thank you for helping my dad that night, for getting him on a bus back to Scarborough. The next day, the phone rang and he got the job, and Windsor became home.
The honourable member from Bay of Quinte.
Mr. Speaker, there are 2 sureties with this tax and spend Liberal government: high taxes and high spending, the result of which has been high inflation and high interest rates, which means Canadians are facing an affordability crisis with high food and costs of homes that are out of control. But it's much worse than that, much worse. After this budget, Canadians are going to see higher taxes, higher prices, and higher debt, with a carbon tax hurting our farmers and our citizens, with the worst housing crisis in a generation with 10 cities across this whole country, and spending that is out of control on programs that are actually worse. Margaret Thatcher said it best when she said the problem with this sort of government is you eventually run out of other people's money. Mr. Speaker, it's easy to fix, so easy even a toddler can get it because it's as easy as ABC. Axe the tax, build the homes, and cap the spending. So let's get the grown-ups in government and let's bring it home.
The honourable member from Flamborough-Glanbrook.
Mr. Speaker, knocking on doors throughout the Hamilton area over the past 2 weekends, the message from Canadians is very clear. Life is unaffordable, mortgage payments and rents are through the roof, and an entire generation has given up on home ownership. Today is the day that this NDP Liberal government can actually listen to Canadians and help alleviate their very real worries. That's why, in today's budget, Common Sense Conservatives are calling on this NDP Liberal government to help Canadians survive. Stop doubling the housing costs. Stop taxing our farmers and food. Stop the inflationary deficits that are driving up interest rates. Stop endangering our social programs and jobs with more and more debt. This Prime Minister is not worth the cost. So today, will he please just stop?
The honourable member for Vimy. Thank you, Mr. Speaker. Honourable members, as we launch National Tourism Week, let's reflect on the tremendous economic value that tourism brings to Canada. The tourism sector accounts for 1 in every 10 jobs in Canada. 4 in every 10 jobs in tourism are in rural areas. Also, Canada's tourism sector supports 623,000 jobs and 232,000 businesses.
The best is yet to come. Just this year, we launched the Ministerial Tourism Council, announced the International Convention Attraction Fund, estimated to attract $170 million to Canada's economy, and unveiled the Indigenous Tourism Fund, the largest investment in Indigenous tourism in the country's history. Célébrons le potentiel.
Let's celebrate the potential and resilience of Canada's tourism businesses,
especially as they continue to rise to new heights.
The honourable member from Vancouver East.
As of March 23, 2024, the Safeguarding National Security Bill in Hong Kong has passed, escalating arbitrary arrests, detentions, and imprisonment for Hong Kongers who protested the implementation of the national security law in 2020. The Liberals say they stand with Hong Kong, yet IRCC's processing time for the Hong Kong Lifeboat scheme went from 6 months to 21. Hong Kong Link reports that over 8,000 applications applications are stuck, and while people wait, their work permit and study permits are expiring. They have lost jobs, healthcare coverage, and access to education for their children. Priority processing of these applications need to continue. To help cut red tape and expedite processing, I'm calling on the government to automatically renew temporary permits of PR applicants from Hong Kong and to eliminate duplication for criminal record checks. Canada must prevent human rights defenders and pro-democracy activists seeking safety from being forced to return to Hong Kong.
Hear, hear.
The Honourable Member for Saint-Jean. 100 days. Some 500 employees at military bases across Canada have been on strike for almost 100 days. These are men and women who, on a daily basis, support and accompany members of the armed forces, veterans, and their families. These workers have been on strike for almost 100 days, but they're not asking for so much. These workers, who are paid up to 60% less than their civil service counterparts, are simply calling for an old order in council that relegates them to the role of second-class workers to be repealed. They perform the same day-to-day tasks as civil servants, and all they want is for that to be recognized. The government has just announced an update of its defense policy, which focuses on recruitment and retention challenges in the armed forces. So the timing could not be better to finally support those who support the forces on a daily basis. Minister, it is time to repeal the 1982 Order in Council. Non-public funds workers deserve this respect, and the Bloc Québécois stands with them.
The Honourable Member from Bow River.
Today, the NDP Liberal government will table another inflammatory budget that will be inflationary, that will punish working Canadians by increasing taxes and drive the cost of living even higher. Exemplary community leaders like Jackie Murray, who was a proud Canadian and knew the importance of being a responsible steward of the tax dollar, would write me consistently to axe the carbon tax, restore the Canadian principles, and defend our nation's interests. So today, the common sense Conservatives have three ideas that we need to do. Instead of hiking the carbon tax again, they should axe the carbon tax. That's right. So farmers and food can be done by passing Bill C-234 in its original form. Instead of announcing more failed programs, they should build homes, not bureaucracy. Get the shovels in the ground and get the structures in the air. Canadians had enough. Stop the hurt until the Conservatives can fix the Liberals' NDP costly calamity.
The Honourable Member from West Vancouver, Sunshine Coast, Sea to Sky Country.
Mr. Speaker, from breathtaking natural beauty, unique Indigenous cultures, epic outdoor recreation, lively festivals, and delicious foods, Canada has what the world wants to experience. Tourism is the lifeblood of our nation. It's present in every town and city across our country. It contributes over $109 billion a year to Canada's economy, and it employs nearly 1 in 10 Canadians. It's powered by over 2 million tourism workers that expertly showcase and host visitors to our country's finest. These individuals are more than just employees. They're cultural ambassadors that unite us as a proud nation. I salute all those that make our tourism sector what it is, while we recommit as a country to work with you to make it even better. Happy National Tourism Week, Mr. Speaker.
Questions, questions orales. L'honorable chef de l'opposition.
The Honourable Leader of the Opposition. The common sense Conservatives will cut taxes, build homes, fix the budget, and stop the crime. However, this Prime Minister is not worth the cost. After 8 years, he spent huge sums of money with huge deficits and tax increases, and thought that somebody else would pay. But he's not this millionaire prime minister or his friends who will pay. It's always the welders, single mothers, seniors who will have to deal with the increased cost of groceries and the doubling in the cost of housing. The Honourable Minister of Immigration, Mr. Speaker, what Canadians heard is a leader who doesn't have a vision, no ambition, and no plan. On this side of the House, we understand that Canadians understand that a country with ambition is a country that invests. It's a country that invests in more jobs, that invests in building more housing, that has more growth, Mr. Speaker. On this side of the House, we will continue to focus to fight for Canadians every day, while the Conservatives will invite a new slogan today, Mr. Speaker. The Honourable Leader of the Opposition. His ambition is to replace his boss. And he's not the only one. He's not alone. He wants to fire this Prime Minister who is not worth the cost after 8 years. Results speak for themselves. He doubled the cost of housing, increased the cost of groceries, and now he's doubled the national debt. The results are poverty and exorbitant prices for Canadians. Why another $40 billion? Why will another $40 billion change the results today? The Honourable Minister of Innovation, Mr. Speaker, the only ambition on this side of the House is to work every day for Canadians, and that is exactly what we've done for the past 8 years. While the Conservative leader is inventing a new slogan every week, Canadians know full well that slogans don't build homes. Slogans don't build growth, Mr. Speaker. Slogans don't create jobs. They've been there for 8 years, Mr. Speaker. When's the last time that the Conservatives created a single job in this country? On this side of the House, we're going to fight every day for Canadians. We're going to present a responsible budget, and we will continue to ensure growth for this country, Mr. Speaker.
The Honourable Leader of the Opposition.
Common sense Conservatives will axe the tax, build the homes, fix the budget, and stop the crime after 8 years. This Prime Minister is not worth the cost. The results are in. He told us that if he massively increased debts and taxes, that someone else would pay for it. But of course, the Millionaire Trust Fund Prime Minister and his billionaire friends who invite him to private islands never pay a dime. It's always seniors, small businesses, and single mothers. Why would it be any different this time?
The Honourable President of the Treasury Board.
Mr. Speaker, in this budget, like all others, we will take into account the economic context as well as the needs of Canadians. That means for millennials and Gen Z as well, we will unlock supply in housing. We will ensure there are supports for renters. We will make sure there is a national school food program. And Mr. Speaker, and on this side of the House, we will make sure we do that while maintaining a strong fiscal position, AAA credit rating, and the lowest debt to GDP ratio in the G7. Slogans don't make good policy, Mr. Speaker.
The Honourable Leader of the Opposition.
Well, they've definitely proven that. Their slogan for the last 8 years is that you can double the debt and someone else will just pay the bill. But we know who pays every single time. It is welders and waitresses, seniors, small businesses, and single mothers who have faced doubling housing costs and unaffordable food. And now their solution is to do more of the same, to pour on billions of dollars more of inflationary spending that will drive up interest rates, inflations, and taxes. Why would we expect it to be any different this time?
The Honourable President of the Treasury Board.
Mr. Speaker, on the contrary, our government has lifted 2.3 million Canadians out of poverty, and I would like to put it to the opposition, if they truly believe in supporting Canadians, why have they voted against the Canada Dental Benefit? Why have they voted against pharmacare? Why have they voted against $10 a day childcare, Mr. Speaker? That does not make sense because slogans do not make good policy.
The Honourable Leader of the Opposition.
Except everything she just listed are slogans on which they have not delivered. What they have delivered is they've doubled the debt, which has caused the worst inflation in 40 years, interest rates rising faster than at any time in history, the doubling of housing costs, the worst growth in the G7, the worst housing price inflation in that same group of nations. And today, after all of these devastatingly costly results, what do? The same thing that got us in this problem in the first place. Why won't they realize that they're the problem and not the solution?
The Honourable Minister for Housing, Infrastructure and Communities.
Mr. Speaker, the Leader of the Opposition has been masquerading across the country as a working-class hero, but it's fascinating when you actually listen to what he thinks people do for a living. In a couple of recent speeches, he said he thinks electricians capture electricity from the sky and that welders weld with their bare hands. What's he going to tell me next? The fishermen in my community dive beneath the ocean and catch them with their bare teeth? Mr. Speaker, I can forgive the opposition leader for being a career politician who's been on the public dime for a couple of decades, but if he wants to represent the interests of the working class, he should talk to a person who has a real job.
Order. Order, please. Order, please. The Honourable Member for La Prairie. Quebecers have been cheated by this government since 2019 when it comes to housing. We represent 22% of the population. We got only 14% of the money, and only 6% of that was for affordable housing. Despite all this, the Minister of Housing is giving lessons out today. He told the press, La Presse, that his government is acting in good faith, in his opinion, and that it's the provinces that have to agree to do things differently. It's the federal government that has to do things differently. It must stop fleecing Quebecers. Will it pay our fair share of housing funds immediately instead of giving out lessons? The Honourable Minister of Housing, Infrastructure and Communities. The Bloc Québécois is not defining policies on housing in Quebec. We have a good relationship with our counterparts in Quebec to build housing. For example, we are making investments to build 8,000 affordable housing units. The overall programs show that it's clear that we are ensuring that Quebec is getting its fair share. We will continue our work in building homes in Quebec and across the country. The Honourable Member for La Prairie, you have to do that, give lessons. It was this government that made the current housing crisis worse. It lost control of immigration and didn't pay Quebec its fair share for housing. That same government, incidentally, gave us ArriveCan. It can't print passports. It can't pay its own employees with Phoenix. You can't make this stuff up. These gifted people are telling the provinces to act in good faith and do things differently. Does the government understand that the only thing that needs to be done differently is for these gifted people to mind their own business and stop trying to manage Quebec's housing money? The Honourable Minister of Transport. Mr. Speaker, we are Quebecers, and when we're talking about housing, they're saying, mind your own business. Well, when we stand up and we talk about ensuring that our kids are not going to school hungry, they say no. But when the Prime Minister of a foreign country comes here from another continent and he tells us, well, we have to listen to them. Well, Mr. Speaker, they'd be good to listen to them because Quebecers are standing up for Quebecers and Canada, and we will always do this. The Honourable Member for Rosemount Petite Patrie. Mr. Speaker, Canada's large corporations are highly profitable and among the least taxed in the world, a big gift from the Conservatives that the Liberals have maintained. In the U.S., President Biden has understood that it's unfair to workers, and he's going to make companies pay what they owe. Here, the Liberals are hesitating, treading water, beating around the bush, and we fear they won't have the courage to do the right thing. Mr. Speaker, I beg you, tell me, am I wrong? The Honourable Minister of Innovation. Mr. Speaker, he is wrong. That's the simple answer, Mr. Speaker. There's some problems with memory, Mr. Speaker. We have an agreement with NDP colleagues. The Conservatives were opposed. We know that the best way to ensure stability in the country, to ensure affordability, is to have more competition. There's more choice with more competition. There's better prices, Mr. Speaker. We will continue to fight every day to ensure the quality of life of Canadians.
The honourable member from Victoria.
Mr. Speaker, while Canadians are struggling and food bank use is at an all-time high, rich oil and gas CEOs are making record profits. Canadians are frustrated. But sources say that the finance minister backed out from an excess profits tax in this budget. Why? Because oil and gas lobbyists asked her to. Just like the Conservatives, the Liberals keep caving to big oil and gas. Why do the Liberals keep protecting the profits of big oil and gas instead of everyday Canadians?
The Honourable Minister for Natural Resources and Energy.
Thank you, Mr. Speaker. I would point out Canada is the first and the only G20 country to have eliminated inefficient fossil fuel subsidies. We have introduced a tax on share buybacks across the economy to tackle exactly excess profits. Canada is putting into place the first and only in the world oil and gas emissions cap to hold the industry accountable for their own commitments. On the other hand, the Conservative leader has pledged to his oil and gas CEO donors to make pollution free again. We know who's in the pockets of oil and gas. It's that party over there.
The honourable member from Thornhill.
8 years of this Liberal NDP Prime Minister, Canadians know that he's not worth the cost. Even proud Liberal and former bank governor David Dodge, who worked for Paul Martin and Jean Chrétien, says that this budget is on track to be the worst one since 1982. Wow. Canadians know that this budget will bring higher taxes, higher spending, meaning even more misery for families who can't afford to eat. Instead of drowning everyone, will they fix the budget, axe the tax on farmers and food, and stop the endless spending with the dollar-for-dollar law so that Canadians can afford to live?
The Honourable President of the Treasury Board.
Mr. Speaker, I'm not sure if the honourable member is aware, but our fiscal markers are very strong. That is a AAA credit rating by an independent, objective observer. That is the lowest debt-to-GDP ratio in the G7. All the while we will continue to support vulnerable Canadians, something that they refuse to do on the other side of the House by voting against $10 a day childcare, families and seniors every single time. Mr. Speaker, the hypocrisy is palpable.
The honourable member from Thornhill.
Speaker, I'm not sure that the honourable member is aware of the pain that Canadians feel who can't afford to live in Canada. And what's worse is that they can't even afford to die. The Prime Minister's own news agency, the CBC, is reporting in provinces across Canada, dead bodies are being stored in mobile freezers because people can't afford the cost of laying their loved ones to rest. They can't afford their homes, they can't afford their groceries, they can't afford their gas, and now they can't afford a dignified goodbye. We're asking him just to stop. We know he won't. So how much inflationary fuel is the PM going to pour on the fire at 4 o'clock today?
The Honourable President of the Treasury Board.
Mr. Speaker, all Canadians deserve to die with dignity. They also deserve supports while they are alive, which is why we have reduced poverty by 22% on this side of the House, which is why we have supported families with $10 a day childcare and the Canada Child Benefit, which has lifted 500,000 children out of poverty. Mr. Speaker, what we will do on this side of the House is maintain a strong fiscal position while supporting Canadians, especially vulnerable Canadians, Mr. Speaker. We take that as our priority, unlike the other side of the House.
The honourable member from Central Okanagan, Similkameen, Nicola.
Mr. Speaker, after 8 years, we know that this Prime Minister and his NDP Liberal government are not worth the cost. His recent spending spree is inflationary and making everything worse, adding billions to the debt. This year alone, they will throw $52 billion towards debt servicing. That's more than they allocate to the provinces for health care. Doesn't the Prime Minister see his reckless spending is increasing inflation and debt, burdening all generations of already struggling Canadians? Or is he too busy cutting checks to care?
The Honourable Minister.
Mr. Speaker, let's delve into the numbers a little bit. When the leader of the Conservatives was Minister of Jobs, unemployment in Canada was 11% higher. Wages in this country were 75% of what they are now, and they had our foreign direct investment behind Ireland, behind Japan, and now, Mr. Speaker, we are third in the world, and when you divide it by our population, we're first in the world on bringing good jobs, on bringing investments, on making Canada a place where everybody wants to call home, unlike the Conservatives, which are full of bluff and bluster.
The Honourable Member from Central Okanagan, Similkameen, Nicola.
Spendy ways, my friends, spendy ways. David Dodge said that this was likely to be the worst budget since 1982. 1982? Who was Prime Minister then? How out of control was that budget? How broke did Canada and Canadians become before Pierre Elliott Trudeau finally took his walk in the snow? Plus ça change, Mr.
The more things change.
2 million visits to food banks in a single month. Isn't it clear that Canadians are desperately hungry for change? How many more Canadians need to visit food banks before the Prime Minister really realizes that today's budget is a recipe for disaster?
The Honourable Minister for Employment and Workforce Development.
Thank you, Mr. Speaker. Today sounds like a day for some of the greatest hits, so let's put the Conservatives in the spotlight. Mr. Speaker, when we formed government in 2015, one of the first things we did is we asked the wealthiest 1% of Canadians to pay more. How did the Conservatives vote? Against. When we asked to make sure that Canadians and their children could have money coming to their houses every month, how did the Conservatives vote? Against. And now that we're going to have a national school food program and housing across this country and investments to grow this country, how are the Conservatives going to vote against?
Order, please.
Certains.
I'm convinced that all members would like to hear the question by the Honourable Member for Charlebourg-Haute-Saint-Charles. Mr. Speaker, in order to bring inflation down and allow the Bank of Canada to lower interest rates, there aren't 36 solutions. You have to cap spending by applying the dollar for dollar rule. Want to spend $1? Save $1 somewhere else. It's simple. It's how everybody manages their budget at home. And that's how all government ministers should manage their departments. Is the Prime Minister going to cap spending to keep inflation and interest rates down in his budget that he's going to table shortly? The Honourable Minister of Public Services, Public Procurement. Thank you, Mr. Speaker. The Conservatives have always wanted to do and voted in favor is to reduce taxes for the wealthiest and make lives more difficult for everyone else, the middle class and those lower income earners. This includes a Canada Child Benefit. When they voted against it in 2016, it was one of their first votes. It includes a vote against dental care for seniors, the 600,000 seniors who are now eligible for this plan. The leader of the Conservative Party flees when we ask him when he's asked questions about this. The Honourable Member for Charlebourg-Haute-Saint-Charles. Mr. Speaker, the Conservative Party has 3 simple demands today. It's to build housing, not bureaucracy. The government insists on announcing inflationary measures that could cost Canadian taxpayers billions of dollars and only serves to increase inflation and the cost of living. Even David Dodge, the former Liberal governor of the Bank of Canada, has predicted that this will be the worst budget since 1982. Will the Prime Minister commit to following the demands of the Leader of the Official Opposition and build housing, not bureaucracy? The Honourable Minister of Public Procurement. My esteemed colleague is putting the Leader of the Opposition and housing together. He built 6 affordable housing units when he was Minister of Housing. So that's all he built during his mandate when he was the minister responsible for housing for the entire country. In my colleague's own writing, if I can say there's only 12 affordable housing units that were built. So that's more than twice what the Conservative leader built. The Honourable Member for Drummond, the English Montreal School Board has decided to challenge Bill 21 before the Supreme Court. That's fine, it's their right. But for the federal government to get directly involved in this case against the will of the National Assembly and provide money, our money, and lawyers, that's a no-no. The Quebec lieutenant says that Canada is secular, that the government supports secularism, but keeps telling us that we have to defend religious freedom against Bill 21. When will the Liberals understand that the best way to protect religion is for the state to have none at all? The Honourable Minister of Transport. Mr. Speaker, I would repeat a fact that my colleague knows full well, is that we're working with this. The Bloc Québécois, when they want to talk about Quebec issues, we are Quebecers and they tell us to mind our own business. A foreign leader came here and then someone tells them what to do, and that person must be listened to. I must tell my colleague there are 35 Quebec MPs elected by Quebecers. We're proud Quebecers and will always stand up for Quebec. The Honourable Member for Drummond, Mr. Speaker, by supporting the will of the National Assembly, they can do good. By supporting the challenge to the law and the secular nature of the state, Ottawa is challenging our model of living together in Quebec. We don't want religion and the state to intermingle. We've moved on. I'm sure that this isn't easy for our MPs who fight to ensure that the days of the House begin with a prayer, but Quebecers have chosen secularism. Religion is private, the state is public. I'd like the minister to answer frankly, why is his government opposed to secularism? The Honourable Minister of Justice. Thank you, Mr. Speaker. Just to be clear, it's a group of Quebecers who went to court to defend their rights under Quebec's Charter of Rights and Freedoms and the Canadian Charter of Rights and Freedoms. They went to the Court of Appeal, and they've talked about it a few times for the past year. We'll be here to take part in the discussions. They're very important, and they are in relation to the Charter, the Canadian Charter and the Quebec Charter. The Honourable Member for Drummond, Mr. Speaker, this is a parliament where we hear God save the King for the head of the Anglican Church, in a parliament where elected representatives pray every day, not at home, which would be their strictest right. But here in this House, we have a government that wants to change the election date for Diwali, a religious holiday, and they're going to tell us that Canada supports secularism. That is so important. Honestly, will the minister admit that if he wants to challenge Bill 21, it's simply because he's against secularism? The Honourable Minister of Justice and Attorney General of Canada. Mr. Speaker, we are firmly committed to taking part in these important discussions that have huge repercussions for all Canadians. These are questions that concern the Canadian Charter and the Quebec Charter, as we have indicated on a number of occasions. We have serious concerns with regard to the preventive use of the notwithstanding clause of Section 33 of the Charter. So we need to ensure this. Thank you.
Member from Lambton, Kent, Middlesex.
Mr. Speaker, after 8 years, this NDP Liberal government is not worth the cost. But let's hear from some rural residents. Judy from Arkona writes, the carbon tax is killing us. And Scott from Tupperville says, as a senior, I'm finding it hard to cope. And Walter from Elvinston writes, I have not even received a carbon rebate. So in his broken promise budget being set to be delivered at 4 p.m. today, will the Prime Minister finally axe the tax on farmers, make food cheaper for Canadians, and pass Bill C-234 in its original form?
The Honourable Minister.
Thank you, Mr. Speaker. And I'd really like to ask the Conservatives, they don't have to wait till 4 o'clock. They could pass the fall economic statement because, Mr. Speaker, that is having an impediment on what rural top-up is going. So in my riding, that would mean $1,430 to go every year to a family of 4. All across the country in Alberta, it would mean $2,160. I wish they'd pass the feds. Then they would truly be helping rural Canadians and rural families.
Here, here. The Honourable member from Lambton, Kent, Middlesex.
Well, Mr. Speaker, even the polls tell us that the majority of Canadians are fed up with this Prime Minister overspending, over-promising, under-delivering, and failing this country. Over $52 billion will be spent on servicing his debt alone. And while Canadians are struggling, he raised the price of gas, groceries, and home heating of carbon tax by 23% just 2 weeks ago. This is punishment, not progress. So in his big deficit budget later today, will the Prime Minister finally axe the tax on farmers and make food cheaper for Canadians?
The Honourable Minister for Rural Economic Development.
Mr. Speaker, I want to tell this story again. I told it a few weeks ago. It was a constituent in my riding who took the time to track every single amount of money that he'd paid. And you know what? He doubled it, in case he missed a few things. He was in $38 every time he got his check. I wish they'd do their homework, Mr. Speaker, because 8 out of 10 Canadians do get more with their Canada carbon rebate, especially in rural Canada.
The Honourable Member from Regina Leuven.
This coming from the Liberal member who said if Canadians want programs, they should vote Liberal. Come on, Mr. Speaker. After 8 long years, this Liberal NDP government is not worth the cost. Canadians are finding it harder and harder to make ends meet. And we all know that at 4 o'clock today, they're going to table a dumpster fire budget. This Prime Minister simply is not worth the cost. The question is, will he finally axe a tax on farmers so Canadians can put food on their tables?
The Honourable Minister for Natural Resources and Energy.
Thank you, Mr. Speaker. On this side of the House, we are focused on ensuring affordability for Canadians moving forward and addressing the climate issue. The price on pollution is an affordability mechanism. 8 out of 10 families get more money back. The PBO has underlined that. 300 economists across this country have underlined that. Mr. Speaker, every one of those MPs over there ran on the platform that included a price on pollution. This is the height of hypocrisy, and my goodness, their plan is only to take money away from poor people and to let the planet burn.
The Honourable Member from Regina Leuven.
Climate 10 can say whatever he wants, but they are 62nd out of 67 countries.
The Honourable Member is an experienced member in this House and understands that we cannot refer to other members other than their titles that they have. Order! Order. So the Honourable Member understands that, and I'd ask the Honourable Member to start from the top and to avoid such language.
He's not Ken. Ken's handsome.
Mr. Speaker, Canadians know this Prime Minister is not worth the cost. They see it time and time again when they go to the grocery store. And we know that our farmers are paying more. By 2030, when this carbon tax is fully implemented at $170 a ton, farmers will be paying $1 billion in taxes. So my question was, again, on their 4 o'clock budget dumpster fire, will they axe the tax farmers so Canadians can put food on the table?
The Honourable Minister for Natural Resources and Energy.
Thank you, Mr. Speaker. I'm not sure if the Honourable Member is actually trying to insult me or actually give me a compliment. But I would say that it's important in this chamber that we actually use facts, that we are not misleading Canadians. 8 out of 10 Canadians get more money back. That is underlined by 300 economists in this country. And to be honest, it's underlined by the Premier of his province. When Scott Moe came here and actually testified, what he said is they looked at all alternatives and they were all too expensive. Well, that's absolutely the right thing, because we have put in place something that actually does address affordability, reduces carbon emissions. On that side of the House, they don't believe in climate change, and they act.
Order. Order. The Honourable Member from Hamilton Centre.
This past weekend, I met with over 100 youth from Hamilton who told me they don't even know how they're going to be able to pay rent, let alone ever be able to afford to buy a home in their lifetime. And a recent Spectator News report confirms that Hamilton's rent is out of control and quickly outpacing Canadian cities. And under the Liberals' watch, life has only gotten better for wealthy developers, and they're raking it in.
The honourable member from Hamilton Centre, usually I can hear quite well. I'm having difficulty hearing him today. I'm going to ask all honourable members, in particular the member from Prince George, Peace River, Northern Rockies, please to only take the microphone when he's take the floor when he's recognized by the Speaker. I'm going to ask the honourable, give the honourable member 20 seconds to finish his question. The honourable member.
Under the Liberals' watch, life has only gotten better for big money developers, and they're raking it in while the rents double for Canadians. So why are the Liberals refusing to take on corporate developers and failing to build non-market affordable housing now?
Order. The honourable member, the honourable minister, rather, for Housing, Infrastructure and Communities.
Mr. Speaker, I have great respect for the honourable member and thank him for his advocacy to build more homes in Hamilton. But he may not be aware that we recently invested $93.5 million in his city to help speed up the construction of up to 9,000 new homes. Mr. Speaker, in addition, we are putting money on the table. It's going to help speed up the development. But if his concern is about building non-market housing, I'm pleased to point to the $1 billion we invested in the fall economic statement to build more affordable housing, the hundreds of millions we're using to build more cooperative housing, the $4 billion we're using to deal with the needs of urban, rural, and northern communities to serve Indigenous peoples. We're going to build housing for the most vulnerable. We're going to build housing for everyone.
The honourable member from Winnipeg Centre.
Mr. Speaker, Indigenous people in Winnipeg make up nearly 75% of the unhoused population. Almost 90% are sleeping outdoors or living in encampments. The Liberals' inadequate response is costing lives. And the Conservative leader, he cut 8,000 affordable units when he was the minister in charge. Clearly not a Conservative priority. In today's budget, will the Liberals commit to increasing funding for affordable housing with rent geared to income and get serious about ending homelessness?
The Honourable Minister for Housing, Infrastructure and Communities.
Mr. Speaker, I thank the honourable member for her concern, and she's right to point out the desperate need of so many communities across the country when it comes to building more affordable housing. She's right to point out the need for increased investment to support the needs of Indigenous people who remain unhoused. That's why we put more than $4 billion on the table to support the needs of Indigenous peoples in community, and an additional $4.3 billion to deal with the needs of Indigenous peoples who live in urban, rural, and northern environments. On top of that, Mr. Speaker, we've invested more than $120 million to build thousands of homes in her city. We're going to keep doing what we need to build more affordable housing. And one point of correction, it was 800,000 units that the opposition leader lost while he was housing minister.
The honourable member from Fleetwood, Port Kells.
Mr. Speaker, today the Deputy Prime Minister will deliver the budget. Over the last few weeks, we've seen the important efforts of this government to invest in this country, building a record we could be proud of. On the other side, Leader of the Opposition loves to talk about his record when he was Minister of Employment. He wants to convince Canadians that he has the solution to make life better. Cut, cut, cut. Well, cuts don't create jobs, cuts don't create investment, cuts don't increase wages. Can the Minister of Employment, Workforce Development and Official Languages tell the House what this government is going to do to make life better for Canadians?
Great question.
The honourable Minister for Employment and Workforce Development.
Thank you, Mr. Speaker, and I want to thank my colleague from Fleetwood, Port Kells, for his hard work. Since we took office in 2015, Mr. Speaker, wages are up, employment is up, and foreign direct investment is up. We are investing in Canadians, in the economy, creating great jobs and growth for the whole country. When the Leader of the Opposition was Minister of Employment, wages were lower, employment was lower, foreign investment was lower. While we're fighting for fairness for every generation, his record is clear, and there's one thing that'll be up if he ever takes over: cuts, cuts, and more cuts.
The honourable member from King Vaughan.
Mr. Speaker, after 8 years, it's clear this NDP Liberal government is not worth the cost. In Newfoundland and Labrador, there are 28 bodies in a freezer outside of a hospital because their families can't afford to bury them. This sounds like a Netflix horror movie, but sadly, it is the nightmare of this Prime Minister's out-of-control spending. Conservatives demand him to stop the outrageous spending and make life affordable. Will they listen and give Canadians the ability to bury their loved ones?
The Honourable Minister for Rural Economic Development.
Mr. Speaker, we know it's a challenging time for many, many people. That's why we've been there all along, Mr. Speaker. We've been there with the child care benefit. We've been there with the increased OIS and GIS. We're now there with a dental program that's rolling out to help people. We know we have our carbon rebate this year for people. We know it's challenging times. We'll be there for Canadians, and we always will be, Mr. Speaker.
The Honourable Member from King Vaughan.
The old song is, "Stop in the name of Canadians." 28 bodies in a freezer because families can't afford to bury their loved ones. Houses have doubled. Food bank usage is higher in history. Well, you know. Families are losing their homes. Enough. Today, the Liberals are announcing their budget. Will they show some compassion and ensure there's $1 of savings for every dollar of spending so Canadians can afford to live?
Before the Honourable Minister gets up, I'm going to encourage members, please. I hear some singing in the House. You know that singing is not permitted in the House. I'll just ask them to please, whoever is doing that, to please stop. The Honourable Minister for Rural Economic Development.
Mr. Speaker, when people find it very challenging and very upsetting time in their life, they know that this party on this side of the House is there to help them for in many reasons. And Mr. Speaker, we don't believe in slogans. We believe in helping people, which we have been since the very, very beginning, and we will continue to, especially with today's budget later today. Thank you.
The Honourable Member for Louis Saint Laurent. Mr. Speaker, after 8 years, this Liberal government is just not worth the cost. We've had 8 years of skyrocketing deficits and debt, and this government has never controlled its spending. It's the perfect storm that generates inflation. And what's the result of that? Rent has doubled. Mortgages have doubled. It's now cheaper for people to live in motels than in an apartment. At a bare minimum, during the budget later, will this government present a plan to control spending? The Honourable Minister of Public Services and Procurement. 6, Mr. Speaker. 6 is the number of affordable housing units that the leader of the Conservative Party had built when he was Minister of Housing for the entire country during his entire term. Quebec municipalities are building 8,000 housing units with the help of the federal government. If you divide that by 6, it's about 1,200 times more. And yet, the leader of the Conservative Party is insulting Quebec municipalities. He's calling them incompetent. Who's really incompetent here? The Conservative leader with his 6 housing units, or Quebec municipalities with 8,000? The Honourable Member for Louis Saint Laurent. Mr. Speaker, this member from Quebec seems to have fun with numbers these days. Well, I have a number for him. 750. Arrive can cost $750 times more. And who was president of the Treasury Board at that time? The member across the way. And then after that, he was Minister of Health. And now he's Minister of Procurement. So it's a real hat trick of incompetence. Does he think it's insulting to have spent 750 times more when it was his responsibility to ensure that things were done right? The Honourable Minister of Public Services and Procurement. Insulting is indeed the key word here. Insulting Quebec municipalities by calling them incompetent. They are building 8,000 affordable housing units with the federal and Quebec governments. Meanwhile, the insulting leader of the Conservative Party only managed to build 6 housing units, affordable housing units, throughout his entire term, throughout the entire country. There have been 66 in my colleague for Louis Saint Laurent's riding alone. The Honourable Member for Saint-Hyacinthe-Bagotte. Mr. Speaker, Ottawa is getting involved in a new border fiasco. On May 13th, importers may hit a wall at the border at customs. Why? Because there will be a new application at the border called CARM for paying import duties. Last week, 19 organizations raised concerns that neither the CBSA nor businesses will be ready on time. Will Ottawa delay the implementation of this application until the Committee on International Trade finishes its study of the matter and comes up with recommendations? The Honourable Minister of Public Safety. Mr. Speaker, as my colleague knows very well, we always work with committees. We always collaborate with them, and I myself have met with the leader of the CBSA. We met yesterday on this matter. I have full confidence in the agency, which is fully aware of the circumstances surrounding this application, and I have full confidence that it will be handled correctly. The Honourable Member. Well, it's all very well to talk about full trust, but there's a precedent here for Ottawa's failures on big IT systems. We all know Phoenix. 8 years later, the federal government still can't pay its employees property. And there's another precedent with CBSA, ArriveCan. Wow, how reassuring. So coming back to this CARM system, the agency did not provide the documents requested by the committee, so the committee cannot finish up its study. And no one seems to know what to do if the application crashes on May 13th. Will Ottawa do what it has to do, which is delay the start date?
L'honorable ministre de la Sécurité publique.
The Honourable Minister. Once again, Mr. Speaker, we have consulted, and we will continue to consult exporters, importers. We understand their concerns. That is why I raised the question with the head of the CBSA, and I do not share the pessimism of my colleague from the Bloc. As my colleague, the Quebec Lieutenant, often says, they are experts on pessimism in the Bloc. I don't share that, and I think we will act correctly on this file.
Member from Leeds Grenville, Thousand Islands and Rideau Lakes.
After 8 years of this NDP Liberal Prime Minister, it's clear he isn't worth the cost or the corruption, like his $60 million Arrive scam contractor, who's being hauled before the House of Commons tomorrow for refusing to answer committee questions about his role in this Prime Minister's latest multi-million-dollar scandal. Now, this contractor claims that he only did Google searches and sent LinkedIn direct messages. So what did this guy and his partner give to these Liberals in exchange for the multi-million dollars that they were paid?
The Honourable Minister for Public Security.
Mr. Speaker, just because my honourable friend continues to repeat something that he knows is not accurate doesn't make it so. He knows very well, Mr. Speaker, that there are a series of investigations that are being undertaken. The RCMP are seized with this matter. If the House, in its wisdom, decides to call people before the bar, that's entirely within the purview of the House. And, Mr. Speaker, we've also said from the beginning that anybody who abused taxpayers' money should face the consequences, and that's exactly what will happen.
The Honourable Member from Leeds Grenville, Thousand Islands and Rideau Lakes.
The minister gets up and says that something's not true. Well, point to the lie is what I would say to him, because we know that 75% of the contractors listed on this app did no actual work. We know that two guys working out of a basement were paid tens of millions of dollars but did no actual work. And we know that every step of the way, these Liberals have tried to cover it up, like that minister and everyone on the front bench and the right to the back voted against having the Auditor General investigate. The question is very simple. These yo-yos working out of a basement were paid tens of millions of dollars, did no actual work. What did they give these Liberals in exchange for that sweetheart deal?
The Honourable Minister for Public Safety.
Again, Mr. Speaker, if our honourable friend wants me to point out the part of his question which he knows isn't accurate, it's the last sentence of the question.
The Honourable Member for Mégantic-L'Érable. While speaking of this scandal, the ArriveCan scandal has reached unheard of levels in 100 years of Canadian history. Tomorrow, Christian Firth will appear at the bar of the House of Commons right here for protecting his friends within the Liberal government by refusing to give their names and lying. Just think about it. 2 guys working out of a basement with no specialized IT knowledge. They got $20 million for developing a digital application, ArriveCAN. I would ask the minister responsible for these historic levels of corruption, I would ask him to get up and apologize for this scandal, which made his Liberal friends rich on the backs of Canadians. The Honourable Minister of Public Safety. Mr. Speaker, my colleague knows very well that there is an investigation underway. The House is bringing in someone to appear on this matter. That is completely appropriate. Within the responsibilities of the House of Commons, we accept that. And from the beginning, whether with the Auditor General, whether with the RCMP, whether with parliamentary committees, we have always accepted an in-depth review of this situation. And anyone who has taken advantage of taxpayer funds will pay the appropriate consequence. The Honourable Member for Châteauguay-Lacolle. Mr. Speaker, National Tourism Week celebrates a vital industry in Canada. It represents 1 out of 10 jobs and affects all regions. Like mine, Châteauguay-Lacolle, which will soon be called Châteauguay-les-Jardins and Napierville. Our government is making strategic investments, like the Indigenous Tourism Fund and the Tourism Growth Program. It's exactly the opposite of what the Conservatives would do. They always vote to cut these programs. Can the Minister of Tourism tell us about the importance of the tourism industry? The Honourable Minister of Tourism. Thank you, Mr. Speaker. As my colleague for Châteauguay-Lacolle said so eloquently, this industry generated almost $100 billion in 2023 and employs 2 million people throughout the country. Beyond the numbers, tourism is something we can be proud of. We can be proud of sharing places with 2.5 million visitors from throughout the world. And that is why I am very surprised that the Conservative Party voted against giving a job to the Bonhomme Carnaval. That's why on this side of the House, we will all be wishing Canadians Happy Tourism Week.
It's rare that I hear the honourable member's voice carry so far. I'm going to ask him please to make sure that he doesn't speak until he's recognized by the chair. The honourable member from Brantford Brant.
After 8 years, this Prime Minister is not worth the cost. Just when you think this NDP Liberal government couldn't be more out of touch, they go ahead and nominate the CBSA as unsung heroes for the Arrive scam, recklessly spending $60 million taxpayer dollars and demonstrating some of the worst financial record-keeping we've ever seen is the opposite of innovative and effective procurement practices. The CBSA should be an example of how not to do government procurement. Why on earth would this government reward incompetence?
Wow. The Honourable Minister for Public Safety.
Mr. Speaker, my honourable friend knows very well that we have instituted a series of changes in terms of the procurement process, both at CBSA and horizontally across the Government of Canada. My colleague, the Minister of Public Services and Procurement, has spoken about the changes we've made in light of the recommendations, of course, of the Auditor General. We welcome other reviews, whether it's parliamentary committees. And in the case of ArriveCAN, Mr. Speaker, as you know, the RCMP are looking into this matter, and as I said, anybody who abused taxpayers' money will properly face the consequences.
Absolutely. The honourable member from Cumberland Colchester.
Speaker, the costly NDP Liberal coalition have announced another poorly conceived federal idea. Their dental care debacle is failing Canadians. I have one simple question. How many dentists in Nova Scotia, New Brunswick, and PEI have signed up for the dental care debacle?
The Honourable Minister of Health.
Well, it's great news, Mr. Speaker, because unlike the member opposite, we're working with dental providers and we're opening up a new portal, which means that in order to participate, all they have to do is accept that dental card and provide service. And the dentists that I'm talking to, as we work through these issues of the negotiation, are extremely excited to do what the member is not, which is to make sure that every Canadian from coast to coast to coast gets oral health care. And that means 1.8 million seniors and soon 9 million Canadians who will have the oral health care that they need.
I ask the honourable member from Oxford, please, to allow his colleague to ask a question and allow the minister to answer. The honourable member from Cumberland Colchester.
Well, interesting enough, the Minister of Health of the NDP Liberal government has been singing the praises and photo ops of this program for months now. Their plan is lacking and it's failing Canadians. One simple question once again to the minister. How many dentists in Nova Scotia, New Brunswick, and PEI have signed up for the botched care announcement? I'll actually give him the answer. It's 8 out of 1,107.
Wow. Order. The Honourable Minister of Health.
Well, of course, Mr. Speaker, the member opposite knows that we're opening a new portal and that members don't have to sign up, that all that needs to happen is they bring their card and they participate in the program. But here's the truth, Mr. Speaker.
I'll ask honourable members to please restrain themselves. I know it's budget day, it's a big day. The honourable minister has 20 seconds left on the clock.
Mr. Speaker, the truth is that they don't want about 9 million Canadians who don't have dental care to get service. They don't want or believe that Canadians who don't have access to diabetes medication to get it. They don't want, Mr. Speaker, for women to be able to get access to universal contraception. So they push despair because they don't want people to hope for something better. Well, we're there to deliver something better.
The honourable member for Richmond Centre.
Mr. Speaker, climate change is real. The science is clear. Current drought conditions and above-average temperatures are bringing an increasing risk of wildfires. Last year, more than 230,000 Canadians were forced out of their homes, not knowing what the future looks. Now, next to 100 fires are already burning in British Columbia, and communities are rightfully concerned. Can the Minister of Emergency Preparedness tell us what our federal government has been doing to...
Informally, I did ask the honourable member from Missinamaskee Fraser Valley, please, to allow the member from Richmond Hill to ask his question. I'm going to give the honourable member from Richmond Hill 15 seconds to finish his question. The honourable member.
Last year, more than 230,000 Canadians were forced out of their home not knowing what the future holds. Now, next to 100 fires are already burning in British Columbia, and communities are rightfully concerned. Can the Minister of Emergency Preparedness tell us what our government has been doing to make sure we will be there for British Columbians this summer?
The Honourable Minister for Emergency Preparedness.
Mr. Speaker, I want to thank the member from Richmond Centre for this very important and timely question. Last year we had the worst wildfire season in Canadian history because of climate change, and potentially this season could be even worse. We have been working very closely with the province and territories and Indigenous leaders to provide the resources that they need. We are training more firefighters, providing additional firefighting equipment, and adding more initiatives to provide humanitarian support. On this side of the House, we know the devastating impact that climate change is having on Canadians, and we will be there for them. Thank you.
The honourable member for Port Moody Coquitlam.
Seniors are being kicked out of their homes because assisted living is now fodder for greedy developers and private equity firms. 90-year-olds are being put on the streets so that super rich CEOs can make a buck. Yep. The Liberals and the Conservatives let developers buy up affordable housing, and now they're letting them go after long-term care. A family whose father was kicked out of his home called this a death sentence. Will the government stop this in its tracks and use the budget to end greedy CEOs from evicting vulnerable seniors?
The Honourable Minister for Housing, Infrastructure and Communities.
Mr. Speaker, as we move down a path of increasing investments to build more affordable housing, we have to acknowledge the very real challenge that exists when affordable housing that is already in communities is snapped up to be for the purpose of renovating those who live in it. That's why we're moving forward with a Canadian First, a new acquisition fund that's going to help nonprofits buy up existing low-cost rentals so they can keep them affordable in perpetuity. This is a new direction that's going to help many thousands of Canadians not just find a place to call home, but to keep a place to call home that they can actually afford.
Honourable member from North Island Powell River.
Mr. Speaker, in the past 2 years, there's been a 50% increase in denied claims for veterans seeking disability benefits. This is shameful. They served our country, risking their lives and safety in the process, yet the Liberals keep turning their backs on them, just like the Conservatives did for years before. This is an issue of respect and livelihood. Many veterans are struggling and they rely on these benefits to make ends meet. Do the Liberals plan on fixing this, or will they keep denying veterans their dignity?
Hear, hear. The Honourable Minister for Veterans Affairs.
Thank you very much, Mr. Speaker. I'd like to take a moment to thank my colleague for important work on the Veterans Affairs Committee. Mr. Speaker, our government has always been there for veterans and will continue to be there. Since 2015, we've invested more than $11 billion in additional funding to support veterans and their families. We've also, in contrast to the Conservative Party of Canada, when they closed the Veterans Affairs Office on this side of the House, we opened them immediately because we recognize that they provided direct services to victims, to veterans. Mr. Speaker, we will always be there to help support our veterans in their time of need and their family. Thank you.
And as such, it comes to an end of question period. But I would like to bring to the attention of honourable members, it's a great privilege for me to draw to the attention of honourable members in the presence of the gallery of Cindy Woodhouse Nepanak, National Chief of the Assembly of First Nations. Point of order, the honourable member from Abbotsford.
As Mr. Speaker, during question period today, the member for North Island Powell River directed a comment at us here in the back benches and directed at me as well. And she used the term shut up. Now, she is a member that generally conducts herself in a very civil manner. But today, using the term shut up is a manner unbecoming of a parliamentarian. And you know, Mr. Speaker, that it is you who, in fact, ensures civility within this House. You are the one who corrects us when we use language that is unbecoming. She actually repeated the remark when I asked her, "Did you tell us to shut up?" She said, "Yes, shut up." That is behavior unbecoming of a parliamentarian. So, Mr. Speaker, I would ask you to ask her to apologize for that remark and to withdraw it unconditionally. Thank you.
Good job, Ed. Good job.
I see the honourable member from North Island Powell River is rising. The honourable member.
Well, thank you, Mr. Speaker. And of course, I thank the member for bringing up how disruptive the Conservatives continue to be in this House. And just to clarify the record, I actually didn't tell him to shut up the second time. I told him to shush. So I will not be withdrawing, and I hope their behavior gets better.
I thank the honourable member from Abbotsford for raising this issue. It was brought to my attention. I know that members, we all could do a lot to improve decorum in this House, and I hope that we all will. But this issue was raised by the member of Abbotsford, and the member from North Island Powell River acknowledged that she used language which certainly causes disorder in the House. I would ask the honourable member from North Island Powell River if she would do the honourable thing and withdraw that comment.
No, Mr. Speaker, I certainly will not.
Before I move on with points of order, I'm going to just deal with this matter first. I'm going to ask, again, the honourable member from North Island Powell River is a long-time member. We've served together in this House on many committees. Out of respect to the chair, I will ask her once again if she could please withdraw that remark.
And I have served many years with you, Mr. Speaker, but my concern is very serious about the fact that members who are asking questions are silenced again and again by the Conservatives. So out of respect, I will not withdraw, and I don't mean that personally. So sad that the Conservatives have very sensitive feelings about it.
I'm afraid I have no choice but to ask the member because to not follow through with a request from the chair, I'm going to have to ask the honourable member please to leave the chamber. I see that the honourable member from Hamilton Centre is rising on a similar point of order.
Mr. Speaker, on the question, I think it's important for us to reflect on what has transpired in this House. You'll recall that there was a member from Regina who absolutely insulted a member. Sir, you gave him his entire question back, and yet when the disruption of this backbench, some who don't have the privilege of asking questions in this House, decided to interrupt my question, I did not receive the opportunity to ask it in full. It is at that point when the intervention happened, Mr. Speaker. So if it is on the question of disruption, you should note the heckling that's happening right now. Note the disorder in this House right now, Mr. Speaker, and I encourage you to reflect on what you've just did to this member, this honourable member from our party, when these people continue to act completely out of order in this House.
Yeah. So let me colleagues, we're coming back to the point of why it is so important for us to conduct ourselves with dignity in this place. The honourable member from Hamilton Centre has raised an important point, and I would like to point out to the honourable member that the chair actually did hear his question up until a certain point, and then not being able to hear the honourable member, as I mentioned, from the chair, I gave the honourable member more time to finish his question. First of all, I sought order in the House and asked the honourable member, give him more time to finish his question, to start further up. The honourable member from Regina Leuven, at the top end of his question, used language which was uncomplimentary, and I asked him to rephrase his question, which he did. But, colleagues, you know, it is very difficult to sit in this chair and to have members act in a way which is really not befitting to this place. And sometimes the chair raises the issue when the chair feels compelled that the chair has to do that. Sometimes members raise the issue. And when members raise the issue, that is a time that the chair has to deal with it. And as a result, it was with great regret that I asked a member from North Island Powell River to leave this place for the day, and because it was at the request of the chair to ask for that comment to be withdrawn so that that disorder or order can be restored to the House as was raised by the member of Abbotsford. That's the only reason why that had happened. I ask all members to remind themselves that once again, the chair can only go so far as members will permit the chair to go. It requires members to act in a manner that is befitting of this place. I think we all can learn from this from this situation. I see the honourable member from, the very experienced member from New Westminster, Burnaby, rising in his place on a point of order.
Mr. Speaker, it is not up to any individual member to try to get the respect in the House that the Conservatives consistently refuse to show. And so I would ask you to use the tools that you have available to you. We have granted you the ability to dock questions when the Conservatives are causing disorder, as they do so frequently. I would ask you to exercise the powers you have and dock their questions so that members, like the member from North Island Powell River, are not forced to try to intervene to stop them from allowing us to ask questions in the House of Commons.
And I thank the member from New Westminster Burnaby for that intervention. And indeed, the chair is increasingly reaching that point where, with proper warning, will start probably moving down that way. I hope I don't have to, and I hope that members will be able to conduct themselves in a way that is befitting of this place. The honourable member from Leeds Grenville, Thousand Island, and Rideau Lakes, I see is rising. I'm assuming on a similar point of order.
Same point of order, Chair. The NDP House Leader, the member for Timmins, James Bay, the member for Hamilton. We can check off everyone on the list. The members of the fourth party in the House create the same level of disorder as all members do, and engaging in heckling, like is happening right now. But Speaker, you know what? That's part of the customs that have been adopted by this place. And the matter at hand is that the Speaker made a ruling, and now in succession, we have NDP members standing up and chastising the Speaker for ruling the wrong way. That's not how it works in this place. Members of the official opposition, when asked to withdraw, in spite of their continuing to hold the convictions of what they've said, out of deference to the chair, have withdrawn and apologized. And when they have not done so at any point in history, they've been ejected. And that's how this place works. We don't have every member then stand up and challenge the chair's ruling, because frankly, that's unparliamentary and unbefitting any member who does it. So order has been restored with the chair's ruling. We thank you for that.
I thank the member from Leeds, Grenville, Thousand Islands, and Rideau Lakes for his intervention. But once again, I call on all members, because this happens, unfortunately, far too often. And it causes disorder. It is not something that I think Canadians appreciate, and I don't think any member of Parliament who spent a lot of time and effort to represent their constituents to come to this place to help pass laws and make laws and to keep governments to account wanted to participate in a place where, frankly, with behavior that would not be accepted in any other workforce or workplace in this country. So I thank the honourable member. I hope that will serve as a purpose to encourage all members to conduct themselves in a better way. I see the honourable member from Winnipeg Centre is standing on her feet to raise the matter, and again, a very passionate and a very contributive member from Parliament who is rising on point of order, and I hope it will add a new dimension to this debate. The honourable member from Winnipeg Centre.
Thank you so much, Mr. Speaker, and we've had the occasion to speak about exactly what is going on in the House. I have to say myself, on Thursday of last week, I felt that I behaved in an unparliamentary way as well, because it is out of control on the Conservative side of the bench. Constant toxic masculinity, including harassing the member from Nunavut, which I found so offensive. What I find shocking, Mr. Speaker, with all due respect, is that this is the first occasion where this kind of severe response has been taken. yet there is a normalization of gender-based violence being perpetrated by Conservative members on that side that happens every single day in this House all day.
Exactly.
I thank the honourable member from Winnipeg Centre. J'espère que je vois que
I see that the member for Mégantic-L'Érable wants to rise. On the same issue, I imagine I will permit the member to speak on this issue, but I hope that we can then conclude this debate. If you have something new to add to this debate, thank you. The member for Mégantic-L'Érable. Mr. Speaker, I would say for some 15 minutes now, you have allowed a number of colleagues, particularly from the NDP, to express themselves and to try to make you understand their version of the facts and to challenge the decision, indeed, that you yourself made, that is to ask the member for North Island Powell River, I think that's the right name, I'm not certain, to leave this House. And since then, Mr. Speaker, the NDP members have been launching a series of accusations against the Conservative Party, accusations that are unfounded, undeserved accusations. And I would ask the member who has just spoken to withdraw her comments on those unfounded accusations that she is making here, because this is an insult to all parliamentarians to insinuate that the Conservatives show, and I won't repeat what she said just now, Mr. Speaker. It's unacceptable that you tolerated her speech, that she allowed her to complete her intervention. The comments she made about the members of the Conservative Party are unacceptable, and I would ask you, therefore, in all due respect, to ask that member to withdraw those comments and to apologize with regard to the comments she made about us. Colleagues, I think that it's very important. I want to thank the member for Mégantic-L'Érable for raising that point. I will say this is a criticism that I will review. And I see that
member from Battle. I'm trying to think of who was up first, so I think it was the member. I think it was a member from Battle River Crowfoot who had gotten up alongside the member from Windsor West. So I'm going to ask the member from Battle River Crowfoot to go first, and then I will go to the member from Windsor West.
Thank you very much, Mr. Speaker. And as an individual, and I think all parliamentarians will acknowledge fully that passions can run high in this place. But when a circumstance arose where I had faced the consequence when your deputy was in the chair, I certainly had the respect to not only respect the ruling that the Speaker had made, but also not challenge that ruling and left this place. And Mr. Speaker, I would also urge you to consider the way that the member from Kildonan St. Paul, likewise, when passions were running high in debate, had made a comment. She, again, my colleague from Manitoba, had respected the chair. And Mr. Speaker, I think that it is very, very unfortunate that the NDP would make such accusations when certainly if one wants to start going through the list, as was mentioned before, about the significant harassment that's been faced, especially from some of my female colleagues within the Conservative Party, including from members of the NDP. Mr. Speaker, it is unfortunate that there would be those accusations leveled at the Conservative Party when the fundamental issue I think at stake here is respect for the chair and the institution that represents within this place.
So I'm going to go to the member of, I thank the honourable member from Battle River Crowfoot. We're getting to now into accusations of he said, she said, they said. I'm hearing this has been raised. The chair clearly understands it. I want to be very clear that the member from North Island Powell River, of course, did leave the chamber on request of the chair. She has not come back in here to debate this matter, as neither did the member from Battle River Crowfoot when he had been ejected by the chair some months ago. The honourable member from Windsor West.
Thank you, Mr. Speaker, and I don't like to rise on this. In a couple of weeks will be my 22nd year here, and I can tell you that it's different. It's not heckling. It's not a sense of involvement in the debate. It's outright bullying tactics that are taking place and verbal abuse. It's changed significantly in this chamber, and
Well said, Brian. Example. Well said.
Doing it right now.
And as you may not be aware because you're on that side down the aisle of the chamber, Mr. Speaker, I can also testify that it depends upon what member rises in the House and what gender they are and what they look like will determine how they are treated. And that is something that is a regular behavior that has escalated significantly in the last number of years. In particular right now, your decision to the member for Hamilton, for example, is he had an important question to ask, and I appreciate your position on it, but he can't do in 20 seconds what he should have had the right in 35 seconds to do for his constituents and for what he wants to do for this country without the type of harassment that takes place. So I ask you to review not only what's taking place in this chamber and how you respond to it and reflect back on the years and the way it's been dealt with in the past, but also the behavior that's taking on behind the curtain in the hallways here, because they're definitely included, which spills out to the chamber here right now. And I can tell you, especially late nights that are in this place, we have young people that are exposed to behavior that is not becoming, and it is not acceptable at a workplace to have a number of different activities that are taking place that clearly are especially encouraged when the camera's off, that may not be seen when the camera's on. Here, here.
So I thank the member from Windsor West for his intervention. I'd like to thank all colleagues for standing and raising these issues. Once again, I think this points out the importance of us to conduct ourselves in a matter better than we currently do. And I think most members do conduct themselves in a way that's befitting, and sometimes when we go over the limit in a way that's just not befitting. I call on all members to please reflect on what has happened today, what has happened in the past, the sense and probably the righteous sense that some people have felt has been raised by many honourable members, so that we can conduct ourselves in a better way going forward. I thank all members for their participation in that. Orders of the day.
Orders of the day, government orders, government bills, commons. Resuming consideration at second reading of Bill C-64, an act respecting pharmacare, and on the amendment of Mr. Ellis.
The Honourable, resuming debate, the Honourable member from Humble River Black Creek has 10 minutes and then followed by questions and answers. Member from Brandon Souris, my apologies.
I wanted to get your attention this morning in the debate when I was asking a question of my colleague from Cumberland Colchester. I used the word likely, and it should have been unlikely in the discussion and the question, and I just wondered if I could have that noted. Thank you.
Thank the honourable member for making that clarification in the debate. The honourable member from Humble River, Black Creek, 10 minutes.
Thank you very much, Mr. Speaker. And I wasn't sure I was going to get that opportunity this afternoon, so glad to be able to join in what is a very, very important bill, Bill C-64, an act respecting pharmacare. Bill C-64 represents the next phase of our government's commitment to establish a national universal pharmacare program. It proposes the foundational principles of the first phase of national universal pharmacare and our intent to work with provinces and territories to provide universal single-payer coverage for a number of contraception and diabetes medications. This is an important step forward to improve health equity, affordability, and outcomes, and has the potential of long-term savings to our very endangered healthcare system. Public health care in Canada was built on the promise that no matter where you live or what you earn, you will always be able to get the medical care that you need. Despite this promise, Canada is the only country in the world with universal health care that does not provide universal coverage for prescription drugs. And we talk specifically about contraception, and we talk about the things needed for diabetes, are very important aspects of this program. When Medicare was first introduced, prescription drugs outside of hospitals cost less and played a smaller role in healthcare, something that we need to work harder at to get those costs reduced. But today, prescription drugs are a central part of our health, helping to control chronic conditions, treat temporary ones, and aid in overall health and well-being. One area that has seen significant change is diabetes treatment. That's been mentioned by the minister earlier and by other colleagues. Over 100 years ago, thanks to a Canadian team of researchers, Frederick Banting, Charles Harvard Best, John J.R. MacLeod, and James Bertram Kolek, insulin was discovered. Since this monumental scientific discovery, there have been several advancements in diabetes treatment, from the introduction of fully synthetic human insulin to glucose monitors and insulin pumps. These breakthroughs have immensely improved quality of life for people living with diabetes, whether it's enhancing their self-esteem, increasing social participation, and improving overall health and well-being. And one of our colleagues in the House adopted a program for a national diabetes strategy through her hard work in bringing that forward. They have also come up with higher costs, creating new affordability challenges for Canadians. Outside of hospital, prescription drug coverage comes from a mix of private insurance, out-of-pocket cash payments, and various provincial programs. While the majority of Canadians have access to some form of public or private insurance, about 2.8%, or 1.1 million Canadians, have no access to private or public drug insurance. And we constantly hear just how expensive everything is in and around the diabetes forum on a monthly basis for individuals. Although most Canadians have some form of drug coverage, as I mentioned, this does not mean that those with insurance have equal access to the prescription drugs that they need. The existing patchwork system of private and public drugs plans leaves millions of Canadians underinsured. That is, their out-of-pocket prescription drug costs create a financial burden that leaves them struggling to afford an essential part of health care. In 2021, Statistics Canada found that more than 1 in every 5 adults in Canada reported not having the insurance they needed to cover their prescription costs and having to make the decision as to whether they are going to fulfill their prescription or are they going to buy their dinner. Underinsurance can take many forms. For example, Canadians may have high deductibles, resulting in significant out-of-pocket costs before their
Order. I know of, because there was a number of things, the translation sort of taken a bit of a break because of the noise. So I just want to make sure that translation will be picked up. But just if the honourable member can make sure she doesn't hit the microphone as she puts the pieces of paper down. So we were picking that up a number of times.
Thank you, Mr. Speaker.
There you go. The honourable member for Humber River Black Creek.
Underinsurance can take many forms. For example, Canadians may have high deductibles, resulting in significant out-of-pocket costs before their insurance coverage even kicks in. Or they may reach the maximum annual or lifetime coverage limits for their insurance and have to pay out-of-pocket. Or they may have high co-payments, which are often more than 20% of the drugs costs on private plans and sometimes more on public plans. All provinces have drug coverage to protect Canadians from catastrophic drug costs, but deductibles under these plans can range from 0 to 20% of net family income. In many cases, Canadians will never reach the deductible, leaving them without any support for their drug costs. This variability across the country creates a postal code lottery. Consider again the advancement in diabetes treatments. For a working-age Canadian with no private insurance, out-of-pocket costs vary widely. In some parts of the country, out-of-pocket costs for people living with type 1 diabetes can be higher than $18,000 per year, out of pocket, and for type 2, higher than $10,000 per year, out of pocket expenses. Even those with private insurance can face high co-pays or exceed annual plan maximums, resulting in high out-of-pocket costs. Even in cases where an individual is not accessing devices that cost thousands of dollars, they can face significant out-of-pocket costs. For example, consider a woman in her mid-20s, excuse me, working a minimum wage job. An IUD, one of the most effective forms of birth control, can cost up to $500 with no insurance. Even with private insurance, a copay of 20% would be $100. While IUDs can last from 3 to 12 years and save money over the long term, the high upfront costs can make them inaccessible. Underinsurance can be a particular concern for young adults who age out of their parents' private insurance but do not have their own form of private coverage. Lower-income Canadians also make up a disproportionate share of the underinsured. While most provinces have put in place drug coverage for those accessing social assistance benefit, a gap clearly persists. Many lower-income households that do not qualify for social assistance continue to struggle with out-of-pocket prescription drug costs. Employment factors contribute to differences in insurance coverage. People with low-paying jobs, such as entry-level, contract, and part-time positions, often report less adequate drug insurance coverage. This may even discourage people accessing social assistance benefits from applying for jobs, because once hired, they may lose their public drug coverage. But many entry-level and part-time jobs do not offer drug benefits. One study found that only 27% of part-time employees reported receiving medical benefit coverage. Underinsurance can have serious consequences. Many Canadians with high out-of-pocket costs report foregoing essential needs, such as food and heat, or not adhering to their prescription costs due to the costs that they have to pay. Statistics Canada also found that in 2021, close to 1 in 5 Canadians spent $500 or more out of pocket for their prescription medication, and almost 1 in 10 reported not adhering to their prescription medication because of costs. This includes delaying filling prescriptions or skipping doses in order to save money. When people do not take their prescription drugs the way they're supposed to, their health, of course, can suffer. And this results in serious consequences for the individual and their household and unnecessary costs to the healthcare system, as patients are more likely to visit an emergency room to be admitted to hospital. For example, the full cost of diabetes to the healthcare system in 2018 was estimated to be around $27 billion and could exceed $39 billion by 2028. I think we all can agree that no Canadian should be put in a position where they must choose between the prescription drugs they need for their health and well-being and putting food on the table. This is unacceptable, and it is why we are continuing to work to improve accessibility, affordability, and appropriate use of prescription drugs as we move forward towards national universal pharmacare. Thank you very much for the opportunity to speak to a very important bill as we start the debate and move forward to the legislation passing in this House. Thank you, Mr. Speaker.
Questions and comments? Question commentaire, the honourable member for Cumberland Colchester.
Well, thank you very much, Speaker. An interesting speech once again. It would appear today that Liberals are suffering with counting problems. That being said, we've heard often today about the number of insulins covered on this fantasy pharmacare program proposed by the NDP Liberal Costly Coalition. We know clearly that in British Columbia, on their formula, there are 17 insulins covered, Speaker. And guess what? On this program, there's only 9, which again, we come back to the magical number of 8, which is how many insulins are not covered on this program. I thought I would give the answer to the member before there's difficulty answering the question, as there has been all day. That being said, I'd also like to question a cash-paying customer paying for birth control pills. How much would that be a month? Because certainly the numbers are not adding up once again, Speaker. So thank you very much.
The honourable member for Humber River Black Creek.
Mr. Speaker, this is a new program that's being introduced, and I can't tell you how pleased I am that it's there. I have heard from my constituents whether there's someone who's interested in the issue of the diabetes support or they're interested in talking about the contraception opportunities. In the end of the day, this will save lives and save a lot of money, and it'll also make our country far more understanding and appreciative of what people are trying to suffer. When we talk about affordability, I think we need to start by helping people with their drug costs.
Questions et commentaires. L'honorable député de Saint-Hyacinthe.
The Honourable Member for Saint-Hyacinthe-Bagotte. Thank you very much, Mr. Speaker. I'd like to thank my colleague for her speech. She's the chair of my committee, and we've been working together for nearly 5 years, ever since I arrived in this House. I've always been on the same committee. Very quickly, I would just invite her to table as quickly as possible the motion we adopted last Tuesday, a week ago. So I would invite her to table it in this House as quickly as possible. Now my question. Pharmacare. Yes, Quebec is not against it because we have our own and we're very good at public programs. But why would it be so difficult to have a right to withdrawal with full financial compensation that could enable us to get our fair share, improve our existing programs? And then everyone would be happy with that.
L'honorable député de Humber River Black Creek.
I want to thank my honourable colleague, and his first question was regarding a report. I can rest assured that to the member that I will report the motion to the House when I have the first opportunity to do so. On to the issue of C-64. I think this is a beginning. This is a new program, and we expect that there will be times and altercations of how we do things and continue to work with the provinces on how we do the rollout of this plan. I think the best thing that the member could do is to be working with all of us and all of the parties in the House to see that this legislation, C-64, gets passed as soon as it can.
Questions and comments? The Honourable Member for Timmins, James Bay.
Thank you, Mr. Speaker. Certainly New Democrats support investments in pharmacare. We support the National Dental Care Plan that's bitterly opposed by the lobbyists in the Conservative ranks. But the issue that we have to look at larger issues of health care. I want to speak about Indigenous health care, particularly children's health care, where the government spent millions of dollars fighting against Jordan's principle implementation at the Human Rights Tribunal, and yet we still see, time after time, the government refusing to pay in a timely manner for treatment for children who need treatment in all manner of areas. And we have therapists who simply cannot keep the lights on because the federal government refuses to pay. Does the member not understand that these are obligations that were ordered by the Human Rights Tribunal, that if we're going to provide health care, it has to be done in a timely manner for the vulnerable Indigenous children covered under Jordan's principle?
The Honourable Member for Humber River Black Creek.
I want to thank my honourable member for his question and for certainly his commitment to his community and the Indigenous community in particular. We all, through C-64, was just one more way of us talking about health care in Canada. Whether we're talking about certainly we're talking about the Indigenous community, but we're also talking about all Canadians. And the more opportunity we have to look at where we can improve the system, I think the better it is for all of us.
Now, before I call the next speaker, just a reminder that we will probably have to stop right around 4 o'clock. So hopefully she might get her whole speech in, and maybe not. The Honourable Member from Fort McMurray, Cold Lake.
Thank you, Mr. Speaker. It is an absolute honor to be able to rise in this place and bring forward a perspective on this bill and speak in support of the amendment that has been brought forward by my colleague and friend, the member for Cumberland Colchester. Sorry. It is very terrifying to me because this is effectively another fairy tale promise that this government is pushing forward, along with a long line of fairy tale promises when it comes to things they are trying or claiming that they are doing on behalf of Canadians. And this bill is not a pharmacare plan. They might state that it's a pharmacare plan. They can repeat it over and over and over again, but that doesn't necessarily make something true. Just because you say something over and over and over again doesn't make it so. And so this is something that I will repeat over and over again, because if they think that that somehow works, then maybe we need to bring this forward as well. But this is a legislative framework to look at possibly one day, maybe kind of, sort of, creating a pharmacare scheme of sorts. But it's not a true pharmacare scheme because it will only cover a couple different drug types for a couple different spaces. And it goes directly and flies directly in the face of many provinces. In fact, my home province of Alberta, very early on, the health minister, a former colleague of mine, Adriana LaGrange, was exceptionally clear that Alberta would pull out of a federal pharmacare plan, citing subsidy program concerns and a lack of consultation from the federal government. Citing a lack of consultation from the federal government. Provinces, whether this government and their NDP partners in their coalition want to admit it or not, provinces and territories in this country are the ones responsible, constitutionally responsible, for the delivery of health care in this country. And so not doing adequate consultation with provinces and territories before bringing forward a bill that will directly impact the delivery of health care is exceptionally concerning and should concern every single person in this chamber, whether they are, whether they care about what the Constitution says or not, because inevitably we will see something similar to what we have seen with so many of the bills brought forward by this government that will end up resulting in a whole bunch of lawyers getting rich from court cases when they get found out 5, 6, 7 years from now that, unfortunately, they did not fall within their jurisdiction and they overstepped. And so the government has an opportunity right now. We're giving them an out. We're giving them a pass. They can accept the amendment from my colleague and vote against this and allow us to have a little bit more consultation, have some real conversations about this. But they're not concerned about that. They want to bully through. They think that Ottawa knows best. And frankly, I can speak very clearly. In Fort McMurray, Cold Lake, and right across Canada, the people in the communities know better for their communities. The provinces know better about how to deliver health care than Ottawa will ever know. But they won't pull the cotton out of their ears for long enough to listen. And that is very unfortunate. And like I said, this is just a promise. This is a promise along lines of so many broken promises over the last 8 years we've had from this government. They promised affordable health care. Reality is they've doubled housing costs. They promised that the carbon tax wouldn't cost you anything. Yet, the reality is that we found that 60% of families are paying more because of these carbon taxes. They promised that taxes would go down. Yet the reality is taxes have gone up. And they promised safe streets, and yet the reality is we see crime, chaos, drugs, and disorder. I point out these broken promises because Canadians deserve to understand that after 8 years, this Liberal NDP coalition government just is not worth the cost. And it bears repeating that they are yet again trying to buy votes with a fairy tale scheme of sorts to possibly one day look at something that is something that should be looked at, but they should actually consult with provinces and territories, something that this government has decided to completely abdicate their role in. I do want to highlight the fact that I will be splitting my time with the member for Souris Moose Mountain, one of my colleagues on the Health Committee, who also is someone that is very passionate when it comes to provincial jurisdiction, as well as making sure people are getting the adequate care that they have. And so back to the broken promises that we hear time and time again, this is indicative of a pattern. And if we don't look at the patterns, and if we're going to take a government at their word because they claim that this is new and shiny and just trust them, that terrifies people that I talk to in Fort McMurray, Cold Lake. That is something that people don't want to hear. They know full well that Ottawa breaks more things than it touches. I hear that day and day out from people saying, this might be an okay idea, this might be something that we should talk about, but I don't actually trust that they're going to get it done. And housing is a perfect example of this. We have seen that under the last 8 years of this Liberal NDP government, housing prices have doubled. People in my generation do not think that they will ever be able to afford a home. It takes longer to afford a down payment on a home than most Canadians of the generation before had to pay their mortgage. Mr. Speaker, if that doesn't terrify everyone in this room, there is some serious problems at play. And so we will continue fighting for Canadians because, frankly, Canadians deserve to have someone that's fighting for them right now. We understand that the NDP did this in a request to grapple onto some form of power and prop up a government that they complain about on every occasion, and yet they vote with them. They vote with them time and time again. They'll get up in question period, have a big fight, and yet when push comes to shove, they co-sign everything that this Liberal NDP government puts forward. And frankly, Canadians have had enough. I hear from Canadians every single day. So do all of my Conservative colleagues. We hear from people that are struggling to put groceries in their fridge and feed their kids a nutritious meal. Families that are struggling as to whether they're going to put the heat up in the dead of winter or put food on the table. These are real, true, honest concerns, but this government seems to be completely negligent when it comes to actually standing up for Canadians. And so the news is positive. Conservatives have been very clear. We want to see a few things from this government, especially in this upcoming budget. We want to see them axe the tax. We want to see them build the homes. We want to see them stop the crime, and we want to see them bring forward a dollar-for-dollar law so that Canadians do not have to pay for their extravagant promises and costs. And frankly, Mr. Speaker, the Liberals would do well if they took my advice and voted for this amendment and allowed us to axe this bill.
Thank the honourable member. She will have 1 minute and 30 seconds left on the clock when debate is to resume. Order. It being 4 p.m., the House will now proceed to the consideration of Ways and Means Proceedings number 20 concerning the budget presentation. Comme il est 16 heures.
It being 4 p.m., the House will now proceed to the consideration of Ways and Means Proceedings number 20 concerning the budget presentation.
Ms. Freeland, seconded by Mr. Boissonnault, moves that this House approve in general the budgetary policy of the government. L'Honorable Ministre.
The Honourable Minister of Finance. Mr. Speaker, pursuant to Standing Order 83-1, I would like to table, in both official languages, the budget documents for 2024, including the notices of Ways and Means motions. These documents contain details of the various measures. Pursuant to Standing Order 83-2, I am requesting that an order of the day be designated for consideration of these motions.
Okay. Mr. Speaker, we are acting today to ensure fairness for every generation. We are moving with purpose to help build more homes faster. We are making life cost less. We're driving the kind of economic growth that will ensure every generation of Canadians can reach their full potential. And we're making Canada's tax system more fair by ensuring that the very wealthiest pay their fair share. We're doing this because a fair chance to build a good middle-class life, to do as well as your parents and grandparents, or better, has always been the promise of Canada. But today, Millennial and Gen Z Canadians can get a good job. They can work hard. They can do everything their parents did and more. And too often, the reward remains out of reach. They look at their parents' lives and wonder, how will I ever be able to afford that? The same anxiety haunts those of us who care about our younger generations, their parents and grandparents. What many parents have achieved for themselves, a degree of comfort and security, we want for our children and grandchildren. We want their hard work to be rewarded, as it has been for us. We want them to look forward to a future with a sense of anticipation, not angst.
We have arrived at a pivotal moment for millennials and Gen Z. These Canadians have so much talent and potential. They need to see and believe that our country can work for them. Making the promise of Canada real for younger Canadians requires action from us, and that is what we are delivering.
It begins with building more homes at a pace and scale not seen since after the Second World War. Over the past 3 weeks, we have shared with Canadians our new and ambitious plan to solve the housing crisis and to help ensure that Canadians, especially younger Canadians, are able to afford their rent or mortgage payments. We're investing to kickstart the construction of more rental apartments and more affordable housing across our country. We're topping up the Housing Accelerator Fund, which is doing exactly what we intended and exactly what Canada needs, cutting through red tape and breaking down zoning barriers. This innovative fund is at the vanguard of a housing revolution in Canada and is fast-tracking the creation of new homes. We're making the math work for builders by cutting federal taxes on new apartment construction, breaking down regulatory and zoning barriers, providing direct, low-cost financing, and making more government land available for building. Dans un pays
In a country with winters as long and as cold as ours, we are scaling up innovative construction techniques like modular housing to build homes year-round. Modular housing makes Canadian homes less expensive and the Canadian economy more productive. To support all this new housing, we are investing in the infrastructure communities need to grow and increasing the number of construction workers. By creating opportunities for apprentices and recognizing foreign credentials.
We're making it easier for Canadian homeowners to add a basement suite or a laneway house, so middle-class Canadians can be part of the housing solution too. Mr. Speaker, our work to build more homes faster across our country is quite literally an exercise in nation building, a true Team Canada effort. Together, we are putting into action a plan to build nearly 4 million homes by 2031 and to unlock the door to the middle class for more young Canadians.
While we work urgently to increase the supply of housing, our government is taking action to bring relief to Canadians, especially younger Canadians, by making it more affordable to rent or to buy a new home. This starts with better protecting renters from steep rent increases and renovictions. It also means making sure they get credit for their on-time rental payments, so they are in a better position to qualify for a mortgage, maybe even at a lower rate, when the time comes to buy their first home.
For first-time buyers, we will be extending the maximum amortization period of a mortgage to 30 years on new builds, including condos. That means lower monthly payments and greater opportunity for young people to get those first keys of their own. Combined with tax-free ways to save for first down payment through the tax-free First Home Savings Account and the Enhanced Home Buyers Plan, the longer amortization period will ensure more younger Canadians are able to afford that first home and take that next big step into a prosperous middle-class life. Monsieur le Président.
Mr. Speaker, the second part of our plan is making life cost less. Inflation has now been back within the Bank of Canada's target range for 3 months in a row. That is good news for Canadians. But more is needed to help reduce the cost of living, to help younger Canadians gain ground. As a government, we've made transformative enhancements to Canada's social safety net.
$10 a day childcare is already saving parents thousands of dollars a year and making it financially possible for more Canadians to choose to start a family of their own. Now we're making further investments, creating even more childcare spaces so more families can benefit and so more mothers don't have to choose between a career and a family. This is feminist social policy, and it is smart economic policy too. Already, thanks to our early learning and childcare investments, Canada has reached a record high for working-age women's labor force participation. Enrollment started in our new Canadian Dental Care Plan in December, and more than 1.7 million Canadians have already signed up. Next year, 9 million uninsured Canadians will have dental coverage.
And we've introduced legislation to deliver the first phase of National Pharmacare, which will provide universal coverage for many diabetes medications and make contraceptives free, ensuring every Canadian woman can freely choose the contraceptive that works best for her, not just the only one she can afford.
Mr. Speaker, free contraceptives are central to a woman's right to control her own body. That is a fundamental woman's right. It is a fundamental human right.
Bravo.
As a woman, as a mother, and as Canada's Finance Minister and Deputy Prime Minister, let me say clearly here today, This is an essential right our government will always protect. Women in other countries, our friends, our neighbors, are losing their right to control their own bodies. We will not let that happen here in Canada. Our government's transformative investments are having a meaningful impact, helping every generation save money. The Canada Child Benefit is the foundation of our support to young Canadian families and has helped lift more than 650,000 children out of poverty since 2016. The Canada Workers Benefit provides a meaningful boost to our lowest paid and often most essential workers. Our new Canada Disability Benefit will increase the financial well-being of low-income Canadians with disabilities.
Bravo.
And we will launch a national school food program, working with provinces and territories. We will expand access to school food programs and help 400,000 more children. Yes. So that they can have good, healthy food that will allow them to have a fair start at a good, healthy life. The list of supportive cost-saving measures goes on, Mr. Speaker. The GST credit arrives every 3 months to put some extra money in the pockets of millions of Canadians. The Canada Carbon Rebate ensures that we fight climate change in the most cost-effective way, delivering hundreds of dollars to Canadians every 3 months, including yesterday. 8 out of 10 Canadians get back more than they pay in the provinces where the federal price on pollution applies. And in this budget, we are delivering on our promise to return carbon pricing proceeds to small and medium-sized businesses.
I am so proud to announce that our new Canada Carbon Rebate for small businesses will soon return over $2.5 billion directly. That's right, over $2.5 billion directly to about 600,000 small and medium-sized businesses. This real, meaningful support is a testament to our commitment to Canada's small businesses. Mr. Speaker, at a time when prices are high, we're delivering real investments that help make life cost less for Canadians. The third part of our plan is growing the economy in a way that's shared by everyone. To drive the kind of growth Canada needs today, we are redoubling our efforts to attract investment, increase productivity, and boost innovation. We're working to empower our best entrepreneurs to put their ideas to work here in Canada and create good-paying and meaningful jobs. How do we do that? Well, to quote one of our country's great philosophers, we need to skate to where the puck is going. Cela veut dire.
That means doubling down on artificial intelligence. We were the first country to have a national artificial intelligence strategy. Over the past several years, we've supported the creation and growth of one of the world's leading, most talented artificial intelligence communities.
And today, Mr. Speaker, we are taking the next step to secure Canada's AI advantage.
Bravo. Bravo.
We are equipping our AI innovators with the compute power they need to attract and nurture the best researchers, scale up businesses, and drive the innovation that will deliver transformative economic opportunities for Canada and Canadians. Homegrown Canadian AI companies are already helping to boost the productivity of Canadian workers. A natural area to seize a further competitive advantage for Canada is building the mechanical heart of the AI economy, data centers. We have a natural edge. We have abundant and clean electricity. We have skilled and experienced engineers. We have the cold climate needed to help cool supercomputers. And we are physically close to the world's largest market, which has vast data processing needs. We're introducing the Accelerated Capital Cost Allowance for innovation-enabling and productivity-enhancing assets. This means that investments in things like computers, data network infrastructure, and more will be eligible for immediate write-offs. This will encourage companies to reinvest, create more jobs, and make their businesses more productive and innovative.
That's very good.
Mr. Speaker, in the first 3 quarters of 2023, Canada attracted the very highest per capita foreign direct investment in the G7.
Bravo.
And the third most total FDI in the world. Our budget builds on that significant accomplishment because attracting investment is key to driving growth, increasing productivity, and boosting innovation. With the Canada Growth Fund and our $93 billion suite of investment tax credits, we are already encouraging businesses to invest in emerging clean technologies that can drive growth and productivity and create more good-paying jobs. Today, we're proposing a new investment tax credit to attract companies investing across the electric vehicle supply chain. Canada boasts an abundance of natural resources. We intend to leverage this national advantage to build entire supply chains. And our new investment tax credit will encourage precisely that. We're investing over $5 billion in Canadian brain power. More funding for research and scholarships will help Canada attract the next generation of game-changing thinkers pursuing excellence.
Very good. Very good.
And we are building on our track record of making it more affordable to go to college and university by renewing the increase in upfront Canada student grants and interest-free loans, increasing the amount of financial aid students get for housing, and making it easier for mature students to go back to school affordably. And all of this is on top of our campaign promise to eliminate interest on Canada student loans, which we delivered on a year ago.
Our new Canadian Entrepreneurs Incentive will ensure entrepreneurs get to keep a bigger share of the profits from the risks they take and the hard work they do, and have more money to reinvest into their next venture. A prosperous future and abundant, good-paying jobs depend on Canada's innovators, entrepreneurs, and researchers. And this is why we are supporting them.
Mr. Speaker, there are those who claim that the only good thing government can do when it comes to economic growth is to get out of the way.
That's why you sit there, guys. That's why you sit there.
Well, Mr. Speaker, I would like to introduce those people who just cheered, to the talented tradespeople and the brilliant engineers who last Thursday made the final weld. It's known as the Golden Weld on a great national project, the Trans Mountain Pipeline.
Yep.
It took an activist, determined Liberal government to get it built. And last week, the Bank of Canada estimated that this project alone will add 1/4 of a percentage point to Canada's GDP. Mr. Speaker, as we invest with purpose for the benefit of our younger generations and those who love them, we continue to stick to a responsible fiscal plan. As part of that plan, in the fall, we set 3 very specific fiscal guideposts: maintaining the 2023-24 deficit at or below $40.1 billion, lowering the debt to GDP ratio in 2024-25 relative to the 2023 fall economic statement, and keeping it on a declining track thereafter, and maintaining a declining deficit to GDP ratio in 2024-25, and keeping deficits below 1% of GDP in 2026-27 and future years. Mr. Speaker, in this budget, every single one of these objectives is being met. As is our fiscal anchor, a declining federal debt to GDP ratio over the medium term. In fact, Canada has the lowest deficit and net debt to GDP ratios in the G7, as recognized in our AAA credit rating.
And private sector forecasters are now predicting a soft landing for the Canadian economy, thus avoiding the recession and heartbreaking surge in unemployment that many had thought was inevitable. Canadians know how important it is to responsibly manage a budget in the face of rising costs. And they rightly expect their government to do the same.
That's why, going forward, federal public service organizations will be required to cover a portion of increased operating costs through their existing resources. Most of these savings will be achieved through natural attrition in the federal public service. As a result, over the next 4 years, we expect the ranks of the public service to decline by approximately 5,000 full-time equivalent positions. Mr. Speaker, to responsibly build a fairer future for younger Canadians, we need to make sure our tax system is fairer too. In Canada and around the world, the 21st century winner-takes-all economy is making those at the very top richer, while too many middle-class Canadians are struggling just to avoid falling behind. The job of our tax system is to lean against this structural inequality, to fund investments in the middle class, especially in young Canadians, by asking those who are benefiting from the winner-takes-all economy to pay a little bit more. Today, our tax system doesn't do that. Today, it is possible for a nurse or a carpenter to pay tax at a higher marginal rate than a multi-millionaire. That's not fair. That must change, and it will. Our government is raising the inclusion rate to 2/3 on annual capital gains above $250,000 for individuals. This new revenue will help make life cost less for millions of Canadians, particularly millennials and Gen Z. It will help fund our efforts to turbocharge the building of more homes. It will support investments in growth and productivity that will pay dividends for years to come. So, who will pay more? Well, Mr. Speaker, most Canadians have no capital gains in a typical year, so they won't pay more. The first $250,000 in capital gains every single year enjoyed by each individual Canadian will be taxed at the current rate. Individual Canadians enjoying this substantial annual gain won't pay a penny more. The lifetime capital gains exemption, an amount fully exempt from taxation, will be raised to $1.25 million. And this change will not, of course, apply to the sale of Canadians' principal residence, which is and will remain fully exempt from the tax on capital gains. Only 0.13% of Canadians with an average annual income of $1.4 million will pay more on their capital gains. For 99.87% of Canadians, personal income taxes on capital gains will not increase. Taxing capital gains is not an inherently partisan idea. It is an idea that everyone who cares about fairness should support. In fact, the idea of taxing capital gains in Canada was first broached by the government of Prime Minister John Diefenbaker and his Royal Commission on Taxation, chaired by Kenneth Carter. And Prime Minister Brian Mulroney raised the capital gains inclusion rate to 75%, higher than the rate we're establishing today. Yet, I know, there will be many voices raised in protest. No one likes paying more tax, even, or perhaps particularly, those who can afford it the most. But before they complain too bitterly, I'd like to ask Canada's 1%, Canada's 0.1%, to consider this. What kind of country do you want to live in? Do you want to live in a country where you can tell the size of someone's paycheck by their smile? Do you want to live in a country where kids go to school hungry? Do you want to live in a country where a teenage girl gets pregnant because she doesn't have the money to buy birth control? Do you want to live in a country where the only young Canadians who can buy their own homes are those with parents who can help with the down payment? Do you want to live in a country where we make the investments we need in healthcare, in housing, in old age pensions, but we lack the political will to pay for them and choose instead to pass a ballooning debt on to our children? Do you want to live in a country where those at the very top live lives of luxury, but must do so in gated communities behind ever higher fences, using private health care and private planes, because the public sphere is so degraded and the wrath of the vast majority of their less privileged compatriots burns so hot? Every one of us here in this chamber today, and every Canadian across our truly great country, needs to ask themselves these same questions, because the stakes could not be higher. Democracy is not inevitable. It has succeeded and succeeds because it has delivered a good life for the middle class. When liberal democracy fails to deliver on that most fundamental social contract, we should not be surprised if the middle class loses faith in democracy itself. Tax policy is not only, or chiefly, the province of accountants or economists. It belongs to all of us, because it is how we decide what kind of a country we want to live in and what kind of a country we want to build. Today, our government is making our choice. C'est le chemin que nous...
This is the path we must follow, Mr. Speaker. This is our plan to renew the promise of Canada. There are some in this chamber, particularly across the aisle, who do not share our vision. They would cut programs that we have put in place to improve the lives of all Canadians. Nevertheless, our government, in their opinion, should just do a little and then less, and ultimately, in their view, do as little as possible or even nothing at all.
They ripped up early learning and childcare. And as housing minister, the current leader of the opposition only got a handful of homes constructed. It was our prime minister, not a conservative, who actually got a pipeline built. And you know why that is, Mr. Speaker? That is because our government understands that to do big things in Canada, sometimes the government needs to lead the charge, whether it is getting more homes built faster or finally creating a national system of early learning and childcare, or bending the curve on emissions. Let's be honest about what austerity and shrinking the state would mean for Canadians. It means you're on your own. It means no one will give you a hand when you falter, and that you are choosing to turn your back on the friend or neighbor who has not been as lucky as you. That is not the Canadian way. In this country, we take care of each other. Mr. Speaker, to make a positive difference in people's lives, to get big things built, to get big things done, you need more than a slogan, more than a rhyme or two. You can't hop on pop your way to a better country. To make a difference in people's lives, you need a plan. Canada needs action, not indifference. We are acting. The times call for building up our country, not sitting on the sidelines. We are building. Today, we say to our younger generation and to those who care about them, we are putting all the power of government to work for you. We will build more homes. We will make life cost less. We will grow our economy in a way that works for everyone. Together, we will unlock the door to the middle class for more Canadians and renew the promise of our great country. Thank you, Mr. Speaker.
Questions et commentaires de l'honorable chef de l'opposition.
The Honourable Leader of the Opposition. This is the 9th deficitary budget since the Prime Minister promised that the books would balance themselves, and everything he's spending on has gotten worse. He promised that the deficits would make housing affordable, but it ended up doubling the cost of rent and mortgage payments and down payments to buy a house. He said that the cost of food would be more affordable, and now it costs 30% more, and 1 in 4 children aren't able to get nutritious meals. After 9 deficits, Mr. Speaker, the government is rich and the people are poor. And today, they're doing the same thing over again with $40 billion worth of inflationary deficit. That means $2,400 for each family in inflation and spending, and increase to the national debt instead of health. And that's why the Conservatives have a common sense plan to put an end to this pyro Prime Minister who's adding fuel to the flames.
9th deficit. The 9th deficit after the Prime Minister promised the budget would balance itself. And what did he do with the money? Everything he spent on has become more expensive. He's doubled the rent, doubled mortgage payments, doubled the needed down payment for a home, forced 35 homeless encampments in Halifax alone. 1 in 4 kids cannot afford food. And now he's adding $40 billion of new debt and new spending. That's $2,400 of new inflation. That is why Conservatives will vote against this wasteful inflationary budget that is like a pyromaniac spraying gas on the inflationary fire that he lit. It is getting too hot and too expensive for Canadians, and that's why we need a carbon tax election to replace him with a common sense Conservative government. Thank you.
The Honourable Deputy Prime Minister and Minister of Finance.
Much, Mr. Speaker. Mr. Speaker, I have a point that I think it would be good to get the Leader of the Opposition to offer clarity on. We presented a clear choice to Canadians. We said to Canadians, we believe that we need the power of government to get things built for young Canadians, to get things built for the people of Alberta who needed the pipeline that we got built. And we presented a clear, fiscally responsible way to finance those essential investments, increasing the inclusion rate on capital gains. I think that it is high time for the opposition, which poses as being on the side of working people, to clarify its position today. Will the opposition join us in asking those at the very top to pay a little bit more to support Canadians? Or are they going to show their true colors and stand with the 0.1%? That's what Canadians want to know today, Mr. Speaker.
The Honourable Member for Mirabel. Mr. Speaker, the Minister just tabled a budget which is centralizing, and it interferes with Quebec jurisdiction. New encroachments in education, municipal zoning, new strings attached to housing, conditions on childcare, new interference with property taxes. Does the minister realize that these intrusions that use the federal spending power, that this is just a demonstration of the fiscal imbalance which prevents the National Assembly of Quebec from freely acting within its own areas of jurisdiction? The Honourable Deputy Prime Minister and Minister of Finance. Mr. Speaker, I'm so happy that my colleague has raised the issue of childcare, because I think that one issue clearly demonstrates the close cooperation between the federal government and Quebec. Childcare was an idea that began in Quebec under Quebec feminists, and congratulations to those women, and thank you for that. When we decided, we took the initiative to create a national system, a national childcare, early learning and childcare system. At the same time, we struck a deal with Quebec to support Quebec and to enable Quebec to go even further. And that is what we will continue to do. Yesterday, I spoke to the Quebec minister to discuss budget initiatives, and we have very close cooperation with the government of Quebec, and we will continue to work very closely with them. Thank you.
Member from Vancouver, Kingsway.
Mr. Speaker, New Democrats know Canadians are facing a serious economic and climate crisis. Millions of people are struggling to make ends meet and are worried about their children's future. That's why we've used our seats in this House to successfully press for meaningful relief and progress in this budget in numerous areas, including to build more homes, preserve existing affordable housing, and protect renters, to deliver universal public pharmacare, starting with contraception and diabetes medications and devices, establish a national school nutrition program, reverse damaging cuts to Indigenous services, and help workers transition to a sustainable economy. But despite record corporate profits across many sectors, from food conglomerates to oil and gas multinationals, there is nothing to ensure the corporate sector pays its fair share so we can better fund the services Canadians need. Can the minister explain why she declined to raise corporate tax rates in Canada, despite them being among the lowest in the OECD, despite the U.S. doing so, and in the face of record prices and profits? Was the lobbying that effective?
The Honourable Deputy Prime Minister and Minister of Finance.
Mr. Speaker, I I want to start by congratulating the member for Vancouver Kingsway on his new role as finance critic. And I'm going to share with this House that he and I both grew up in Edmonton and first met when I was a teenager because he was working on my mother's election campaign. Life is funny that way. I, therefore, agree with the member from Vancouver Kingsway on so many things and have for so many years. But I have to say, on this specific issue, we're going to have to agree to differ. We believe in a fiscally responsible policy, and we believe that when we make investments, we need to finance them. We also believe in fairness, and we believe a fair tax system is essential to build a fair country and to deliver fairness, particularly for young Canadians. It's also really important for us to ensure that Canada continues to be internationally competitive, to ensure that Canada continues to be an attractive investment destination for foreign investors and for Canadian investors. It was with that in mind that we were very thoughtful about the revenue-raising methods that we chose.
Yep.
We have time for a very brief question from the member from Calgary, Forest Lawn.
Conservatives told this Liberal NDP Prime Minister to stop his spending, his deficits, inflation, and his tax hikes. But this Prime Minister blew right through that stop sign, dumping $40 billion of fuel on the inflationary fire that he started. This photo op budget is going to do nothing for average Canadians who can't afford a home and groceries today. Will the Finance Minister tell us how much each Canadian household is on the hook for the $54 billion of just interest charges on this Prime Minister's debt?
An equally brief answer from the Minister of Finance and Deputy Prime Minister.
Let me just share then with the member opposite the good news that we got today, which is that inflation for March was 2.9%. For 3 months in a row, inflation in Canada has been within the Bank of Canada's target range. Thanks to Canadians, that is very good news for our country.
Reprise de débat, resuming the Honourable Leader of the Opposition.
Pour une neuvième fois.
For the 9th time, the Prime Minister has promised that if he spends more and taxes more, Canadians would be better off. For the 9th time, we see that the quality of living, especially for the famous middle class, has actually gone down with a doubling of the cost of housing. And after big government programs for housing were started, 1 in 4 children aren't getting enough food to eat, according to the government itself. After the creation of programs for affordable food. And now he's talking about a pipeline paid for by government as if that was the biggest accomplishment you could ever have in a society. And if the government were not to have intervened, this never would have happened. This project is 500% over cost, and the money to pay for that has gone to Texas, another example of massive waste. And that is why Conservatives, with their common sense plan, will be voting against this budget and will be voting in favor of a carbon tax election, which will allow Canadians to choose a party that will cut taxes, build housing, fix budgets, and stop crime. That's our common sense.
And a 9th consecutive deficit, with the budget still not balancing itself. And everything on which the Prime Minister spends gets worse and more costly. He has spent and Canadians are broke. The country is broken. We have a doubling of housing costs. We have 8,000 people joining a Facebook group to study how they can get a meal out of a garbage can after food prices have gone up faster than at any time in a generation because of the carbon tax he's imposing on our food, a carbon tax that with the help of the NDP, he plans to quadruple to 61 cents a litre. And today, did he learn anything from these catastrophic failures? No. He doubles down on the same failure with $40 billion of new deficits, $40 billion of new spending. That's to say $2,400 for every family in new debt and new inflationary spending. And now, for the first time in a generation, we're spending more on debt interest than on health care. That's money for bankers and bondholders rather than doctors and nurses.
Right.
And the great example of how wonderful government can be, given after a tremendous theatrical pause, was the government's purchase of the Trans Mountain Pipeline. What would have happened if the government had just gotten out of the way? Asked the finance minister. The answer is the thing would have got built with private money rather than $30 billion of taxpayer bailouts.
That's right.
In fact, a project the Prime Minister said would cost $5 billion is up to $30 billion. Wow. Mr. Speaker, that is 500% over budget. It is $2,000 in costs for every single Canadian family for a project the private sector was going to be building on its own, and the company that was going to build it bought out, taking the money to Texas, where they're building Texan pipelines with Canadian dollars. All of our X's are in Texas, Mr. Speaker. And then, to close it off, we got some of the most hair-raising ideological fervor from the minister, who says that what Canadians really need is a stronger government. Well, they have created a stronger government in order to make for weaker and more suffering people. This is not a government that gives people everything they want. It's a government that takes everything they have. But the good news, Mr. Speaker, is we want big Canadian citizens with a smaller and more efficient government where the state is servant and not master, where our priorities are clear: to axe the tax, build the homes, fix the budget, and stop the crime. And as soon as the NDP takes away its support from this Prime Minister, we will have a carbon tax election where the people will be able to make that decision for themselves in a country where they can earn powerful paychecks that buy affordable food, gas, and homes in safe neighborhoods. The country that we all knew and still love, a country based on the common sense of the common people, united for our common home. Your home, my home, our home. Let's bring it home. And I now move, seconded by the member for Forest Long, that the debate now be adjourned.
Okay. Mr. Poilievre, seconded by Mr. Halland, moves that the debate now be adjourned. Mr. Poilievre, appuyez.
Mr. Poilievre, seconded by Mr. Halland, moves that the debate be now adjourned. Pursuant to Standing Order 83-2, the motion is deemed adopted and the House stands adjourned until tomorrow at 2 p.m. pursuant to Standing Order 24-1.
Heglema. Pursuant to Standing Order 83-2, the motion is deemed adopted and the House stands adjourned until tomorrow at 2 p.m. pursuant to Standing Order 24-1.